Good evening, everyone. Welcome to the Patheya National Seminar. I would like to invite our paper presentation coordinator, Dr. Aishwarya Aras, for the introduction. Hello, Dr. Aishwarya Aras. Hello, Dr. Aishwarya.
Hello, am I audible?
Yes, Doctor. Audible, Doctor.
Thank you, Dr. Sabin. So, hello and good evening, all. On behalf of Team Samiksha, I welcome everyone to the Patheya National Seminar with paper and poster presentation. It's my honor to welcome our respected panel members. And first of all, I would like to invite Agada panel, Dr. Ashwati S., Dr. Jayaprasad, and Dr. Shalini. And I invite Panchakarma panel, Dr. Mohan Kumar, Dr. Anjana Mishra, and Dr. Mahesh Raj. Now I invite Dravyaguna panel, Dr. Vikas Sharma, Dr. Sridevi, and Dr. Shija. Let me invite our Kaumara Vrithya panel, Dr. Pankaj Verma, Dr. Ramya, and Dr. Ansiba. I invite Samhita panel, Dr. Veena Vijayan, Dr. Rashmi, and Dr. Krishna Priyasi. Now I invite our Nidana Tantra panel, Adarsh Arora, Dr. Nitya R, and Dr. Arya K. Now I would like to invite our Prasuti Tantra panel, Dr. Supriya, Dr. Kavita, and Dr. Ashwani. Next, I would like to invite our Swasthavrita panel, Dr. Vandana Sharma, Dr. Shilpa, and Dr. Kirti. Now I invite our Kajilsa panel, Dr. Nitesh Pandey, Dr. Vinita S, and Dr. Surya Chetak. Next, I invite Manasika panel, Dr. Nitin Darade and Dr. Uma Jadhav. Now, I would like to invite Shailendra panel, Dr. Sandeep Pandey, Dr. Ravinder Singh, and Dr. Vaishnav. I invite December Shija panel, Dr. Arunlal K and Dr. Preeti. Next, I invite Shalakya Tantra panel, Dr. Akanksha Keshri, Dr. Devika Pradap, and Dr. Sriril. Now I invite our physiology panel, Dr. Kiran Kumar and Dr. Ramya. And finally, I invite our anatomy panel, Dr. Ramya Bhushan and Dr. Divya Prabhaji. First of all, thank you all for joining with us. And now we can start. I hope all the participants are present here. And dear participants, your allotted time for the presentation is 8 minutes. So kindly do follow the time period. And the webinar is streaming live on YouTube. And the copy will be saved in the broadcast website. So don't unmute unnecessarily. Now we can start with our first presenter.
I would like to invite Dr. Umesh Zade for the paper presentation. Hello, Dr. Umesh Zade. Hello, Dr. Umesh. Please unmute, Doctor.
Hello.
Yes, Doctor.
Am
You
I
are audible,
audible?
Doctor. Audible, Doctor. Audible. Your screen is visible, doctor. Please start.
Okay. Hello. Good evening, everyone. Myself, Dr. Umesh Zade, second year PG student from GSC Nagpur. Today, I am going to present diagnostic methodology of diseases in Ayurveda. So, what is the study about? Ayurveda is traditional medicine in science. Diagnosis of disease depend upon etiological factor of diseases. In Ayurveda, there are many techniques which are used for diagnosis of diseases such as Trivid Pariksha, Nidan Panchak, Ashtavid Pariksha, Dashvid Pariksha. Objective. Trivid Pariksha includes Darshan Pariksha, Sparshan Pariksha, and Prashna Pariksha. Nidan Panchak include Hetu, Purvarup, Roop, Upashay, and Samprapti. Ashtavid Pariksha, Nadi, Mala, Mutra, Jiva, Shabda, Sparsha, Druka, and Akruti. Dashvid Pariksha includes Karan, Karan, Karya, Karyayoni, Karyafal, Anubandha, Desh, Kal, Pravruti, and Upaya. Materials used for study. Review of literature was done by using available Samhitas in Ayurveda study. Online articles present on various sites. Book published in relating to this topic. Trivid Pariksha include Darshan. As we know, Darshan Pariksha, inspection, Sparshan is like palpation, and Prashna Pariksha. Nidan Panchak, Hetu, Purvarup, Rup, Upshay, and Samprapti. There are various types of Hetu like Prakrut Hetu, Vikrut Hetu. Purvarup are like Sharir Purvarup, Manas Purvarup, Vishesh Purvarup. Science means Rup, Samanyas, Doshas, Avasthanurup, Rup. Upashay. There are 18 types of Upshaya and Anupshayas like Viprit or Vipritarthakari. Samprapti is a Sankhya Samprapti, Pradhanya Samprapti, Vidhi, Vikalpa, Bala, Kal, etc. Ashtavid Pariksha include Nadi, Mala, Mutra, Jiva, Shabda, Sparsha, Druk, and Akruti. दशविध परीक्षा में आता है कारण, करण, कार्य, कार्ययोनि, कार्यफल, अनुबंध, देश, काल, प्रवृत्ति, उपाय. Conclusion. There are the main important diagnostic tool in Ayurveda. That's why Roga Pariksha is given first place and principle of treatment with drugs are given next place in order of importance. Thank you.
Thank you, Dr. Umesh.
Thank you.
Next, I invite Dr. Janavva for the paper presentation. Hello, Dr. Janavva, are you there?
Yes, sir. Sir, can
Okay,
you see
doctor.
my PPT?
Okay, doctor. 1 second, doctor. Please start the session, doctor. Is the screen is visible, doctor?
Yes, sir. Good afternoon, everyone. Myself, Dr.Janavva Sevana, second year PG scholar from the Department of Sharlatantra, AMC Modbidri. Today's my presentation topic is Ashtaveda Shastra Karma with special reference to Sivana Karma. Introduction. Acharya Shrestha has mentioned Ashtaveda Shastra Karma with a great importance. Acharya has described 8 surgical procedures with its indications. These surgical procedures explained in the Shrestha Samhita forms the basis for the surgery. These are being implemented in a various forms in a modern surgery even today. Ashtaveda Shastra Karma includes Chedana, Bhedana, Lekana, Vedana, Ishana, Aharana, Visravana, and Sivana. To learn, next slide. To learn Ashtaveda Shastra Karma on the suitable or easily available objects, one present chapter is explained by Acharya Shrestha, that is Yoga Sutri Adhyaya. A student, after studying the science, has a good knowledge of the management principles, but before he can start practicing, he should make a yoga. He should be trained on the patient or the models for all these karmas. In spite of theoretical knowledge, lack of hands-on practical training makes the student unfit for the medical profession. For this hands-on training, Shushta had invented various models. Among these 8 karmas, Shivana karma is the suturing technique, which is a final step in every surgery. Here I am making an attempt to review the principle mentioned for the Shivana karma in the Shushta Samhita and to execute these ideas in the current practice. Ashtavya Shastra karma. Chedana, Bhedana, Lekana, Vedana, Eshana, Aharana, Visravana, and Sevana. These surgical procedures is carried out with the help of Suchi is called Sevana karma. Indication for Sevana karma are Sivya, Medha, Samuttasha, Bhinnaha, Sulikitaha, Gadaha, Sadhyoranascha, Echaiva, Chalasandhi, Vapashitaha. A disease arising from the vitiation of the Medha Dhatu, Bhinnarana, Sadhyorana, and the wound over the movable joints. Contraindication. Next slide. न क्षाराग्नि विसदृष्टे न च मारुतवाहिनः अन्तर्लोहितशल्यश्च तेषु सम्यक् विशोधनं पांशुरोमनकादीनि शलास्ति भवेत् च यत्. The wound caused by the kshara, agni, visha, those which emits the gas from inside, antarlohita shalya are contraindicated. When there is the presence of pamshu, roma, naka, bone which are present and moving inside the wound, these will cause the pus formation in the wound and give rise to many kind of pain. Sivana dravya. Two types, Sivana Sutra and Sivana Suchi. Sivana Sutra bind and hold the tissue together till wound get healed. Materials used are the Sukshma Sutra, Pashmantaka Valkara, Shanaja Sutra, Snayu, Bala, Murva, and Guruchi. Sivana Suchi. The next Sivana Suchi. Sivana Suchi is a sharp instrument which pierces the tissue and aid in suturing. These are 3 types, Rutta, Ayata, and Dhanarokra. First one is Rutta, round body needle. It is 2 angular long and for Alpa Mamsa Desha it is used. Ayata, straight cutting needle, Suchi with the 3 edges and 3 angular long. Dhanarokra is a curved needle, curved like a bow, is 1.5 angular in length, and for Marma and Palakosha Udara suturing it is used. Next. Suchi is a Tiksnagra Susamahita and its end should be Malati Pushpa Ruttagra Parimandal. Procedure. Purva karma for the Sivana karma. If wound is contaminated with any pamshu, roma, naka should be removed. Samyak Vishodhana of the rona has to be done. Pradhana karma, wound edges are elevated. Sivana is done using the Sivana dravya and Suchi. Paschat karma, after proper suturing on suturing site, Churna of Priyangu, Anjana, Yasti, Lodra, Shallaki Pala applied and covered with the Kshoma Pichu and Bandhana done. Types of Sivana karma. There are 4 types: Vallitaka, Govanika, Tumasivani, and Ritucharya. First one is Vallitaka. It is continuous step. It resembles like a creeper. This is achieved by suturing the continuously along the length of the wound, wrapping the wound edge inside it. Second is Govanika. It is a vertical mattress or blanket type suturing. The wound which are shaped as a footprint of the cow, they are sutured with this type suturing. Tunasivani, subpeticula type, it is done as like as torn up garments are sutured. Sirajagranthi, simple interrupted type. This type of section thread is inserted from 2 edges of the wound and knot is tied. Conclusion. The Ashtaveda Shastra Karma mentioned by the Sushita are equally applied even today with required modification to manage the disease which requires surgery. Sivana Karma is the suturing technique which is final step in every surgery. Wound heals by primary intention which is closed by suturing. Yogya Sutri Adhyaya is an important part of the Sushita Samhita because new practitioner can develop their surgical skill in a proper manner. These ideas can be executed in the current teaching methodology for obtaining the highest rate of success. Thank you.
Thank you, Doctor. It was a well explained presentation. So next I would like to invite Dr. Greeshma for the paper presentation. I invite Dr. Greeshma. Yes, you are audible, Doctor. Okay, sorry. So, Doctor, please share your screen.
Hello, ma'am.
Hello, Doctor.
Hello, Doctor.
Sir, my poster presentation.
Okay, doctor. I know, doctor.
Doctor, you are ready to present now?
Yes, ma'am.
Okay, doctor.
Should I present now or after the poster?
After the process, doctor.
Doctor,
We will call
please
you
be
next.
there. You can present later.
Okay.
Doctor, please start, doctor.
Yes, thank you, sir. Sirajagranthi. Introduction. The priceless value of the leg is not appreciated until the loss of function threatens the day-to-day activity of a person. In the present era, lifestyle and the working pattern of the person is showing variety of diseases, among which varicose vein, that is Sirajagranthi, is the one commonest disease in a surgical practice. It occurs more in the people who are habitual to standing for a longer duration. Definition. Sira is a Saranat Sira. Granthi is a formation of knot-like structure. Acharya Shushruta and Acharya Vagbhata has explained the Nidhanas for the Sirajagranthi. First one is Abanasya Vayama Jayate. That means person who is weak and emaciated and who does the excessive exercise. Second is Patatya Sasamba Avaganat. Acharya Vagbhata has explained that who is suddenly immerses the lower lip in a cold water after walking a long distance. Third one is a Vayama Pratanatasya. Acharya Vagbhata has told that one who does the excessive exercise, who is more prone to get the Sirajagranthi. Samprapti, Nidhana Sevana leads to Vata Prakopa, and Prakupita Vata does settle in the Sirapratana by Akshepa and exposes them to Sampedana, Sankochana and Vishoshana. Produces the Rutta and Unnata Granthi, which is protruding out, forms the Sirajagranthi. Lakshanas. Acharya Shuta has told that it is Rutta, round shape, and Unnata Granthi. And Vagbhata has told that Nispurana, non-pulsatile, Nirujagranthi, pendulous, and Sira Vaikrikriti, it is torsicity. Sadhya Sadhya, Acharya Shuta has explained that one which is painful and movable, it is Kritya Sadhya, painless, immovable, and lately enlarged and situated in Marmasthana, it is Asadhya. Acharya Vagbhata and Shushta both have explained the treatment modalities for Sirajagranthi. Acharya Vagbhata has told that internal administration of Sahacharadi Taila, Basti Karma, Rakta Mokshan, and Upanaha with Vatara drugs. Acharya Shushta has mentioned the same treatment modality and he has mentioned extra as Mardana and Alepana. Discussion. Acharya Shushita, removing the large amount of the stagnant vitiated blood reduces the intravascular pressure and volume and hence relieves the shula and shota. Since the stagnant blood is drained out, the breaking of the RBCs get reduced, which in turn reduces the pigmentation and itching over the part. Jalakocharana removes the starch of the blood and improves the microcirculation. Conclusion. Varicose veins are the penalty for the verticality against the gravity. About 5% of the adult population is affected by the varicose vein in India. By avoiding the prolonged standing and by doing certain exercises, we can prevent the varicose vein. Various Ayurvedic modality like the Jalakocharana and Siraveda are the simple, economic, time-saving procedures and having the miraculous effect on the varicose veins. Thank you.
Thank you, doctor. Now I invite Dr. Greeshma.
Hello, Dr. Greeshma.
Is my screen visible?
Yes, doctor. Now visible, doctor.
Okay. So today I'm going to deal about Nighantus, the introduction of Nighantus. So I'll be completing introduction, importance of Nighantu and list of Nighantus in chronological order and conclusion. So to come to the introduction part, according to P.V. Sharma, there are two distinct patterns of Nighantu which explains one only the synonyms and the other one which describes synonyms as well as its properties. For only synonyms, the example are Ashtanga Nighantu, Paryaya Ratnamala and etc. For which describe synonyms as well as properties, there are Dhanvantari Nighantu, Shodala Nighantu, etc. So introduction is what is Nighantu means, the one which tells the hidden meaning and understanding of any word or dravya, that is Nighantu. So why Nighantu is important to know. So a Vaidya who doesn't read the Nighantu is similar to the scholar who doesn't know the Vyakarana, or the warrior who doesn't know the knowledge of Ayuda or Shastra. So both are undervalued. So the importance of Nighantu is that it is very important to understand the important properties of all the Samhitas. Then how, on the basis of identification of plants, there are different techniques that is used in Nighantus. One is like the distribution of plants as per area, as well as a peculiar character. For example, Lajjalo is explained, and with the resemblance of different plants with animals and birds, and the uses of fruits and seeds appropriate to its standard of weighing, and protuberance seen in plants, for example, Shamali, and with the help of the ridges of the fruits or leaves, like Haritaki and Shatavari are named, and counting the number of leaves or the typical characteristics of leaves or the color of the seeds, and with floral appearances, for example, Dataki Pushpa, the typical shape of the fruits and the size and shape of stem, and the milky juice or latex, for example, Panchavalkala are named likewise, and typical aromatic plants and thorns seen on plants in the habitat. As per this, it has been named. And if we consider the period, one is the ancient period where Vedic Nighantu and Saushrita Nighantu and Rasa Vaisheshika comes. So these are the other medieval period where the Nighantus come. Like for example, the important one are Ashtanga Nighantu, Dravya Gunakara, Dravya Guna Sangraha, Dhanvantari Nighantu, Nimi Nighantu, Indu Nighantu. These can be considered in medieval period from 8th to 15th century. And the modern period that comes after the 16th AD, the important Nighantus are Bhava Prakasha Nighantu, Ayurveda Saukyam, Dravya Guna Shataka, and Chudamani Nighantu, Dravya Ratnavali. We can consider these. There are many such Nighantus. In Vedic Nighantu, the literature goes way back. From Rigveda to Atharva Veda, we see the number of plants that has been explained from Rigveda to Atharva Veda. It has been increased day by, it has been increased in number. So many Ayurvedic plants have been explained even in the Vedic Nighantus. And in Saurashtra Nighantu, the P.V. Sharma sir has explained that at the end of every Samhita, there should be a Nighantu that has been explained. So on this basis, there is Sir Shri Hemaraj Sharma, the Rajaguru of Nepal, claims that he has possessed a manuscript of Sushruta Samhita, which has happened with a Nighantu, appended with a Nighantu, and this portion had a name as Saushrutam, that is Sushrita Nighantu, which can be compared with Sushruta Samhita. So what and all it has, the Nighantu, what all is been explained is Dravya Swarupa, Pushpa Swarupa, as well as Rasa Sambandha Pavyayas. These are the main things that has been explained in every Nighantus. So the difference of Sushruta Samhita and Saushrita Nighantu, if we see, in Sushruta Samhita there are 37 ganas explained, and in Saushrita Nighantu there are only 35 ganas have been explained. And not only about that, the Punarnava, the Kadara, the Shigru. In Punarnava, the 2 types of Punarnava has been explained in Saushrita Nighantu, whereas only 1 type of Punarnava has been explained in Sushrita Samhita. Likewise, we can see many differences between Sushrita Samhita as well as Saushrita Nighantu. So both are not similar, but it is related, like Saushrita Nighantu has been appended to be explained in the end of the Sushrita Samhita. Then coming to the other important Nighantus like Ashtanga Nighantu, Acharya Vahata has explained the maximum number of group of drugs on this basis of Ashtanga Sangra and Ashtanga Hridaya. So he has explained like 26 ganas of Vagpata in this Ashtanga Nighantu. And in Paryaya Ratnamala, the author is Madhava, briefly known as Ratnamala. And as its name implies, this work is a synonymous medical lexicon of Nighantus in its broadest sense. And if we go to Siddhasara Nighantu, author is Ravi Gupta, therefore known as Siddhasara of Ravi Gupta itself. And Dhanvantari Nighantu, the original name of the book appears to be Dravyavali Samuchaya. And initially the Nighantus were containing only the synonyms which communicated the prevalent names, morphological characters, properties, action of the drugs, habitat, and other relevant information. Later on, properties, action of the drugs, habitat, and other relevant information were added. Later on, properties, total there are 7 groups under which the plants are described. Total drug groups are claimed to be 373. The total, there are 7 groups in this. One is Guduchyadi, Shatapushpadi, Chandanadi, Karaviradi, Amradi, Suvarnadi and Mishrakadi Vargas. In Shodala Nigantu, which is also known as Guna Sangraha or Nama Sangraha, this text describes the properties of drug with their Rasa, Virya, Vipaka, etc. And explanation is not too detailed or too concise style, so that the same may be easily understood. Between Ashtanga Sangraha and Ashtanga Hridaya, he preferred the later treatise because of its concise style. And these are the Vargas that has been explained in it. And if we come to Madanapala Nigantu, which was written by King Madanapala of Tika dynasty, this book is also known as Madana Vinoda. The total number of dravyas described are 490, in which 450 vegetables have been mentioned and 44 metallic and other drugs have been explained. So these are the different Vargas has been explained. And when we come to Raja Nigantu, this is also known as Abhidhana Chodamani and Nigantu Raja. Author is Narahari. The author claims that this book is compiled after consulting works like Dhanvantari Nigantu, Madanapala Nigantu, and Halayuddha Nigantu, Vishwa Prakasha Nigantu, Amarakosha Nigantu, and Baijaraja Kosha. Dravyaguna importance as per Nigantus are like Raja Nigantu is this explains 7 factors, mainly Rudi, Prabhava, Desha Yokti, Lanchana, Upama, Virya, and Itaravya. Then coming for Kayadeva Nigantu, which is known as Pathya Vibodhini. Author is Kayadeva. It is the author has given importance for maintaining normal health and to prevent from disease. In this way, he puts forth principles of Ayurveda in his work. On this basis, he has planned his work as Aushadha Dravya, Anna Dravya, and Vihara Dravya. In this 9 important Vargas have been explained, grouping the Dravyas as per Vakpata: Aushadha Varga, Dhatu Varga, Dhanya Varga, Dravya Varga, Kritana Varga, Mamsa Varga, Vihara Varga, Mishraka Varga, and Nanartha Varga. And coming to Bhava Prakasha Nigantu, which comes in a medieval period, author is Bhava Mishra. He explains 5 types of Swarna and 3 kinds of Rajata and classified into 23 Vargas and has mentioned 426 Dravyas. And Raja Vallabha Nigantu, only written by, originally written by Raja Vallabha Vaidya and later redacted by Narayana Dasa in 1760. He has classified into 6 chapters, which have been mentioned here. And coming to Shiva Kosha, author is Shivadatta Mishra, composed 540 verses. And Shaligrama Nigantu, the text is being considered as the last in the series of classical Nigantu, written by Lala Shaligrama Vaidya. Text is divided into 2 parts, Purvartha and Uttarartha. First part has 23 Vargas and second part has 2 Vargas, Anupadi and Mishraka. Then Haritakyadi Nigantu, Vaidyalankara Shiva Sharma, he is the author, and he has included Dravya Pariksha Varga, which is not found in Bhava Prakasha Nigantu, has explained 24 Vargas in it. And these are the other Nigantu Vargas which have just quoted below. And comes Priya Nigantu, which has been written by P.V. Sharma sir. According to his literature studies on the subject of Dravyaguna, the synonyms of the drug many times leads to difference of opinion about the drugs and thereby controversies in accepting a Dravyas comes. So the author removed the same synonyms and put single meaning synonyms to the drugs. He has explained 13 Vargas. These are the 13 Vargas P.V. Sharma sir has explained. So the conclusion is, by the above discussion, it reveals that Nigantu covers the entire Dravyaguna Vijnana with clinical application of drugs. Also, due to various synonyms, it leads to confusion of Dravyas among scholars. So it would be very interesting to study the different medicinal plants from the Vedic period to the period of Ayurvedic Nigantus to the present era. This might throw a good deal of light on the general chronology of different texts and may also help in the study of development of knowledge of medicinal plants in ancient India. Thank you.
Thank you, Dr. Greeshma, for this excellent presentation. Next, we have a poster presentation, and I invite Dr. Indu for the presentation. I invite Dr. Indu.
Yes, doctor.
Good evening, doctor. Doctor, please
Good
start.
evening. Slide is visible.
Yes, doctor. Visible, doctor.
Good evening, all. Welcome to the presentation. I am Dr. Indu.P.V, first year PG scholar, Department of Agatandra, VPC Ayurveda College, Kottakkal. The topic of the presentation is Vilwadi Agada. Vilwadi Agada is most popular preparation of choice in acute toxic conditions. It can be used both internally and externally. Majority of drugs are Tikta Kadurasa Pradhana, so it acts as Kavavadahara. And Vilwadi Guliga is a proven drug in conditions like Vishujika. And the references are in Ashtanghrida Uttarasthana, 36th chapter, and in Ashtanga Sangraha Uttarasthana, 42nd chapter, and Kriya Kaumudi, Vishavaidya Jolsnika, and Prayoga Samchaya. These are some traditional Vishavaidya books and in Sahasra Yoga. And the ingredients are Vilwa, Surasa, Karanja, Nada, Surahua, Trubhala, Trikatu, Nisha, Daruharidra, and God's urine. And method of preparation is all drugs are taken in equal quantity and powdered and mixed well, bhavana with bastamutra, and in very fine consistency. And dose is no classical reference about dose, and we can divide given in divided doses and in 1 to 2 tablets per every 2 hours in emergency cases. And the indications are Sarpadamsha, Vishujika, Luda, Garavisha, Jwara, Unduruvisha, and Vrishchigavisha. And we can use as Anjana, Pana, Nasya, and Layabana. And the Rasapanchaga is Rasa is Kadu Tiktarasa, Guna is Lagu Ruksha, Virya is Ushna, and Vipaga is Kadu, and Tosha Shamana is Kabavada Shamana. Thank you.
Thank you, doctor. Doctor, you have poster presentation, right?
Yes, doctor. Can I present?
Sure, doctor.
Paper
Please present,
also?
doctor. Sure, doctor. Please, doctor. Please present, doctor.
Okay. Good afternoon, all. Welcome to the presentation. Today, I will be presenting on the topic Vilwadi Agada. I am Dr. Indu.P.V, first year PG scholar, Department of Agatandra, BPSC Ayurveda College, Kottakkal, Kerala. Vilwadi Agada is the first drug of choice in acute toxico-pathological conditions. It is a Nirvisha Agada, and the references are in Ashtanga Hridaya, Ashtanga Sangraha, Kriya Kaumudi, Vishavaidya Jolsnika, Prayoga Samchaya, and in Sahasra Yoga. Villasya Moolam, Surasasya Pushpam, Phalam Karanjasya Nadam, Surahum, Phalatrayam, Yoshanisha Dvayamcha, Bastasya Mutrena, Susukshma Bishtam, Bhujanga, Luda Unduru, Vrishchikadir, Vishujika Ajirna, Garajoresha, Arthan Naran, Bhuda Vidarshidamsha, Sosti Karoti, Anjana Pana Nasyehi. It is Upakalpana of Kalkakalpana, and it is palatable, easily applicable, and it has greater shelf life and is convenient for fixation of dose. And these are the drugs. And the method of preparation is all the drugs mentioned in the table are taken in equal quantity and powdered and mixed well, and bhavana with the bastamutra. So Sukshma Pishta means very fine consistency. In Sahasra Yogam, the duration of bhavana is mentioned as 6 yama, and in general practice, 3 to 4 hours per day for 6 days. And in a study conducted by Department of Agatandra, BPSC AVC, the grinding time is found as 120 hours. Moving to properties of Bastamutra, this categorized under Lavanavarga, and female mutra should be taken according to Bhavapragashya, and the properties are Rasa is Kadu Lavanatikta, and Guna is Ushna, Tikshna, Ruksha, Lagu, and Virya is Ushna, and Vipaga is Kadu, and Dosha Shamana is Kapha Shamana, Vada and Lomana, Pitta Avirodhi, Krimikna, Vishakna, and Shobhagna. Moving to dose, no classical reference for the dose for this formulation. In clinical practice, 1000 to 2000 mg per day has been found effective and safe, and we can given in divided doses, and in emergency case, 1 to 2 tab per every 2 hours. Moving to indication, we can use as internal and externally. Internally, Sarpadamsha, Ludavisha, Unduruvisha, Vrishchikavisha, Vishujika, Ajirna, Garavisha, Jwara, Bhada, and other conditions, and externally in Sarpa, Luda, Unduru, Vrishchiga as Layapana. Anubana is source of Tulasi leaves and according to the need. And we can use as Anjana, Pana, Nasya, and Layabana. And the different combined effect of Vilwadi Agada is Kadutiktarasa, Ushnavirya, Kaduvipaga, Laghuruksha Guna, and Kabavada Shamana in action. Moving to pharmacodynamics, Trigadu is an immunomodulator, and Kadurasa increases endorphin and is a serotonin modulator, and piperine extracted from Pippali and Marija is known to have antidepressant activity, and Pippali increases bioavailability, so enhances the absorption, and Vilwa, Surasa, Nata, Shundi, etc. is antidepressive activity. And majority of drugs are Tikta Kadurasa, so which act as Kabavadahara, and all drugs are Ushnavirya and Kaduvipaga, and Tagara and Tulasi directly counteract the action of Visha, and Kadutiktarasa has Kramigna property. Mode of action is anti-poisonous activity. Most of the drugs in the formulation having Vishashamana property and it effect on gastrointestinal system, and it's a proven drug in Vishuchika, and antimicrobial activity, Budakna property, and it's Yogavahi. The drug Pippali has having Yogavahi and antioxidant activity. Another two Vilwadi Agada is mentioned in our traditional Vishavaidya books, Cherry Vilwadi and Vishavilwadi. In Cherry Vilwadi contains 8 drugs, Vilwadi devoid of Nadam, Surahum, and Trubala. And in Vishavilwadi contain Vilwadi Yoga plus 3 other drugs, Nilini, Ishwari, and Pada. And these are few studies of Vilwadi Agada. Thank you. Thank you, organizers.
Thank you, doctor. So next I invite Dr. Indu K. Dr. Indu.
Hello, Dr. Indu. We can't hear your voice, doctor. Please reconnect your headset, doctor. There is a problem in your headset, doctor. Please reconnect, doctor.
Am I audible?
Yes, doctor. Audible, doctor. But some voice disturbance is there, doctor. Please reconnect your headset, doctor. Please reconnect properly or remove the headset, doctor. Hello, Dr. Indu.
Hello.
Some
Yeah.
voice disturbance are there, doctor. Okay, doctor. Please continue, doctor.
Can you please share me the slides?
Okay, doctor.
Okay.
Indu, please.
Hello. Can I? Hello.
Hello, doctor. Please start, doctor.
Okay. Good evening, all. Myself, Dr. Indu, first year PG scholar, Department of PG Studies in Swasthavrata, Sri Sri College of Ayurvedic Science and Research, Bangalore. Today, I am going to present on the topic a review on role of ritucharya in health promotion with special reference to hemantha. Introduction. The word ritucharya comprises of 2 words like ritu, denotes season, and charya means ritual. Ritushu ritunam va charya. Sushruta Sutrasthana, 6th chapter, 3rd shloka. Hence, ritucharya means adopting the activities which are to be performed and the activities which are to be avoided in various seasons. The basic principles followed in the Ayurvedic system of medicine is Swasthasya Swasthya Rakshana, which means to maintain the health of the healthy rather than the Adurasya Vikarya Prashamanam, means to cure the diseases of the deceased. For this purpose, ritucharya have been mentioned in the classes of Ayurveda. Now, the types and division. There are 6 numbers of Ritus. Shishira, Vasanta, Greeshma comprises Adana Kala, and Varsha, Sharant, and Hemantha comprises Vasanta Kala. So, in a year, there will be 2 ayanas, that is Uttarayana and Dakshinayana. Uttarayana will be called as Adana Kala, and Dakshinayana will be called as Visarga Kala. Here, the Shishira, Vasanta, and Greeshma comprises of Uttarayana, and Varsha, Sharat, and Hemantha comprises of Dakshinayana. So, according to this, the Bala will be in Shishira and Hemantha Ritu, there will be Uttama Bala, and Vasanta and Sharat Ritu, there will be Madhyama Bala, and Greeshma and Varsha Ritu, there will be Importance of Ritucharya. One who knows the suitable diet and regimen for every season and practices accordingly are enhancing the strength and destiny. The person who adheres to seasonal regimen in and out of the season does not become a victim of dreadful diseases post-virus. Dosha relation with the Ritu. Like Chaya Prakopa Prashama, Vayo Greeshma Dishu Trishu, Varshadishu tu Pitasya Shleshmana Shishradishu. Vada will be like Sanjaya will happen in Greeshma Ritu, and Prakopa will be in Varsha Ritu and Prashamana in Sharat Ritu. So Pitta, Sanjaya and Varsha Ritu, Prakopa in Sharat Ritu and Prashamana in Hemantha Ritu. So Kaba, Sanjaya and Shishira Ritu, Prakopa in Vasanta and Shamana in Greeshma Ritu. So after dosha shodhana in July, for dosha shodhana in Ritucharya, so the accumulated dosha of the whole season should be purified in Vasanta Ritu. Similarly, those accumulated in Greeshma Ritu should be eliminated during Varsha Ritu. Dosha accumulated in Varsha Ritu should be expelled from the body during Sharat Ritu. By this, one can avoid seasonal diseases. So now the relation between Agni Bala and so in Shishira, same as like mentioned with the Deha Bala. So Shishira and Hemantha Ritu will be having Krishnagni, Vasanta and Sharat Ritu will be having Madhyamagni, and Greeshma and Varsha Ritu having Mantha. Moving to Hemantha Ritu. Now we are under like Hemantha Ritu since the November, half of the November to January there will be Hemantha Ritu. During Hemantha, the Agni of human beings possessing food strength due to the restraint caused to body by the Shita Nila. So it is capable of digesting any foodstuff irrespective of its heaviness and quantity. In the absence of adequate fuel, the strong digestive fire covers the body's tissue. Night will be long as compared to day, so one feels hunger in the morning. Now it is rhetorical representation. Here the how it is the environment will be cold, clouds will be there, even sunlight also will be there, and how the body will be digestive fire increases and Kapha dosha also accumulates. Now Pathya Apathya is mentioned. I will later explain. So Pathya Ahara. Rasa will be Madura, Amla, and Lavana Rasa dominated food. Guna, Snigdha, Krishna Guna Ahara. Shalidanya, Shimbidanya, Mamsa Varga can be used. In Mamsa Varga, Audaka Mamsa, Anupa Mamsa, Vileshya Mamsa, Prasma Mamsa can be used. Madira, Sridu, Gorasakriti, Ikshamikriti, Masa, Taira, Navodana, Ushna Jala also can be used. Next slide. Next slide. Into Pathya Vihara, Abhyanga, Udvartana, Murtitaila, Jetaka Sweda, Ushna Bhumigraha Nivasa, Ushna Garbhagraha Nivasa, Anjana, Lebana with Kumkuma, Kasturi, Avagaha, cloth made up of Pravara, Kausheya, Pravedi, etc. can be used, and Vyavara. Pathya, Apatya Ahara and Vihara. Apatya Aharas are Vadavartaka and Lagu Annapanas, food of golden potency. But Viharas are Pravada Sevana and Divasa. On to discussion. The concept of Ritusandhi explained in Ritucharya illustrates the last week of previous season and the first week of approaching Ritu. Together 14 days is termed as Ritusandhi. Previous seasonal regimen must be discontinued by following Padamsha Abhyasa, and regimens of coming Ritu should be adapted gradually. This is because abrupt modification in the regimens might produce disease of the asadhya or incompetence. Therefore, to avoid the disease of seasonal changes, individuals should follow the charyas which are mentioned in Ritusandhi. This is the way the ancient sages set up the regimen for various seasons on analytical reasoning to obtain swastha and prevent the disease. Moving to conclusion. By following seasonal regimens appropriately without deviating from classics, the individual can stay healthy and blissfully. Further, one can prevent the disease concerned to the season. In addition, ritucharya will assist in treating diseases successfully since Patheya plays a significant role in curing disease. If person follows suitable ahara and vihara according to the one can cure the diseases effortlessly. Ritucharya as preventive medicine provides the way of health. Thank you.
Thank you, Dr. Indu. So next I invite Dr. Shamali Bhujbal for the paper presentation. I invite Dr. Shamali. Doctor,
Hello, Dr. Shamali. Can you hear me?
Doctor, you are not
Shamali,
audible.
we can't hear your voice, doctor. Hello, Dr. Shamali. Doctor, please reconnect your headset, doctor. We can't hear your voice, doctor. Hello, Dr. Shamali. Please reconnect your headset, doctor. We can't hear your voice, doctor. Please reconnect or remove your headset, doctor. Dr. Shamali Bhujbal. Dr. Shamali, we will call you next, doctor. Next, I invite Dr. Vikrant Arun Patil for the paper presentation. Dr. Vikrant Patil.
Hello.
Hello, doctor.
Am I
Please
audible,
share.
sir?
Audible, doctor. Please share the screen, doctor.
One sec. Do you have my PPT over there? Because I'm not getting it here. How to share the screen? Wait. I get it.
Okay, doctor. Okay. Okay, doctor. Screen is visible, doctor.
Okay, should I start?
Sure, doctor. Please start, doctor.
Good evening, all. Myself, the Vikrant Patil. I'm a PG scholar, Samhita Department, GSC Nanded. My topic for presentation is management of Dushta Vrana with Niruha Basti and Rakta Mokshan, which is a case study. In introductory slide, we will quickly go through the concept of Vrana. Vrana means Vranayati Gatram Iti or Vrana Anga Churane. We all know that there are two types of Vrana, that is Dvo Vrano Bhavati, Sharira Agantusha. This is the quote from Sushrut Samhita. And again, they are divided into Dushta and Shuddha Vrana. For the Chikitsa of Vrana, Sushruta Acharya has given Shashti Upakrama. Apatarpanam, Alepaha, Parisheko, Abhyanga, Svedo, Vimlapanam Adi, and ended with the Raksha Vidhana. This is the overview of Vrana from Grantha, or we can say that this is the review of literature. So now coming to the case, a male patient of age 54 years from a poor economical state, which I have mentioned as occupation praised and poor economical condition, having Pradhan Vedana as Dakshin Padatala evam Pradeshini Anguli Vrana since 5 days, Tat Pradeshi Shula, Shotha, evam Srava, which was Alpa, the Srava was Alpa, and Aushna at that particular Pradesh. Some other points which are not mentioned here are patient was not having any comorbidity, no history of any trauma, and patient was only willing to take Ayurvedic medication due to his previous ill experiences. Vartaman Vyadhi Vruttanta will see that Shotha, Shula and Vaivarna at Dakshin Pada was present, and Aushna, which will indicate the Paka or Dhatu Paka condition. And these all the symptoms were present since 5 days. In Pariksha, while doing Pariksha, we did it in both the ways, that is Rogi Pariksha and Roga Pariksha. While in Rogi Pariksha, Madhyam Kaya, Madhyam Bala, that is Sharirik Bala, and Uttam Sattva Bala. From this, we get overall view of his Sharir and Mana. In Rogi Pariksha, please refer the photos. I'll zoom it out for you. Dakshin Pada Pradeshi Vrana, that is, and we can get that Pada is Sthan of Vata, indicating the dosha predominancy in that particular region is Vata Dushti. And Srava was Tanu and Alpa. and Gandha was Visra, which are the Lakshana of Vataja Vrana. Vedana was present, and Vedana is a particular Lakshana of Vataja Dushti. Varna of Vrana was Shava and Aruna. By this, we can say that this particular Vrana was Nija Vata Dushta Vrana. Do note that this Vrana is Adhokaya Visheshtha. Locally, while doing dressing, Dushtatvak Nirharan was done. Their right index toe was not having any sensation and black in color as seen in previous slide. So we remove that toe too. Vrana Dhavana with Patola Nimba Kwatha was done. After that, Shodhan Tail was applied and Bandhan was done. In Upakrama, we particularly do Niruha Basti and Rakta Mokshan by Siraved. Bahyataha Dhupan and advised Purva Dishi Shayan. Abhyantaraha Trifaya Gogul 500 mg 2 times a day after food. Dashamula Patola Nimba 500 mg Churna 2 times a day before food in Apana Kala. In for Pathya condition, we advise to avoid Navadhanya, Divaswap, Ayas and Ratro Jagran. This is the quick overall view of Chikitsa. Now we'll see why we choose why Niruha Basti and Siraved only and why not Matra Basti and other types of Rakta Mokshana. So I have involved only photos and now I'm going to explain why we choose that particular things. Firstly, Niruha. There is a quote in Sushruta saying that Adhokaye Vata Dushtevrane Niruha Visheshitaha. So we get the direct reference in text. And as it was the sthan of Vata, that Apana Kshetra, Pada is sthan of Vata, and Basti is Shreshta Chikitsa of the same, we use the Basti. But why Niruha Basti? Presenting Vrana was a Nija Vrana, and Nija Vrana, while having a Nija Vrana in a particular patient, overall dosh in all the body gets vitiated, and then after having Khavaigunya, they produce Vrana. So Niruha has its effects on all over the body, and that for that particular sthan as a Vata predominant sthan, we wanted that Shodhana Guna of Niruha, and so we apply Niruha Basti. For ingredients of Niruha, we refer Vagbhat Sutrasthan 15. There is a shlok that Ete Varga Dosha Dushyadepeksha Kalkakvatha Sneha Lehadi Yuktaha. That is this Samana Pratyarabdha Dravya. We can use same medicines from particular Varga for any Upakram, that is Dhavan, Niruha, Abhyantartaha. And due to his poor economical condition and as per the availability of our medicines, we use Guduchadigan and Patoladigan. That Patoladigan is Patola Koturohini Chandana Madhusrava Guduchi Pathanvitam that contains Guduchi 2. And Guduchadigan is Guduchi Padmakarishta Dhanaka Rakta Chandanam because there is Daha and Aushna was present. While preparing Niruha, we have to add Snigdha, Taila or any Sneha, and we do add Nimbatel in it as it is Krumigna, Laghu, Grahi and Vranaropaka. So as per the demand, Sarva Shariragata Kriya, Evam Sthanik Kriya, we advise Niruha for that and not any other Basti, as it will lead to, if you apply some Sneha Basti over there, it will lead to Kledan of that Vrana और and बाद में वो वहाँ पे दुष्ट व्रण बन जाएगा. इसलिए we give Niruha Basti for 5 days straight and then weekly 2 days for entirely 4 months. Then come to Rakta Mokshan by Siraved. For Sarvadahik Shuddhi of Rakta, we have to do the Siraved from the nearby Sira. So we did the Siraved from the leg itself. Patient was presented with Aushnya, which is sign of Dhatu Paka. And as we know that we don't want to get that Dhatu Paka in progressing level while treating the Vrana. Rakta Mokshan prevents further Dhatu Paka and leads to the Rakta Shuddhi, which will lead to the Vrana Shuddhi. And after attending the Vrana Shuddhi, we replace the Shodhan Tail for local application to Jatyadi Ghruta. Jatyadi Ghruta references in Sushruta and also in Vagbhat Uttar Tantra 25th Adhyay, that is Jati Nimba Patola Tikta Kotoka Darvi Nisha Sariva. And for particular Lakshanik Chikitsa over that period was given when Chikitsa was given and wherever necessary. We got the best result after the 4 months. And I'll show you the results. These are the results. You can compare the previous photos and these photos for the best results we get. What is the takeaway message? That Sushruta's every verse, as I'm from the Samhita department, every verse from the Sushruta for Vrana Karma opens up a new horizon for management of Vrana. Basti and Rakta Mokshan are called as Ardha Chikitsa. So using them in a single case can be presumed to give faster results. Thank you. That's all.
Thank you, doctor. Next, I invite Dr. Shamali Bhujbal for the paper presentation.
Hello, am I audible?
Yes, doctor.
Okay.
You are audible, doctor.
Yeah.
Please share the screen, doctor.
Yes.
Your screen is visible, doctor. Please start.
Good evening, everyone. My name is Dr. Shamali Bhujbal. I am from Prasuti Tantra Stirok Department, Late Kedari Redekar Ayurved Mahavidyalaya, Kolhapur. My topic of presentation is Ayurvedic aspect of PCOS with special reference to the insulin resistance, a review. Polycystic ovaries. One sec. Introduction. Polycystic ovarian syndrome is a common chronic anovulatory disorder with the androgen excess in women of a reproductive age. The term polycystic ovarian syndrome was first described by the Stein and Michael Leventhal as a triad of amenorrhea, obesity, and hirsutism in 1935, when they are observed the relation between the obesity and reproductive disorder. It is hence also known as a Stein-Leventhal syndrome or hyperandrogenic anovulation. It is most common embryonic ovarian disorder affecting the approximately 2 to 8% of the women of reproductive age worldwide. Nowadays, it is also referred as a syndrome O, that is overnourishment, overproduction of insulin, ovarian confusion, and ovulatory disruption. Obesity is a PCOS associated with the hyperinsulinemia and insulin resistance. PCOS is a major cause of infertility in the female. In modern modality, treatment is symptomatic, which including the oral contraceptive, periodic progesterone withdrawal, and metformin, anti-androgen, and clomiphene cited. But they have their own complication like long-term use associated with the fetal and non-fetal lactic acidosis, oral contraceptive associated with the weight gain, etc. So so it is a need of a time for the safe and cost-effective treatment protocol for this multifactorial disease. Aim to understand the causative factor which are leading to the PCOS, to understand relation between the PCOS and insulin resistance. Objective to evaluate the efficacy of the Ayurvedic treatment in PCOS with special reference to insulin resistance. Etiological factor. PCOS is multifaceted metabolic disorder, heterogenic in nature, and is of unknown origin. Hormonal imbalance, precisely hyperandrogen, higher insulin resistance, high incidence of impaired glucose tolerance, which may approach up to the 30 to 40% in the obese population. Women with the PCOS are characterized by the hyperinsulinism, that is insulin resistant at the level of muscle, adipose tissue, and the liver, while their ovaries continue to have a normal insulin sensitivity. The prevalence of the hyperinsulinism is greater in the obese than non-obese patient. Overall, between 50 to 70% of the women with the PCOS have a demonstrable insulin resistance. Diagnostic criteria. American Society for Reproductive Medicine and European Society of Human Reproduction and Embryology have a following diagnostic criteria for PCOS: oligo and or anovulation, clinical and or biochemical sign of a hyperandrogenism, polycystic ovaries in imaging. Androgen Excess Society 2009 have a diagnostic criteria for PCOS as follows: hyperandrogenism, including the hirsutism and or hyperandrogenemia; ovulatory dysfunction, including the oligo or anovulation and or polycystic ovary; exclusion of any other androgen excess or related disorders. Investigation. Following test will be required for the diagnosis, the cause and to decide its severity. Complete hormone profile, which including the LH, FSH, total testosterone, androstenedione, and estradiol. Fasting blood insulin level, which is elevated. Increased level of a very low density lipoprotein. Decreased level of high resistance lipoprotein or good cholesterol. Ultrasound featuring shows thickening of the capsule of a ovary with numerous small cysts in ovarian cortex. PCOS in Ayurveda: Pushpagni Jataharini, Vrutha Pushpam, and Sthula Lomagandasha. Menses are occur regularly at the usual time, and the women suffering from this type of infertility have a obese cheek covered with the hairs. Description of these of the obese cheek may indicate the central obesity, which is found in the PCOS as the steroid hormone, mainly androgen, have increased. Also, there is an indication of the hirsutism, which is again due to the androgen excess. The name Pushpagni here indicates the infertility due to the anovulation or due to the formation of bad quality of ovum or defective endometrium. Artavakshaya, Jeto Yujita Kalam Adarshanam Alpatava Yoni Vedanacha. In Artavakshaya, there is a feature of oligohydramnia, scanty menses and painful menses. Explain the PCOS only partially, since the Acharya mainly focused on the description of a Alpa Artava Lakshana, that is menstrual blood, not the other. Sign of a androgen excess and the presence of cystic ovaries have not been explained. In Prameha, impairment of a Kapha dosha and Jala Mahabhut, which lead to the Jatragni Mandya, which causes a Samyak Ahara Parinamana, which result in a Bahudrava Shlashma and Sharir Shaithilya, causes circulation of the Prokopita Shleshma throughout the body through the Srotasa. This decreases the responsiveness of to the insulin and other hormone. Prameha Purva Rupa Lakshan like a Madhurasyata suggests the deranged glucose metabolism. The etiology, clinical manifestation, and pathophysiology of PCOS are very close to that of the type 2 diabetes, a combination of insulin resistance and cell failure. In Sthaulya, due to the Vikrut Medavruddhi, creates the Strotorot, which causes dosha, Koshtagni Dipana, result in increase in appetite, faster digestion and assimilation. The Vikrut Meda Dushti also causes the Dhatvagni Mandya, which causes formation of a Apachit Meda only. Charakacharya mentions the Medani Mansa Atruddhi in the buttock and abdomen. Women with the PCOS have an android obesity, which seen in the waist hip ratio is greater than 0.08, central obesity, and many of them have an increased BMI. According to the recent study, visceral obesity is the most significant variable correlating with the metabolic dysfunction in the woman with PCOS. Nidan, Mithya RVR, that is faulty dietary habits and lifestyle. Pradushta Artava, hormonal imbalance and ovarian disorder. Bija dosha, chromosomal or genetic abnormality. Prevalence of the PCOS featuring among the first degree relative is suggestive is genetic influence. The Daiva, that is unknown and idiopathic. Samprapti, Santarpanatha Nidana Sevana, which causes the Agni Mandya, which result in a Ama Annarasa, which causes Dhatvagni Mandya and formation of Apachit Meda Dhatu, which result in Usthaulya. And also because of the Avarana to the other Srotas caused by the Kapha dosha, there is no proper formation of other Dhatus. Doshic involvement in PCOS. Dosha include our Kapha Vritta Vata, Dhatu Upadhatu are Medo Dhatu, and Srotas are Rasavaha, Medavaha, and Mausavaha Srotas. Ayurvedic management. The main objective of a chikitsa is Samprapti Vigatana. This can be achieved by the Samshodhana and Samshamana. Samshodhana can be done in Bahudoshavastha. Samshamana is advised mainly in a Madhya Doshavastha. In Alpa Doshavastha, Langhana Chikitsa can be given. Nidan Parivarjan for the curing the disease, avoiding their recurrence, avoiding the causative factor is essential. Samshodhana is a process by which the waste product or harmful product are thrown out by either by Adhomarga or Urdhva Marga. Use of purification measure
Doctor?
also create.
Doctor, you are exceeding the time limit, doctor. Can you speed up your presentation?
Okay. Patyahar, Kulatta, Amladravya, Tila, Masha, Sura are also useful. According to the Shushruta, Yavanna, Goduma are useful and beneficial in Artava Dushti. Pathya or Vihara, moderate exercise, aerobic exercise can be done in the and yoga practice, including the Surya Namaskar, Sarvangasana, also useful in a patient with the PCOS. Polycystic ovary disease is lifestyle disorder that has no specific etiology and manifestation of a group of a symptom, making difficult to diagnose. Contemporary and traditional management can together improve the outcome of the disease. Thus, adopting a holistic treatment, good lifestyle, and appropriate balanced diet, pranayam, yoga, meditation, stress-free life can prove the effective management of PCOS, having the etiological factor as insulin resistance. Thank you.
Thank you, doctor. So next I invite Dr. Pranamya N. Naik.
Hello. Good evening, ma'am. Am I
Hello.
audible?
Good evening, doctor. You are audible. Please share the screen.
Is it visible, ma'am?
No, doctor, it's not visible. Dr. Pranamya.
Ma'am, can you please share the screen of my PPT? It is not.
Okay, Dr. Pranamya. I will share for you, doctor. Please start the session, doctor.
Thank you, sir. Good evening, everyone. Myself, Dr. Pranamya. I don't know. Presentation is on Garbhapala Rasa. Garbhapala Rasa that is given in pregnancy in from first trimester to last trimester. Introduction. Garbhapala Rasa is a herbo-mineral formulation mentioned in age-old classic book Rasa Chandamshu Rasa Kaumudi. Garbhapala Rasa Kalpana, Prathama and Dvitiya are found in Rasa Yoga Sagara and even in A5. In A5, they reference from Rasatantra Sarava Siddha Prayoga Sangraha. It is described useful for feto-maternal well-being and ensure delivery of a healthy child. It is being used for protection and preservation of pregnancy. Garbhapala Rasa contains minerals like Hingula, Naga, Vanga, and Lohabhasma. Herbal contents of Garbhapala Rasa include Twak, Ela, Patra, Shunti, Chavya, Dhanyaka, Krishnajiraka, Maricha, Draksha, Devadaru. All the ingredients in same quantity were triturated in extract of Vishnukanta Rasa. List of references of Garbhapala Rasa. Rasa Chandamshu in Garbhini Roga Chikitsa, Bharata Bheshaj Ratnakara, Sri Roga Karadi Prakarana, Rasatantra Sara Siddha Prayoga Sangraha, A5 and Rasa Yoga Sagara. In Prathama Garbhapala Rasa, the shloka has been given like Rasam Vimardya Tridinam Jayanti Swacha Amli Tulya Rasena Tasya Palam Vara Trayushana Shatpalani Prag Vimardhyartha Vatim Vidadhyat Tam Varina Grishya Sa Garbayoshi Napi Pradeshe Bhito Atilepaha Vanti Agnimandya Arati Shirovyadati Narocha Kanchapi Nihanti Tasadyaha Grutoshanai Vallamitaha Prayukta Tane Varogaschapi Pragadam Sa Sharkara Kshira Yuto Naranam Upadrava Langana Sambhavacha. Method of preparation of Prathama Garbhapala Rasa is by adding Parada, Jayanti, Shamali, Trikatu and Triphala. When we detail study of each ingredients of Prathama Garbhapala Rasa, that is Jayanti, family Fabaceae, botanical name Sesbania aegyptica, Rasa, Katutikta Rasa, Ushnavirya, Lagu Rukshaguna, Katuvipaka, in Kapha Pitta Hara and Vishagna. Indications Plihodara, Madhumeha, Mutrakritra. Root of white Jayanti is made into paste and applied externally to cure Shvitra. Shalmali, it is also Lagu and Snigdha Guna, Madhura Vipaka, Kashaya Rasa. Indications are Rakta Pitta, Pravahika, Atisara and Rakta Pradara. Next slide. Triphala, Kapha Pittagna, Meha, Kushta, Vishama Jwara Nashana. Ruchya, Deepani, Chakshusha Sara, Trikatu, Deepana, Shwasa, Kasa, Tvatroga, Gulma, Meha, Kafastaulya, Meda, and Shlipada Pinasa. In these diseases, it is indicated. And when coming to Garbhapala Rasa Dvitiya, Hingulam Nagavangaucha, Trijatascha, Katutrayam, Dhanyakam, Krishnajirascha, Chavyam Drakshas, Suradrumaha, Karshamanam, Prutak Sarvam, Karshardam, Lohabhasmacha, Saptaham, Mardayet Khalve, Vishnukranta Rasenacha, Gunja Matra Chavatika, Draksha Kwatena Yojayet, Masa Pratama Marabhyam, Navamasanta Mevacha, Garbini Roganashartam, Garbhapala Rasasmutaha. That means The ingredients are hingula, nagabhasma, vangabhasma, trijataka, trikatu, dhanyaka, krishnajiraka, chavya, draksha, devadaru, and lohabhasma. All the above ingredients are taken in 1 karsha, but lohabhasma is taken in half karsha. Bhavana dravya is Vishnu Krantarasa, and Bhavana is given for 7 days. Dosage is 1 rattivati, once daily from first month of pregnancy to 9th months. Anupana, Draksha Kvata. Indications: Garbhini Roganashana. Coming to detailed study of Shuddha Hingula, it is useful in rejuvenation. It augments the appetite, alleviates all the tridosha. It is used in the diseases like diabetes, skin diseases, fever, hepatitis. It also possesses the properties of Deepana, Atirasayana, and Vrishya. Next slide. Nagabhasma, it is Tikta Katu Pradhana Rasa, Guna Ushna and Lagu Guna, Snigdha Guru Sara Guna, Virya Ushna Virya, Karma, Vidoshahara, Lekana, Balya, Deepana, Rogagnata, Prameha, Kushta, Vrana, Grahani, Atisara. It is also given in oliguria, obesity, Shweta Pradhara, tumors, anemia, etc. Vangabhasma, Tiktamla Rasa, Katu Kashaya Rasa. It is Tridosha Hara in Karma, Ushna Virya, Rogagnata, Prameha, Kushta, Vrana, Grahani, Atisara. And it is also given in obesity, anemia, skin diseases. Coming to herbal ingredients, Twak, Cinnamomum zelanica, family Lauraceae. It is Katutikta Madhura Rasa, Ushna Virya, Ruksha Tikshna, Guna, Katu Vipaka, Kafa Vata Pittahara, Shukrala, Balya. Indications: Kandu, Ajirana, Aruchi, Ati Vata Arsha, Ela. Now, coming to Ela, it is Katu Madhura Rasa, Shita Virya, Kafa Vatahara. It is given in Rudroga, Mutra Krichra, and Arshas, Shirashula. Patra, Ushna Virya, Madhura Katuras, Tikshna Raguguna, Katu Vipaka, Kafa Vatahara, Ruchya. Indications are Hridlasa, Arsha, Pinasa, Prameha, Aruchi. Coming to Shunti, it is Gingiber officinalis, family Citamania, Rasa Katu, Ushna Virya, Guru Ruksha Tikshna Guna, Vipaka Madhura, Karma, Kafavatahara, Deepana. Indications: Shula, Amavata, Admana, Atisara, Shlipada, Kasa, Shwasa, Hridroga, Shofa, Arsha, Agnimandya. Maricha, it is also Katurasa, Tikshna Laguguna, Katuvipaka, Kafavatahara, Deepana, indicated in Shwasa, Shula, Pravahika, Hridroga. Pippali, Piper longum, family Piperaceae, Katurasa, Ushnavirya, Lagusnigdha Guna, Tikshna Guna, Madhura, Vipaka, Kafavatahara, Karma, Vrishya. And it is indicated in Pliha Roga, Udara, Jwara, Kushta, Prameha, Gulma, and Arshas. Dhanyaka, it is Lagusnigdha Guna, Ushnavirya, Kashaya Tiktarasa, Tridosha Hara, and it is in Jwara, Daha, Trishna, Chardi, Kasa, Shwasa, Krina, and Arshas. Krishna Jiraka, Katurasa, Ushnavirya, Ruksha Guna, Katuvipaka, indicated in Jwara, Atisara, Gulma, Admana, Shula, and Ajirna. Chavya, Piperaceae, Katurasa, Ushnavirya, Lagu Ruksha Guna, Kafa Vatahara, indicated in Agdimandya, Kasa, Shwasa, Krimi, and Udara. Coming to Draksha, it is one ingredient having Madhura Rasa, Shita Virya, Guru Mrudu Snigdha Guna, Madhura Rasa, Madhura Vipaka, Vata Pittahara, Vrishya, Brahmana, Chakshushya, Virechanopaga. It is indicated in Jwara, Daha, Trishna, Kamala, Raja Yakshma, and Rakta Pitta. Devadaru, it is having Kashaya Tikta Katurasa, Ushnavirya, Lagu Ruksha Guna, indicated in Jwara, Prameha, Pinasa, etc. diseases. Vishnu Krantarasa, which is used for Bhavana. It is Katu Kashaya Tiktarasa, Shita Virya, Lagu Ruksha Guna, Katu Vipaka, Tridosha Hara, Medhya, Vishagna, Chakshushya, Kushta, Shota, Unmada, Shula. Indications. These are the ingredients that we have discussed now, which are most probably, it is also given in many manufacturing units are providing the Garbhapala Rasa with the manufacturing process of Dvitiya Garbhapala Rasa, that is using Hingula and all. Now coming to research article that has been done on Garbhapala Rasa, Garbhini Paricharya, a case study. The results what that has been given is the patient, one case that has been taken got a healthy active male child of 3.5 kg. In this case, there was no abnormality in fetus, no any complications in the time of pregnancy period and after the childbirth. Another article, effect of Garbhapala Rasa on pregnancy induced nausea and vomiting. Results and conclusion are normal hematological picture maintained, renal and liver function has been given. Liver function tests show non-toxic nature of Garbhapala Rasa. Thus, it can be recommended safely in pregnancy at therapeutic doses. Next slide. The leading manufacturers, that is Vaidyanath, Doodh Papeshwar, Chirayu, Dabar, Dhanvantari, Amritsar, Dindayal, Sandu, Swadeshi and Jandu. The dosage of the Garbhapala Rasa is 125 mg to 250 mg BD. Conclusion is this drug is safe during the pregnancy. Though Garbhapala Rasa is herbo-mineral formulation, if used in absolute indicated patients will definitely help mother and fetus both to maintain health. It has been proved that despite the fact that mercury and lead were found in the maternal as well as umbilical cord blood, in one of the research studies, level of mercury and lead were below the permissible limits. People are always doubtful about the use of metals and minerals containing Ayurvedic formulations. These Rasaushadhis are misunderstood and misinterpreted. Metals and minerals are converted to organometallic compounds by proper processing called Shodhana and Maran. Thus, to improve the potency of certain drugs and make them more effective, specific metals are used in pure and processed forms that are Yogavahi, that are catalytic in nature. They carry active molecule of the herbs more effectively. Thank you.
Thank you, Dr. Pranamya. And before going to the next presentation, dear participants, the time allotted for your presentation is 8 minutes. So please kindly follow the time limit. And next, I would like to invite Dr. Dharmaraj Nagesh Chavan. I invite Dr. Dharmaraj.
Hello, Dr. Dharmaraj. Hello, Dr. Dharmaraj Nagesh Chavan. Please unmute, doctor.
Audible, sir.
Okay,
Yes,
audible,
doctor.
Good evening, ma'am. Can you share that PPT I sent?
Doctor, please start, doctor. Your screen is visible, doctor.
Good evening, all respected panel members. Myself, Dr. Dharmaraj Chavan, second year PG scholars, TGMC, Ballari. My topic of presentation is seminar on Sandhana Kalpa. Next slide. Coming to introduction, Sandhana Kalpa, as per the Ayurvedic system of medicine, contains alcoholic and acidic contents in variable percentage produced by fermentation. These possess special properties which make them more beneficial than other preparations. The Madhya Sandhana contains both water soluble and alcohol soluble active principles of the drug. They can be stored for a longer time without losing their therapeutic activity, as the generated alcohol acts as a preservative too. The basic pharmaceutical principles in Sandhana Kalpana is to extract active constituents of drug through a biochemical process of fermentation in mildly self-generated alcoholic medium. This ensures extraction of both water and alcohol soluble constituents. Now coming to etymology, Sandhyate yaditi Sandhanam. The literal meaning of the term Sandhana is the process of fermentation. Definition: Draveshu chirakalastam dravyam yat sanditam bhavet asavarishta bhedestu procyate besejochitam. Sandhana is the process of fermentation where dravadravya prakshepaka dravya, dravadravya, madura dravya, prakshepaka dravya and sandhana dravya are put together in an inert vessel and sealed for a specific time period to facilitate the process of fermentation. Asava and arishta are the two major products of this process. This fermentation is the incomplete oxidation of sugar into ethanol and carbon dioxide in the absence of oxygen, brought about by the enzymes invertase and zymase secreted by yeast cells. This mechanism happens there. Next slide. Now coming to significance of fermentative preparations. These preparations contain self-generated alcohol, which acts as a self-preservative and have infinite shelf life. Tikshnadi gunas rendered by madhya helps in quick absorption and assimilation of the medicine. Since these preparations are in liquid media, liquid form, they may be readily administered in pediatric and geriatric cases. These preparations kindle appetite by stimulating the activity of digestive enzymes. The sweetening agents like jaggery, sugar, grapes, honey, etc. adds to their good palatable and are highly nutritive to the body. Next slide, please. Now coming to classification of Sandhana Kalpana. Sandhana Kalpana can be classified into two categories, Madhya Kalpana and Sukta Kalpana. In Madhya Kalpana, Sura, Sidhu, Varuni, Asavarishta. In Sura, there are 5 classification: Prasanna, Kadambari, Jagala, Medaka, Sura, Bija. In Sukta Kalpana, Sukta, Tushambu, Savira, Kanjika and Sandaki. Next slide. Madhya and Sukta Kalpana difference. Madhya Kalpana and Sukta. Fermentation in this case carried out by the yeast cells, whereas in Sukta Kalpana, fermentation by acid bacilli. In Madhya Kalpana, fermentation period is more than 15 days to even up to 6 months. In Sukta Kalpana, fermentation period usually within 15 days. In Madhya Kalpana, sweetening agents are added in all the preparation, excepting Sura. In Sukta Kalpana, fermenting media here mainly are carbohydrates. Next slide, please. Sandhana Kalpana, general method of preparations, essential ingredients, Kvata Dravya, drug for decoction, Drava Dravya, liquid preparations, Madhura Dravya, sweetening agents, Prakshepaka Dravya, additional drugs, Sandhana Dravya, fermentation initiated. Asavarishta Anuktamana. Anuktamanaristeshu Dravadrone Tulam Gudam, Shodram Chipet Gudardam, Prakshepam, Dasamamshakam. It is quoted in Sharangadra Madhyamakanda. Dravadravya 1 Drona, Guda is 1 Tula. Madhu is half Tula, Prakshepaka Dravya is 1/10 Guda of Guda. Next slide. Now coming to Sandhana Vidhi, take Sandhana Patra and Dhupana Patra using Dhupana Dravya, kept in husk, prepared Drava Dravya, add sweetening agents, pour the mixture into the Sandhana Patra, add Prakshepaka Dravya and Sandhana Dravya. Next slide. Sandhana Patra is closed with a cloth and lid, kept undisturbed, observed for 3 to 5 days. Onset of fermentation. After onset of fermentation, Sandhi Bandhana is done for Patra, kept undisturbed for 15 to 30 days. Observed for completion of fermentation. After confirming the completion of fermentation, the vessel is opened and the preparation is sipped out. Next slide. This image shows the how from starting to end product. Storage of raw materials, grinding of raw materials, chopping of woody raw materials, pulverization of raw materials, preparation of decoction using boilers, fermentation in wooden containers, clarification of the fermented liquid, and final products in bottles. Next slide. Observation. Onset of fermentation and completion of fermentation. In onset of fermentation, floating of Prakshepaka Dravya over the liquid. Prakshepaka Dravya will be sunk to the bottom. Effervescence is seen, no effervescence. Hissing sound is there, no hissing sound is there. Mild alcoholic odor and taste, strong alcoholic odor and taste. Burning candle is put off. Burning candle is continues to burn. Lime water turns to milky white. Lime water taste is negative there. Now coming to burning candle test. During the onset of fermentation, burning candle gets puts off if taken near to the fermentation liquid surface. After completion of fermentation, the candle continues to burn. Lime water test. At the time of sealing the vessel for fermentation, the lid should be connected and sealed with a small pipe of half to 1 centimeter width by carving a hole in the lid. The other end of the pipe has to be properly clamped after full establishment of fermentation process. The pipe's distal end clamps is removed and is put in a lime water bottle. The test is done every week after onset of fermentation. Here, turning of lime water to milky white indicates the production of carbon dioxide. Next slide, please. This image shows the onset of fermentation, onset of fermentation, and completion of fermentation. Next slide. Now coming to important factors in Asavarishta preparations. Medicinal drugs for Kvata preparations, quality of water for Kvata preparation, preparation of Kvata, Sandhana Patra selection, Patra Samskara, mixing of sweetening agents into the Kvata, place of fermentation, Prakshepaka Dravya, Sandhana Dravya, sediments in Asavarishta, percentage of alcohol in Asavarishta, incinerated metals in Asavarishta, and Sandhanakala. Next slide. Now coming to difference between Asava and Arishta. यद अपक्व औषधाभ्यम सिद्धम मध्यम स आसवा अरिष्ट क्वात साध्यम स्याद त्युर्मानम फलोन्मितम. Asava, in Asava, usually Kwata will not be prepared here, except Asava in which Kwata is prepared. Example, Kumari Asava, Draksha Asava, Kharjur Asava, Madhuka Asava, and Lodra Asava. Whereas in Arishta, Kwata is prepared here, except Arishta where Kwata is not prepared, Takrarishta. In Asava, it is prepared usually with the majority of Sita Virya Dravya. It is prepared usually prepared with the majority of Ushna Virya Dravya. It is Drava Pradhana, whereas Arishta is Dravya Pradhana. Potency is comparatively lesser. Potency is more because of Agni Samskara. Comparatively lesser viscosity and specific gravity, both are more here. In Asava, these are preferred mainly in Paitika Vyadi. In Arishta, preferred in Vata Kaphaja Vyadi. In Asava, preferred in pediatric cases. Arishta is preferred in adult and old age. Next slide. Asava and Arishta doses and adjuvant. Dose is one that is general dose 48 ml. Adjuvant is equal quantity of water. Next slide. Asava and Arishta in Ayurvedic classics. These mentioned in Charaka Samhita 10, Arishta is 20, Susra Samhita 7, Arishta 14, Ashtanga Hridaya, Asava is 3, Arishta is 5, Ashtanga Sangraha, Asava 4, Arishta 13, Sharangadhara Samhita, Asava 4, Arishta 9, Vaishyajaratnavali, Asava is 8, Arishta is 22, Gada Nigraha, Asava 35, Arishta 10, Sahasra Yoga 25 Asava, 20 Arishta, EFI 18 Asava and 20 Arishta. Next slide. Some of Asava Arishta in classic, Arjuna Arishta, Aravind Asava. Now coming to conclusion, Asava and Arishta are two popular Ayurvedic formulation which are. Sir, can you remove that? Asava and Arishta are two popular Ayurvedic formulation which are widely used for therapeutic purpose of various disorder. Asava and Arishta are considered as one of the best formulation in Ayurveda as they possess self-generated alcohol which acts as a self-preservative because of the virtue of properties like palatability, quick action, easy dosage form, and important one is their long life, shelf-life. These preparations are most appreciated by consumers. These two preparations comes under the umbrella of these two preparations comes under the umbrella of Sandhana Kalpana. The main difference between Asava and Arishta lies in the preparation of Kashaya with few exceptions. Drugs used for preparing Arishta are found to be Katin and Madhyama, whereas in case of Asava are Mrudu and volatile in nature. There remains a wide scope to reevaluate them scientifically by means of other sciences for the betterment of mankind because of high therapeutic value. Many Ayurvedic pharmaceuticals companies are having their maximum turnover with the preparation of these Asava Arishta. Next, thank you.
Thank you, doctor. Next, I invite Dr. Pratima Naresh.
Yes, ma'am. Hello.
Yes, doctor, you are audible.
Yes, ma'am. Will you please show my slide?
Please wait, doctor.
Hello, doctor. Please start, doctor.
Yes, sir. Good evening. My name is Dr. Pratima Naresh Gawand. Sir, slide is okay, sir. My name is Dr. Pratima Naresh Gawand, second year PG scholar from Panchakarma department. Topic of my presentation is case report on Shaman Chikitsa and Shirodhara on Khalitya and Darunak. Next slide, sir, please. Abstract. Continuously increasing industrialization and urbanization has posted greater threat on health and hair, due to pollution, contamination of water, air, and stress. There is an increase in incidence of hair fall, that is alopecia, correlate with Khalitya in Ayurveda. Ayurveda treatment provides holistic approach like Shodhana, Shaman, Nidan Parivarjan, and Rasayana. So my case is a female patient aged 25 with complaints of excessive hair fall, dandruff, and itching all over the head was managed by Shirodhara with Jatamansi Taila and certain internal Ayurvedic drugs. Next slide, please, sir. Introduction. Hair forms an important anatomical structure of the body, which not only has protective function but also adds beauty to the face. Increasing industrialization and urbanization has posted greater danger on health of hair due to pollution, contamination of water, air, and stress factors. A female, she was unmarried, age 25 years, came to Panchakarma OPD of Dr. D.Y. Patil Ayurveda Hospital. Her complaints was dandruff and itching all over the scalp and excessive hair loss. A dietary history shows she has irregular food habits and mixed diet with high intake of hot, spicy food. No personal and family history of a major systemic illness was present. Ratri Jagrana and stress regarding the disease were present as etiological factor. Case report. On physical examination, patient was found febrile with blood pressure of 120/80 mm of Hg. Pulse rate was 76 per minute. RR was 18 per minute. On systemic examination, no abnormalities was found in respiratory, cardiovascular, and CNS. Now, on scalp and head examined, dandruff were visible. The patient was Vata Pitta Prakruti, having Madhyam Koshta and Madhyam Bala. Rasavah, Raktavah, Astivah, Manavah, and Svedavah Srotadushti Lakshanas were observed. Next slide, sir. Clinical examination. Nadi was Kapha Pradhan, Mala Samyak, Putra Samyak, Jiva Sam, Shudha Prachiti, Akruti Madhyam, Trishna Samyak, Nidra Samyak, Shabda Prakrut, Sparsha Samashitoshna. Next slide, sir. Treatment schedule. Shodhan Chikitsa. Patient was treated on OPD basis. Patient was advised to perform Shirodhara with Jatamansi Tela, 45 minutes of Shirodhara, and Nasya with Indriya Tarpan Tela, 8 drops on each nostrils. A Shirodhara procedure. Now I will explain Shirodhara procedure. Material required: Shirodhara Patra, Shirodhara stand, Shirodhara table, gauze, cotton, air plugs, vessel, soft towel, suitable oil in case we have taken Jatamansi Tela. Okay. Shirodhara is a procedure of Murdni Tela, where medicated oil or other substances such as the takra, kashai, kshir, etc. continuously pour on head and allowed to follow or scalp in a specific rhythm. It's called Shirodhara. The patient is advised to lie down in a supine position. Dharapatra is fixed 4 angula above forehead. The eyes and ear are covered with the cotton to prevent the flow of liquid into eyes and ear. Shirodhara room should be clean and ventilated and silent. Shirodhara is done in morning hours on empty stomach after Abhyanga. Medicated oil or other liquids like taila, milk, vath, and water is kept in Dharapatra. Can be kept in Dharapatra. Dharapatra should be poured continuously on forehead, neither very fast or nor very slow. The stream of liquid should not be too thick or thin. Dharapatra is moved in pendulum manner in this procedure. The liquid is then collected in another vessel and reused till to refill the Dharapatra. It is done for 45 minutes in the morning. Temperature of the liquid of Shirodhara should be maintained above the body temperature during this procedure. Next slide. Saman Chikitsa, we have given Astiposhak Vati of 500 mg, Sukshma Trifala 250 mg, Krimi Kuttharra 60 mg, Arogyavardhini 250 mg, and we advise her Manjistadi Kvat 4 TSP 3 times, Panchatikta Ghruta 2 TSP 3 times before meal with hot water. Anuloma Kvati 1 gram of 1 tablet of 2 gram at night was advised from day 1 to last sitting of Shirodhara. And follow up after 15 days. We advise her Shirodhara for 15 days. We can see the results before treatment picture and after treatment picture. Discussion. Ushna and Tikshna Vidha and Vidha Ahar leads to Pitta Dushti, while the Ruksha Guna in Ahar leads to Vata Dushti. Vikshepan guna of Vat leads to Kesha Bhagna and Kesha Chuti. Later, the Ghana, Guru, Sthira gunas of Kapha influence the Rakta and leads to Avarodh on or Sangha in the Romakupas. Excessive indulge in cold water and cold weather leads to Vata and Kapha doshas. Apta Ati Sevana Raja and Dhuma Sevana means excessive proper protection to head, which may result in excessive sweating. At Maithuna, Ati Maithuna increases Vata dosha, Ati Swapna and Ratri Jagrana leads to Kapha and Vata respectively. Vega Avrodha leads to Vata Vaigunya. Manas Hetu such as Chinta, Shoka, Krodha, Bhaya, all are responsible to increase Vata and Pitta dosha. Dushti, thus thereby Rasa Dushti, which in turns leads to vitiliation of other doshas. Rogamarga is Bahya, Adhisthana is Kesha Bhumi, Rakta Mokshan is a specific processor for elimination of Rakta and Pitta doshas. Next slide, sir. Conclusion, there was marked improvement in the case of Khalid. The patient has complete relief in dandruff, itching in the scalp and marked relief in the hair fall. Khalid, though it is difficult to manage, but internal medicine gives to patient followed by Shira can be a good option for Khalid and Arun. Thank you, sir. These are the references.
Thank you, doctor.
Thank
It
you.
was a well explained presentation. So next I invite Dr. Mandvi Sharma.
Yes, ma'am.
Doctor, please start.
Your screen is visible,
Your
doctor.
screen
Please
is visible,
unmute and
doctor.
start.
Please
Doctor.
unmute and start, doctor.
Am I audible, sir?
Yes, doctor, audible.
Okay, sir. So good evening, and myself, Dr. Mandvi Sharma, final year PG scholar in the Department of Rashastra and Bheshajya Kalpana in SDM College, Hassan. Today, topic of my presentation is Mukha Roga Shamaka Arka. I am presenting this topic under the guidance of Dr. Ghazala ma'am. Content of my topic is introduction. In this, I am going to explain about journal introduction of Arka, journal method of preparation of Arka, characteristics, Arka Grahanartha Patra, and next is material and method. In this, I am going to explain about journal method of preparation of Mukha Roga Shamaka Arka, indications and analysis, then discussion and conclusion. Coming to the introduction, first I'll explain about Arka Kalpana. Arka is a unique preparation in which we will collect volatile principle and essential oil from the herbal drugs. Then in our classical books, we will find the reference of Arka in Arka Prakasha, which is written by Ravana. This book contains 10 chapters and all the chapters are named as Shatakas. In Bhishya Kalpana, Arka is considered as Panchavidha Kashaya Kalpana by Arka Prakasha, and Acharya Sharangdhara have considered it under the Upkalpana of Fanta. Then definition according to AFI. AFI is Ayurvedic Formulary of India. They have given definition like Arka is a liquid preparation obtained by distillation of certain liquid or drugs soaked in water using the Arka Yantra or any convenient modern distillation apparatus. Next is journal method of preparation. In general method of preparation, we will take required amount of drug in and we will clean that drug. Then we will coarsely pound it. It is important to pound drug coarsely because if it is not pounded, then we will not get the volatile principles. And if it is finely pounded, then it will get charred soon. So it is important to pound the drug coarsely. Then some quantity of water is added to the drug and soaked overnight. Next morning, this drug is transferred to the round bottom flask and remaining water is added. Here what we can do is half quantity of water we can use for soaking purpose, and next day we can use put half amount of water and we can start the procedure. Next is boiling is started by adjusting temperature in heating mantle. In heating mantle, knob will be there. In that we can adjust the temperature according to the nature of the drug and we can start the procedure. Then when heating is started in round bottom flask, that when liquid start boiling, then vapor will go to condenser. In condenser, two lets are there. One is outlet, one is inlet, through which normal water will move. It will help that vapors to come into water form again, and we will collect that water through receiver. Then first 2 drops should be discarded because it don't have any therapeutic value. So we will discard first 2 drops. Then we will collect 60% of arka, and remaining portion should be discarded as it is not containing any therapeutic essential substance. Next is characteristics. These characteristics are according to AFI. They have mentioned it is slightly turbid. It will depend upon the nature of the drug. If it is like Bharangi Arka or Tripla Arka, then color will be like accordingly. Then smell of the predominant drug. If it is like Hingu Arka, then smell will be Hingu smell we can appreciate. So all these characteristics will depend upon the nature of the drug. This is Arka Grahanartha Patra. In Arka Prakasha first chapter, they have mentioned these 4 patras. One is Jirna Asthi Mritika Nirmit Patra. Next is Kancha Patra, then Pashana Patra and Mritika Patra. Jirna Asthi Mritika Nirmana Patra, Nirmita Patra, they have mentioned in first chapter. They have told like in which land this Shilajittu is available. In that land, we have to make one pit and we have to put the bones of 2-legged animal or 4-legged animal, and we should add lavanas and ksharas, and we have to leave that for 6 months. Then after 6 months, we should put soil above in that pit, and we should keep bricks, and we should leave that for 3 years. After 3 years, we should collect that that mud, and we should make pot out of it. So maybe it will have some ethical issues or it is very lengthy procedure. So we can go for other 3 patras, which is Kancha Patra, that is glass container, Pashana Patra, stone container, and Mritika Patra, mud container. Next, coming to the material and methods. In this, I will explain about Mukha Roga Shamaka Arka. It contains 3 ingredients, which are Krishna Jiraka, Kushtha, and Indrayava. I took all the ingredient according to volume by volume. So I took 30 ml of all the ingredients and 2 parts of water, which is 180 ml. Next is indication of arka. General indication of arka is swasthen rogina va api yachito arkasya enva gyatva tat lakshanam dadyat anyatha brahma bhavet. Here they have told like we can give arka to both swastha person and rogi person. But before giving arka, we should see the lakshana of rogi as well as arka. If we don't see that, then it will consider as brahma hatya. Then mukha roga shamaka arka. This first line explain about the ingredients of the arka. Second line is Triden Vrana Kleda Dorgandhya Upshamyanti, which means within 3 days this arka will cure Vrana, Kleda and Dorgandhya of Mukha. Next, coming to method of preparation. 30 ml of each ingredient was taken and soaked in 90 ml of water overnight. Then next day 90 ml of more water is added. Then arka preparation was started at 9:14 a.m. And at the temperature of 60 degrees Celsius temperature. Then first 2 drops came at 9:29 a.m., which was 15 minutes afterwards. We discarded first 2 drops. Then afterward, temperature was decreased to 30 degrees Celsius to 40 degrees Celsius to take all the volatile principle of that drug. Then 60% of arka was collected, and which was 108 ml. Then coming to the analysis, in analysis, for analysis, I have referred this CCRAS book named Laboratory Guide for the Analysis of Ayurveda and Siddha Formulation. In that, for ARCA, they have explained 18 parameters, in which I have done only 4 parameters, which are pH, refractive index, specific gravity, and viscosity. pH of my ARCA was 4.58. Refractive index was 1.343. Specific gravity was 0.99 and viscosity was 0.009. Then coming to the discussion, ARCA can be given to both healthy and diseased person. After considering guna and dosha of person, ARCA should be administered. Durgandha yukta ARCA should not be consumed. If patient consume Durgandha yukta ARCA, it will cause glani, vamana and alasya. Then for Upadrava of Durgandha Arka, 1 pala of Japa and Malati Pushpa can be given. Malati Pushpa Arka can be given. pH of Mukha Roga Shamaka Arka was 4.58, which makes it acidic in nature. Nature of the dravya is what caused the pH to be acidic. Mouth pH range from 6.2 to 7.6. Due to the fact that ARCA is a distillate, its refractive index, which depicts velocity of light in vacuum or air, was 1.343. Specific gravity is a dimensionless quantity that is defined as the ratio of density of a liquid sample to the density of the water, which was 0.99. Viscosity of Mukha Roga Shamaka Arka was 0.009, which is property of liquid, which is closely related to resistance to flow. These are the qualities of Arka, means individual drug Arka. Krishna Jirka Arka have Chakshusha, Gulma, Chardi, Atisara Hara properties. Kushta Arka have Vata, Rakta, Kasa, Kushta Roga, Vata Roga and Kapha Janya Roga Hara properties. Indra Yavarka is having Deepana, Shitla, Kapha Trishna, Kushtajit properties. Conclusion. Arka is included in Panchavidha Kashaya Kalpana by Arka Prakasha and its Kalpana of Fanta by Acharya Sharangdhara. Arka is having 1 year shelf life if stored in proper condition. Mukha Roga Hara preparation is easy as all the ingredients are easily available. This pharmaceutical preparation is more sterile than other formulations. As pH of Arka was 4.58, it may help to kill microbes which cause Mukha Dorgandhya and cure Kleda condition of mouth. Arka Kalpana is more palatable than other Kashaya Kalpanas. Mukha Roga Arka will show good effect on patients if administered in proper way. Less dose and more shelf life make this Kalpana drug of choice. Thank you.
Thank you, doctor. Next, I invite Dr. Krishna Teja. I invite Dr. Krishna Teja. Dr. Krishna Teja, please unmute yourself.
Hello, Dr. Krishna. Hello, Dr. Krishna, can you hear me?
Yeah, hello.
Okay, doctor. You're audible, doctor. Please
Can I
share the
share my
screen, doctor. Your screen is visible, doctor. Please start.
Hello. Am I audible?
Yes, doctor. Audible, doctor. Please start, doctor.
Myself, Dr. Vedantam Krishnataya. Yeah, hello. Hello.
Hello, doctor.
Yeah.
Hello, doctor. Hello, Dr. Krishna Teja. Doctor, please unmute, doctor. Hello, Dr. Krishna Teja.
Yeah, hello.
Okay, doctor. Please share the screen, doctor.
Hello.
Hello, doctor.
Am I audible?
Yes, doctor. Audible, doctor. Please share the screen, doctor.
Just a second.
Your screen is visible, doctor. Please chat.
Okay. Myself, Dr. Vedantam Krishna Teja. Hello, myself Dr. Vedantam Krishna Teja. I am first year PG scholar from Department of Panchakarma, SDM College of Ayurveda Hospital in Hassan. Today I will explain about the role of Triphaladi Udvartana in the management of Staulya, a case study. We'll see about the description of the patient. He's age of 38 years and he admission on 7th and he date of discharge on 7th. He's actually a Hindu and localite. We can see the complaints of the patient that increased body weight since 6 months and excessive perspiration from 1 month and dyspnea from 1 month, heaviness in body, polydipsia and polyphagia from 6 months, having laziness from 6 months, is having also snoring problem from 2 months. Present history of the patient. A 38 years male patient apparently healthy before 6 months, gradually observed there was a gradual increase in body weight, excessive perspiration, dyspnea, heaviness in body, polydipsia, polyphagia, laziness and snoring at night time. So he came to OPD of our institute for Ayurvedic treatment. We have diagnosed as a Staulya obesity class 2. In past history is having no diabetes, hypertension and bronchial asthma. Is having addiction of alcohol and smoking since 2 years. An anthropometry of the patient, the height is actually 164 centimeters and weight of 101.95 when he got admitted. At that time, BMI is 37.9 kgs per. You can see the circumference of the chest of 110 centimeters and abdomen of 119 centimeters, hip of 114 centimeters and right mid-arm of 38 and right thigh circumference of 56 and left is 56.2. And as a diagnosis case and obesity of class 2. Treatment plan. On first day, we given Sarvanga Udvartana with the Triphaladi Udvartana Churna. Along that, Shirodhara with Mushta, Amalaki and Jetamamsi Kashaya. And we given Manasa Vati of 2 BD and Haritaki Kanda 15 grams of 2 BD. From day 2 to day 10, we given a Udvartana with Triphaladi and Shirodhara with Mushta, Amalaki and Jetamamsi. Additionally, we added Virechnika Dhumapana 3 times a day. And Kavala with Dhanyamla, Trikatu and honey. And we given Nasya with Shikari Taila of 2 drops morning and evening in each nostril. And we duration of the Udvartana, each part of the body in their respective position is massaged with 3 to 5 minutes. And overall procedure should be 30 to 45 minutes we did that. On sitting position 5 minutes, supine 7 to 10 minutes, lateral, left lateral 5 minutes, dorsal 5 minutes, right lateral 5 minutes, supine of 7 to 10 minutes and sitting in 5 minutes. We can see the outcome of the patient. We can see the changes in anthropometry. Starting it was 110 and after later it comes to 107. Same abdomen get 119 to 108, hip 114 to 97 centimeters and right mid-arm of 38, from starting 38 and later it was 33. Same as usual, same thing. We can see the lipid changes. There is a drastic lipid changes starting and end of the treatment. Before treatment, it was 228 total cholesterol level. Finally, we can see that 206. The same thing HDL cholesterol also. Starting it was 56 and later it was 50. LDL also the same 135 and later it was 130. You can see the triglycerides level from 182 to 0.6 to 130. In VLDL also there is a drastic change from 36 to 26. In weight changes, starting patient weight is 101.95 kgs, later it down to 94.15 kgs. You can see the BMI changes starting and later. Starting it was 37.9 kgs, obesity class 3. And later the result is BMI 35 kgs, this thing, and change it to obesity class 1. We can see the original lab reports that showing the changes of lipid profile starting and later. We can see the ingredients of the Trifladi Udvartana Churna. We're having Haritaki, Bibitaki, Amalaki, Swarshapa, Mudga, Kulatta, Eva, and Medika. Discussion. The term Udvartana consists of two words, Urdhva and Vartana. Urdhva means upward and Vartana means to move. Reinforced rubbing of the body by Churna is called as Udvartana. As Udvartana Chikitsa is the most appropriate line of treatment in Staulya to prevent Amasancha and Srotavarodha. Focus the Agni gets stimulated after applying drugs used for Udvartana, which leads to absorption and digestion of these drugs, and further does previline of the Medo Dhatu, which is present beneath the skin. Udvartana is a simple and affordable procedure which no much harmful effects compared to other. Trifladi Churna will act as Ridoshahara and Kapha Medohara. We can conclusion of this case study. Staulya can be successfully managed with Udvartana Chikitsa with the use of Trifladi Churna. In this case, Trifladi Udvartana gave remarkable relief to patient with significant weight reduction from 101.95 kgs to 94.15 kgs within a 10 days of treatment. And BMI is reduced from 37.9 to 35. I can conclude the speech by this: you don't have to eat less, you just have to eat right. There is no quantity involved in this. It should be like quality of the food we need to intake. Thank you, everyone.
Thank you, doctor. Next, I invite Dr. Sindhura V. Prabhu for the presentation.
Hello, sir. I am audible.
Yes, doctor. Audible, doctor. Please share the screen, doctor.
Sir, can you do it for me? Can you share the slide?
Okay, doctor. Hello, doctor. Please start the session, doctor.
Okay, sir. Good evening, everyone. Myself, Dr. Sindhura V. Prabhu, first year PG scholar, Department of Panchakarma. As we all know, Basti is the main line of treatment in Vata Rakta, we consider. There is shloka, we say, Nahi Basti Samam Kinchit, Vata Rakta Chikitsitam. So here we are seeing about Sagrita Kshira Basti and Chinchadi Lepa in the management of Vata Rakta. Here are the description of the patient who has come to the OPD. Next slide. She complained of pain and swelling in the bilateral knee joint and ankle since 1.5 years, associated with redness of joints and difficulty in walking and reduced sleep. Next slide. History of the present illness. Patient aged 41 years who is non-diabetic and non-hypertensive was apparently normal 1.5 years back. Gradually developed pain and swelling associated with redness in left knee and ankle joint. Later, it shifted to bilateral, both sides also. Next slide. While examining the joints, in inspection, swelling was severe, pronounced swelling with a raised border more than 1 mm, and redness, it was moderate and bright red, it was distinct. And while palpation, tenderness was so severe that patient doesn't allowed to touch us to the affected part, and temperature was also raised. And here are the blood parameters. CRP was 77.6 mg per dl, and serum uric acid also 7.8, and ESR was 135. And while MRI was done, it was told chondromalacia patella grade 3, and mild medial compartment osteoarthritis, and grade 2 intrasubstance signal body in the medial meniscus, and there was also joint effusion. Next slide. So by considering these symptoms, we diagnosed it as Vata Rakta and hyperuricemia. Next slide. Treatment plan was done according to the Amavastha and Niramavastha. In Amavastha, we have done Rukshana Chikitsa, that is Sarvanga Udvartana followed by Dashamula and Dhanyamla Parisheka, and Chinchaddi Lepa to the bilateral knee joint. And in Niramavastha, we did Sarvanga Abhyanga with Pinda Taila, which is told in Vata Rakta again, followed by Jambira Pinda Sveda, which is also a Snigdha Ruksha type of Sveda, along with Sagrita Kshira Basti. Next slide. Here is the Sagrita Kshira Basti, means how we have done it. Anuvasana Basti was given with Panchatiktaka Grita along with the Sukumara Grita, and Niruha Basti contains only Sneha, Kalka and Kwata. Here we did not use honey and Saindava Lavana. It was done in the format of Yoga Basti. Next slide. This is the ingredients of Chinchadi Lepa, which contains Chincha, Rasna, Devadaru, Dhanyamla, Kottam Chukkadi Taila and Saindava Lavana. Next slide. This is the outcome. At the end of the treatment, pain was reduced by 50%, and swelling was reduced. Swelling, redness, and all signs of inflammation was reduced. And blood parameters also. CRP was reduced to 4.5 mg per dl. Serum uric acid was 3.0. ESR was reduced to 30 mm. Next slide. So discussion. Vata gets aggravated being obstructed in its course by Rakta. Excessively aggravated Vata vitiates Rakta and produced Vata Rakta. This is the Samprapti of Vata Rakta, we know. In Amavastha of the disease, here Rukshana Chikitsa is followed in the form of Sarvanga Udvartana followed by Parisheka. Udvartana has Kapha Medohara action. It also does Agni Dipana, thereby reduces Gauravata in the Sharira. Since patient was having severe tenderness, there was involvement of Vata and Rakta. So here, and also patient was having severe tenderness, Drava Sveda was performed in the form of Parisheka Sveda with the help of Dashamula Kashaya and Dhanyamla. Both are again Kapha-Vata Shamaka. Then Chinchadi Lepa is applied to bilateral knee joint and ankle. During this Lepa is Ruksha, means the drugs used are Ruksha and Amapachaka. The drugs used are Ruksha and Amapachaka in nature, which is helped in the reduction of the signs and inflammation. Once the Niramavastha is attained, Abhyanga is performed with the help of Pinda Taila, which is told in Vatarakta Chikitsadhyaya. It is also Shrestha Vatahara, as Abhyanga is considered as Shrestha Vatahara. it is performed. And Jambira Pinda Sveda is one among the Snigdha Ruksha type of Sveda, which is also helped in the patient in reducing inflammation. Sagrita Kshira Basti is told in the context of Vata Rakta. Here both Kshira and Grita are Pitta Anilahara. As said, there is no best treatment other than Basti in Vata Shonitam. Here both Panchatiktaka Gugulu Gruta and Sukumara Gruta are used, which are again Vata Pitta Hara and Rakta Prasadaka. Next slide. Conclusion. Sagrita Kshirabasti is told in the management of Vata Rakta by Acharya Charaka. Lepa is also explained in the Chikitsa of Vata Rakta. So, with the help of Ruksha and Amapachaka Dravyas, Lepana is done. Signs of inflammation are reduced by the end of the treatment. It also helped in the reduction of a CRP, RA factor and ESR to a significant level. That's all. Thank you.
Thank you, doctor. Next, I invite Dr. Sahana as for the presentation. Dr. Sahana.
Good evening, sir.
Good evening, doctor. Please share the screen, doctor.
Can you please share the screen for me?
Okay, doctor. 1 second, doctor.
Thank you.
Doctor, please, doctor.
Okay. Good evening, everyone. Myself, Dr. Sahana, first year PG scholar in the Department of Panchakarma from Dharmasthala Manjunatha College of Ayurveda, Hassan. Now I'll be presenting a case report on combined effect of cup massage, Kati, Pichu and Salavana Upanaha in the management of Katishula. 32-year female patient who is a doctor by occupation. Next slide. Complaints of pain and stiffness in a Kati Pradesha and difficulty while walking and sitting. Patient was apparently healthy 4 months back. She gradually developed pain and stiffness in low back after long sitting. Pain got aggravated by a jerky movement while riding vehicle 15 days back. And in findings, an X-ray of LS spine revealed disc bulge in L4 and L5 region. Next slide. Her vitals were normal. BP was 120/80, pulse was 76 beats per minute, and temperature was febrile. And in systemic examination, no abnormalities were noted. In personal history, sleep was disturbed due to pain. In musculoskeletal examination, SLR was negative in bilateral lower limbs. Scobers was also negative. Tenderness was positive at L4 and L5. Pain on flexion was positive. So it is diagnosed as Abhigataja Katishula and treatment was done. Treatment plan was like cup massage over Kati region, followed by Kati Pichu with Bala Ashwagandha Lakshadhi Taila for 20 minutes. And Salavana Upanaha for Kati region is tied and left for 6 hours. And this treatment was done for a duration of 5 days. So these are the ingredients of Salavana Upanaha. Saindava Lavana, Ashwagandha, Bala, Esti Madhu, Shatavari, Kola Kulatadi Lepa, Dhanyamla, Chincha Rasa, lemon juice, and Taila. Most of the drugs are having Madhura Vipaka and Shita Virya, and Dosha Shamaka action was Vata Pitta Hara. The quantities are also mentioned. And the outcome and comparison of before treatment and after treatment are here. I have taken parameters of VAS score, flexion, and tenderness, and the scorings are given. In VAS score, before treatment, it was 6. Previous slide, sir. In VAS score, before treatment, it was 6, and after it was 3. And flexion, before treatment, it was 1, and after treatment, it was 0. Tenderness before treatment, it was 2, and there was no tenderness after treatment. Next slide. So, Shula is said to be produced by vitiated Vata dosha. Kati includes Asti, Sandhi, and supportive structures like Mamsa, Peshi, and Snayu along with Srotas. Katishula is a condition where vitiated Vata produces pain and stiffness in Kati Pradesha, and Kati is said to be main seat for Vata dosha. And since it is Abhigataja, Pitta and Rakta will also be involved. So the treatment is planned according to that. Katipichu is one of the Bahya Snehana and Svedana procedure that acts against Ruksha and Shita Guna of Vata, helping in reducing symptoms. While cupping is done priorly as it aids in increasing local blood circulation and increases the absorption of active ingredients of the drug to the target cell. Cupping is a complementary and alternative medicine which I have involved in this treatment. It stimulates muscle and helpful in treatment of aches and pains. Upanaha Sveda also helps in relieving pain and stiffness. In Salavana, Upanaha is indicated in all Vata Rogas as it is said Sarva Vatajit by in Ashtanga Hridaya, and drugs used are mainly having Vata and Pittahara properties.
Hello, Dr. Sahana. Hello, Dr. Sahana.
Hello.
Hello.
Am I audible, sir?
Yes, Doctor. Audible, Doctor.
And I want to conclude that the combined effect of cupping, Katipichu and Salavana Upanaha and Katishula significantly reduced pain, tenderness, stiffness, and improved flexion and sitting time. Thank you.
Thank you, Doctor. Next, I invite Dr. Aishwarya Surendran for the presentation. Dr. Aishwarya Surendran.
Hello, sir.
Hello, Doctor. Please share the screen, Doctor.
Can you please share the slide for me?
Okay, Doctor. 1 second. Dr. Aishwarya, please start, Doctor.
Good evening, everyone. Myself, Aishwarya Surendran, first year PG Scholar, Department of Panchakarma, SDM Hassan. Today, I will be presenting a case report on Ayurvedic management of Pandu. Next slide, sir. Presenting complaints, a 22-year-old female complains of experiencing a sudden and temporary loss of consciousness since 6 years, cramps in bilateral calf muscle since 2 months, painless generalized weakness, loss of appetite since 6 years. Next step. History of presenting complaints. Patient not known case of diabetic mellitus and hypertension was healthy 6 years back. 2 months after menarche, gradually started experiencing sudden and temporary loss of consciousness. She approached some local clinic and got temporary relief. Again, the symptoms started 1 year back, along with cramps in calf muscles during night hours, which disturbed her sleep. Also, she presented with painless bleeding during defecation since 6 months. Then she came our OPD for better treatment. Personal history and investigations. Bowel was constipated, appetite was reduced, maturation increased frequency, and sleep was regular. Her vitals were BP 1 time 70 mm per Hg, and others were normal only. Menstrual history amount was scanty, and her hemoglobin level was 8.4 grams percentage. And on general examination, pallor was present in conjunctiva and nails. Systemic examination, except for anorectal examination, no other abnormalities are found. Anorectal examination, first degree hemorrhoids and fissure is noted. And the assessment criteria, aruchi, loss of appetite, panduda, pallor, daurbalya, hridaya spandanam. Next slide, sir. Shwasa, Pindigo Dveshtanam, Akshikoda Shwata, and Shrama. Grading of blood hemoglobin level. Next slide, sir. And it was noted that Aruji as grade 2, that the patient was occasionally having poor appetite, and Panduda as score 2 as the pallor on conjunctiva and nails was noted, and the Daurbalya it was grade score number 1 as occasional normal. Occasionally the weakness was found on normal activities, and Pindigo Dveshtanam score was 0. Hridaya Spandanam grade was 0. Shwasa grade was 0, as nothing with related with that was noted. And Pindigo Dveshtanam score was 2, as it she presented with mild leg cramps, and no any periorbital edema was noted, and Shrama, fatigue, as she's having fatigue during heavy activities. The normal was the score was 1, and the blood hemoglobin level was grade 2. Next slide, sir. And the diagnosis, the previous slide, please. And the diagnosis according to Ayurveda, symptoms like Panduda, Karnaksheda, Aruji, Shwasa, Gatrashula, Gauravada, etc. points to the disease Pandu. Pallor of the skin and the decrease in the level of the hemoglobin is the basic diagnostic criteria for anemia. Patient has diagnosed Pandu with questionnaires that mentioned in the form of grading 0, 1, 2, and 3, and confirmed by CBC laboratory test with the HB level below 9.5 gram DL. And as the low HB level, MCV, PCV, MCHC, and MCH is found, we can take it as iron deficiency anemia. Next slide, sir. And the treatment plan was Matra Basti with Kashmiri Adi Grida for 5 days, Abhyanga with Kshirapala Taila and Ushna Jalasnana, Sadhya Virajana with Avipattikara Churna with honey quantity sufficient, and Shamana Ushadis like Ponarnavat Mandura, Helmalite, Triphala Annabedi Sindura, Jatyadi Grida for anal application, and Pathya and Apathya were given. Next slide, sir. And during the first, in the results part, during the first OPD visit, she was having weakness, fatigue, anorexia and vertigo, leg cramps and perrectal bleeding, and her HB was noted as 8.4 gram per DL. And during the next visit, mild relief in symptoms, and the HB was noted as 8.6 gram per DL. And during the third visit, relief in symptoms was noted, and the HB was increased to 8.8 gram per DL. And during the last visit, it was noted that her HB increased to 10.6 gram per DL. Next slide, sir. And the discussion, Matra Basti will help in healing of fissure and easy evacuation of the bowel. And Sadhya Virajana is done for the Koshta Shuddhi, and Vada Nilomana also helps in easy absorption. Avipattikara containing Trivrit, which helps in easy evacuation, and it is Koshta Shuddhikara. Punarnavadi Mandura is a polyherbal formulation, is rich in iron, and it is mainly used to treat iron deficiency anemia. Triphala Annabedi Sinduram is prepared by Triphala, Annabedi Sinduram, and Yashti Madhu, which is indicated for anemia, skin pallor, fatigue, shortness of breath, etc. Annabedi Sinduram is used for iron deficiency anemia. This medicine is hematinic and cures deficiency of iron. Jatyatikrita purifies and heals ulcers, useful in ulcer, fistula, skin diseases. Next slide. Conclusion. Aushadhis like Punarnavadi Mandura, Triphala Anabedi Sindura, following proper pathya helped in treating the condition. Thank you.
Thank you, doctor.
Thank you, sir.
Next, I invite Dr. Shakira in for the paper presentation. Hello, Dr. Shakira.
Yes, sir.
Doctor, please share the screen, doctor.
Can you see my screen?
Your screen is sharing mode, doctor. It isn't sharing, but not visible. Now visible, doctor. Please start, doctor.
Okay. Good evening, all. I am Dr. Shakira and first year PG scholar from VPSV Ayurveda College, Kottakkal. My topic is scope of cupping therapy in the management of carpal tunnel syndrome. Coming to the introduction, carpal tunnel syndrome is the most common entrapment neuropathy of the upper limb caused by compression of median nerve as it passes beneath the flexor retinaculum. Characteristic complaints of CTS include pain, paresthesia, numbness in lateral 3.5 digits and hand. Prevalence of CTS is estimated to be 4.25% in young adult population of the world, with a female to male ratio of 4:1. Prevalence is more common in age group of 30 to 60 years. Causes of carpal tunnel syndrome. Any space-occupying lesion of the carpal tunnel is responsible for CTS. It includes idiopathic causes, inflammatory causes like RA, and post-traumatic causes like bone thickening after Colles fracture, and endocrine causes like myxedema and acromegaly. Thickening of flexor retinaculum and RA involving synovial sheets of flexor tendons or dislocation of lunate, which compresses the contents of osteofibrous canal, mainly median nerve leads to CTS. Clinical features includes pain is worst at night and relieved by hanging the hand out of bed and most common in perimenopausal women. Pain and difficulty in flexing fingers, neurological deficits of median nerve, tingling, numbness, and discomfort in the thumb and radial 2.5 fingers. This is the pictorial representation of numbness and pain distribution. Long-standing cases, the thenar eminence is wasted and trophic changes may be seen. To diagnose the CTS case, we can use the clinical tests like Phalen's test and Tinel sign. Tinel sign can be performed with lightly tapping over the nerve to elicit a sensation of tingling or pins and needles in the distribution of nerve. CTS can be confirmed with electrophysiological study, nerve conduction velocity test of median nerve. Up to now, there is no universally accepted therapy for CTS, but both surgical and non-surgical interventions have been suggested, such as splints, steroid injection, and surgical decompression. Recurrence rate is high even after this surgical decompression. Complications like intraoperative injury to nerves, vessels, and tendons, infections, pain, and wrist instability also there. Hence, effect of parasurgical procedures like Rakta Moksha as cupping therapy need to be evaluated. While considering the background studies like in a randomized controlled trial conducted by Andreas Michelson et al. Titled Effects of Traditional Cupping Therapy in Patients with Carpal Tunnel Syndrome shows that cupping therapy done at overlying trapezius muscle for 5 to 10 minutes was beneficial in reducing the symptoms. And a review article by Anirudh et al. Suggested that cupping can be considered as the modified form of Sringa. In our text, Acharya Susruta has mentioned Yaktavrita Vada condition in Susruta Nidhanam, first chapter. Sujibiriva Nistoda Spersha Dvesha Prasuttada Shesha Pitta Vigara Sur Marude Shonidanide. Here, most of the clinical features of Rektavradavada resembles that of CTS. Rektamoksha is the treatment mentioned for Rektavradavada, and Rektamoksha can with Shringa is addressed in Vadiga conditions. Cupping is suggested as modified form of Shringa, in which mouth aspiration is replaced with mechanical aspiration. While doing cupping therapy, we selected participants satisfying diagnostic criteria confirmed with nerve conduction velocity test, having mild to moderate CTS, will be treated with wet cupping using sterilized hijama cup of size 4 or 5 over the area within 3 cm diameter of flexor retinaculum of this joint. 5 to 10 ml of blood should be drawn out until and up to the stoppage of bleeding in 2 sittings with a gap of 15 days. Patient can be assessed pre and post the procedure with the objective criteria of NCS, Boston Carpal Tunnel Questionnaire, and range of movement wrist joint, subjective criteria of pain, paresthesia, Phalen's test, and Tinel sign. Conclusion. Many studies are available as testing effectiveness of Agnikarma-like procedures in managing CTS. In our clinics, we experience better results with wet cupping therapy in CTS, and hence this study is conducting now to document the results systematically and give a better patient care. This is my reference. Thank you.
Thank you, Doctor. Next, I invite Dr. Purohit Megha Naresh for the paper presentation.
Yes, Doctor.
Okay, Doctor. Please share the screen, Doctor.
My screen is visible?
Yes, Doctor. Visible, Doctor.
I am properly audible, right?
Yes, Doctor.
Yeah.
Please start.
So, I, Dr. Megha Purohit, second year PG scholar from the Department of PG Studies in Swastavrata, Sri College of Ayurvedic Science and Research, Bangalore. I'll be presenting on the topic Ashtanga Yoga, a time-honored practice. So, let us move ahead. Let us move ahead to the contents. So these are the content of my presentation. Now, before going into the Ashtanga Yoga, let us know what is yoga, the definition, and what is Ashtanga Yoga. Yoga has different derivations and definitions. One among which is the derivations which are mentioned are Yujir Yoga, that is which combines or which unites, and Yujjate Aninaiti Yoga, which is also mentioned, which means that which brings about the union of soul and God. The different definitions which are mentioned are Yoga Karmasu Kaushalam, which brings about the perfection in action, is mentioned in Bhagavad Gita. Bhagavad Gita gives us another reference or a definition, that is Samatvam Yoga Uchyate, that is a state of balance. Yoga Chittavritti Nirodha is another definition which is mentioned by Patanjali Yoga Sutra. Chittavrittis which are mentioned here, I have mentioned here is Pramana, Viparyaya, Vikalpa, Nidra, and Smriti, and yoga helps us to overcome that. Next, moving ahead, yoga understands the nature of our nature, and it is not merely a state to be reached, but it is or maintained. It is the oldest holistic concept, and health and well-being is a dynamic continuum of the human, and Yoga Chikitsa can be a first man attempt at unitive understanding of mind, emotions, physical health, and dimensions of health. Later, let us move on to the Ashtanga Yoga. Ashtanga Yoga includes Yama, Niyama, Asana, Pranayama, Pratyahara, Dharana, Dhyana, Samadhi. It is mentioned by Patanjali Yoga Sutra. Let us move ahead to each limb or each anga. The first one is Yama. Yama includes Ahimsa, Satyam, Asteyam, Brahmacharya, Aparigraha. Ahimsa means truth. Ahimsa means non-violence. Satya is truth. Brahmacharya, celibacy. Aparigraha, no desire for others' wealth, and asteya, non-stealing. Now, further moving ahead to the niyama. Niyama mentioned are, according to Patanjali Yoga Sutra, are Shaucha, Santosha, Tapa, Swadhyaya, Ishvara Pranidhana, Niyamaha. Shaucha is cleanliness. Santosha means satisfaction or contentment. And Tapa is penance. Swadhyaya is self-study or self-awareness. Ishvara Pranidhana means dedicating or surrendering to God. Let us move to the third limb of Ashtanga Yoga, that is asana. Patanjali Yoga Sutra defines asana as Sthiram Sukham Asanam. It includes yogic postures, helps to attain the further steps, control over the physical body, and leading to the control over our being. Now, if we practice asana slowly and steadily, it will give the physical and mental relaxation, agility, balance, endurance, and great vitality. Now, let us move ahead to the fourth limb of our Ashtanga Yoga, that is pranayama. Prana and ayama brings about the pranayama. Prana is breath, vitality, life. Ayama is length, stretch, or expand. When we expand the breath, we control over it indicates the control over our breath, and after the mastery over asana, we are going to control our breath, and with that we are going to master over our other angas of the Ashtanga Yoga. And hence, when we are having a prana vayu stability, so does our mind have a stability. Now, later moving ahead to pratyahara. Pratyahara is the fifth step or the bridge of Ashtanga Yoga. We have Antaranga and Bahiranga Yoga. This is the fifth step, and it is the bridge of Antaranga and Bahiranga Yoga. It leads to deep relaxation, accessing peace and silence within, isolate from the distractions of world, and withdrawing the senses inward. Let us move around ahead to the dharana. Dharana is withdrawal from the mind, withdrawal of mind from the senses and concentrating on a specific region. It binds the mind with particular aim, and that we consider as dharana. Dharana in this mind is in ekagra avastha, after the withdrawing of the senses from withdrawing the mind from the senses. Here we concentrate on the Agnya chakra, Swadhisthana chakra, Anahata
Hello,
chakra.
doctor. Doctor, you are exceeding the time limit, doctor. Can you speed up your presentation?
Yeah. So mind with with this we have mind with particular aim and stabilizes the attention, leading to higher mental capacities. Now, next one is dhyana. Dhyana gives us deep attention, thought or chakra, continuous thought about the same object, which leads with no deviation and ekagra avastha. Now, there are two types of dhyana, that is saguna and nirguna dhyana. Moving ahead to the last anga of our Ashtanga Yoga, that is samadhi. Samadhi is a deep state of meditation wherein the practicer or the yogi forgets about everything, including themselves. In this, the subject and act are one, and there are two types, that is sampragnata and asampragnata samadhi. Now, when one practices samadhi, they lead to the state of bliss, joy, happiness, and there will be a merging of Jivatma and Paramatma. Now, discussion. Yoga is an education, character building. Yoga has its references from Upanishad and classics like Hiranyagarbha, Bhagavad Gita, etc. Now, it was practical then, and as well as it is practical now because of the globalization, technological advancement, and work culture. There are changes in the nature. So Ashtanga Yoga is a gateway into practice of hundreds of yoga postures, and everyone can practice Ashtanga Yoga. With regular practice, it has abundant benefit. This is the yoga module which one can practice every day, which include Omkara, Mantrocharana, Chalana, Kriya, standing series, sitting, supine, prone series of asana, followed by pranayama and dhyana. These are the few apps which one can use for the daily practice of yoga. Now, concluding the session, the yogic way of living is a vital tool that helps to attain the state of health. It is more important to have both sense of being healthy as well as feeling healthy. For psychological reconditioning, we have yamas and niyamas to help us. And for stress management and metabolic activities, we have asana, pranayama, and surya namaskaras, which leads to the contemplation, visualization, sense of inner calmness, and well-being. These are the list of references. Thank you.
Thank you, Dr. Megha. Next, I invite Dr. Manasini Kea for the paper presentation.
Yes, sir.
Doctor, please share the screen, doctor.
Am I visible, sir?
Yes, doctor. Screen is visible, doctor. Please start, doctor.
Namaste everyone. Myself Dr. Manaswini K, first year PG scholar from the Department of Rasashastra and Vaishajya Kalpana, SDM College of Ayurveda and Hospital, Hassan.
Now I am going to present on Rasakarpura, a mineral formulation. These are the contents. As an introductory note, Rasakarpura is a Kupipakva Rasayana and it is a Nirgandha Murchita Parada Yoga. If we think why the name Rasakarpura, because it is made up of Parada and looks similar to that of Karpura. We come across various references of Rasakarpura. One such important method of its preparation is given by Ayurveda Formulary of India and Rasataranginis is as follows. 1 pala of Shuddha Parada and 1.5 pala of Gandha Kamla should be taken in a glass beaker. This should be kept over a tripod stand and heated with the help of a spirit lamp. Heating should be continued till all the liquid portion is evaporated and the resulting powder should be collected and dried. This dried powder is mixed with equal quantity of Saindhava Lavana and triturated to form a homogeneous mixture. This mixture is taken in a Mrit Vastra and heated for 4 yamas in Valuka Yantra. Then this should be left for Swangashita and later the medicine should be collected from the neck of the bottle. Rasayana Sara Sangraha explained 2 methods of Rasakarpura preparation which has variation in ingredients from the one said earlier. In first method, Tankana, Madhu, Laksha, Urna, Gunja and Parada are to be taken in equal quantity and Bhavana should be given with Bringarajasvarasa. This is subjected for Urdhvapatana. In second method, Kasisa, Saindhava Lavana and Parada should be taken in equal quantity and are triturated with Vajrasvarasa, that is Euphorbia nidifolia. This mixture is taken in an iron vessel and closed with a lid. This is heated over Lavana Yantra. Here the dose of Rasakarpura is mentioned as 2 valla, that is 6 rati, and the Lavanga should be used as Anupana. If given in this manner, this causes Rechana in 2 hours and this is indicated in various conditions. According to Ayurveda Prakasha, in first method, 1 kudava of Gairika, Tuvari, Khatika, Saindhava, Guda Churna, along with 1 kudava of Parada should be taken and heated for 2 days. In second method, Shuddha Parada, Gairika, Ishtika, Khatika, Spatika, Saindhava Lavana, Valmika Mritika, and Kshara Lavana are used. According to Rasamritam, ingredients used are Spatika, Navasadara, Kasisa, Saindhava Lavana, Suryakshara, Tutha, Tankana, and added with equal part of Parada. Here is a special mention of 2 karcha of Malla, that is Gauri Pashana. This should be heated in Valuka Yantra for 12 yama. These are few references. Coming on to Guna Karma and Amayika Prayoga of Rasakarpura, it is mentioned that Bahubhuta Vishapaha, that means it is effective in Krimi Visha and various infections. It alleviates Tvak and Rakta doshas. It is Grahi and Ruchivardaka. It also increases Jataragni. It cures diseases like Atisara, Krimi Roga and Pravahika. It is also indicated in Spota, Kandu, chronic Mandala and other types of Kushta, along with Firanga and pain due to Vrana. If it is given in excessive dosage, there are chances of toxic influences. Here is a special mention that if Rasakarpura is added in 16 parts of cold water, it dissolves completely. This can be considered as a test for perfectness of Rasakarpura. And if Rasakarpura is administered in suitable dose, it helps to mitigate various diseases. The dose of Rasakarpura varies between 1/64 rati, that is 1.9 mg, to 1/32 rati. Rasakarpura can be used in various forms like solution, Churna, Gitika, and Bhutagna Chakrika. For solution, 5 rati each of Chulika Lavana, that is Navasadara and Rasakarpura, should be dissolved in 60 tola. Its dose is 30 to 60 bindus. In Churna form, the maximum dose of Rasakarpura is 1 rati. Here, Tvak Churna 5 masha and 1 rati of Rasakarpura triturated with required quantity of Nimbu Amla. In Rasakarpura Gutika, ingredients from Kunkuma Kesara to Jatri Patri should be taken in 1 masha and 1 rati of Rasakarpura should be given Mardana with Nimbu Rasa, and Vati of 1 Gunja Matra should be prepared. This is indicated in acute syphilis. Bhutakna Chakrika, here Rasakarpura 73 parts and Nimbukamla 38 parts should be used, and Chakrikas of 6 Gunja Pramana are prepared. It is indicated in infections and animal bites. There is a special mention of Rasakarpura Drava in Rasatarangini for external application or wash. There are 2 different methods for its preparation, and based on different conditions, various dilutions have been explained. For example, 1:1000 for Firangaja Shofa or Vrana, and 1:2000 for Chirota Vrana, 1:5000 for Komalangas. On general wash, this Rasakarpura Drava acts as antiseptic. These are the images of stages of preparation of Rasakarpura. Related articles, total 53 methods of preparation of Rasakarpura are available in Classics of Ayurveda. Rao PG et al. Had prepared Rasakarpura in 4 sets. In first set, Parada, Gandhakamla and Saindava Lavana are used. The final product was mercury chloride. In second set, Parada and Saindava were kept constant and Kasisa was used. The final product was mercurous chloride. In third set, Parada, Tutta and Saindava Lavana were used. Here, mercuric and mercurous chloride were the final product. In fourth set, Parada, Spatika along with Saindava Lavana. Here also, mercuric and mercurous chloride was the final product. In this work, toxicity study of Rasakarpura was carried out on albino rats and compared with that of mercury chloride. This study concluded saying that at 5-fold therapeutic dose level, Rasakarpura have toxic potential on multiple organs. Coming on to discussion, Rasakarpura is a Nirgandha Murchita Parada Yoga. Nirgandha Murchita Parada Yogas cannot be administered for longer duration as there is a chance of severe toxic effect. Their dose is also very much low, and Rasakarpura is also enlisted as a poisonous substance in Schedule E1 of Drug and Cosmetic Act. Rasakarpura is a combination of mercury chloride and mercurous chloride if prepared by traditional method, and it is 98% mercury chloride if prepared by Rasatarangini method. As it is having Tvak Rakta Dosha Shamana and Grahi properties, it is indicated in Atisara, Pravahika and infectious conditions like Vrana, Piranga and other Kushtas. There were total 77 formulations found in various classical texts in which Rasakarpura is one of the ingredients. Coming on to conclusion, Rasakarpura can be used in various disease conditions with utmost precaution considering dose, Bala and Kala, etc. Thank you.
Thank you, Doctor. Next, I invite Dr. Tanushree N. Nair for the paper presentation. Dr. Tanushree, are you there? Hello, Dr. Tanushree, are you there? Next, I invite Dr. Akash Rathod for the paper presentation. Dr. Akash Rathod, are you there? Dr. Akash Rathod. Dr. Akash Rathod, are you there? Doctor, please unmute, Doctor. Dr. Akash, please unmute, Doctor. Okay, next I invite Dr. Gaurav Lakshman Yetmal for the paper presentation.
Yes, sir.
Okay, Doctor. Please share the screen, Doctor.
Yes.
Your screen is visible, Doctor. Please start.
Okay, sir. Myself Vaidya Gaurav Lakshman Yadma, PG Scholar, second year, Government Ayurvedic College, Nanded. My topic is concept of nourishment of Dhatu according to Ayurveda, Dhatu Poshan Nyay. Dhatu is Sharir Dharnat Dhatva. There are 7 types of Dhatu in our body. Rasa, Rakta, Maunsa, Meda, Asthi, Majja and Shukra. Dhatu Poshan takes place by 2 ways. First one is through Ahar Rasa and second by previous Dhatu nourishes next Dhatu. During dhatu portion, upadhatu also get nourishes. First, aharas nourishes whole dhatu like 7 dhatu: rasa, rakta, masa, meda, asti, majja, and shukra. It contains all necessary nourishing material of sapta dhatu. Aharas through every strotas reaches to dhatu and nourishes that particular dhatu. During nourishing of the dhatu, Agni plays a major role in nourishment of dhatu. Jatra Agni convert the ahar in Panchabautik ahar into ahar ras. Dhatu Agni is the type of Agni is present in strotas of each Agni. This Agni is responsible for conversion of ahar ras in dhatu. After the action of dhatu Agni, upadhatu, dhatu mal, and sar dhatu is formed. In the nourishment of dhatu, Vyan Vayu also plays major role. Vyan Vayu gives speed to ahar ras for circulation. There are Shirdadi Nyay, Kedar Kulya Nyay, Khalil Kapot Nyay, and Ekal Dhatu Poshan Nyay. According to Shirdadi Nyay, according to Chakrapani, ahar ras is digested by Agni and converted into Rakta Dhatu. Rakta Dhatu digested by Agni and converted into Mans Dhatu. In such a way, previous Dhatu completely digested and converted into the next Dhatu. It is explained by the example of milk converted into the ghee. We know that after milk after processing converted into the curd after processing converted into the butter, and then butter after processing converted into the ghee. Dhatu portion occurs in same way. So this is also known as Kshir Dadine. This is a complete conversion of one dhatu into another dhatu. So it is also known as Sarvatma Parinam Paksha. The process of the nourishment of dhatu is from ras to shukra systematically and serially. So also known as Kram Parinam Paksha. The next is Kedar Kulya Nyay. Kedar means field and Kulya means channel. This law is explained with the example of watering of field. When water is provided to field through the channels, water sucks by field through different channels. Similarly, nourishing fluid, that is ahar ras, nourishes ras dhatu. First, whatever nutrient of the ras dhatu is necessary is taken out. That part is converted into ras dhatu by Swadhatu Agni, that is Rasa Agni. This whole process occurs in that dhatu strotas. After this, ahar ras forward to the Rakta Dhatu. Rakta Dhatu takes out its nourishing material and forward ahar ras to Mans Dhatu. In this way, nourishment of Sapta Dhatu up to Shukra Dhatu occurs. This is also known as Anshansha Parinam Paksha. The next is Khale Kapot Nyay. Khal means storage house and Kapot means birds. Birds pick up whatever food they need and back to their places. Similarly, every dhatu pick up its nourishing material from storehouse and nourishes own dhatu. The one who near this storage house get nourishes earlier, and the one who is far from the storehouse nourishes later. Dhatu Poshan Kal. According to Sushrut, Charak, Parashar, there are different time required for the portion of the dhatu. Merits and demerits. Shir Dadina merits. The sequence of nourishment of 7 dhatu is uniform. The time for the nourishment of dhatu is as per Sushrut Samhita. Demerits of Shir Dadina. According to the Nyay, if one dhatu is completely converted into another dhatu, means previous dhatu, after some days there is no previous dhatu in body. But this is not happen. So this is not accept completely. Next is Kedar Kulyana and Khale Kapot Nyay. Both Nyay are equivalent to each other. Merits of the Kedar Kulya and Khale Kapot Nyay is this law explains immediate action of the milk on Shukra Dhatu. Demerits are they cannot explain nourishment of the dhatu from rasa to rakta to mas as well. Ekal dhatu poshana is explained by Arun Datta. Conclusion. During the nourishment of dhatu, all 3 laws work together. First is Kshirdadinay. To supply the aharas up to dhatu is well explained by Kedar Kulyanay. Taking of the nourishing material from aharas is well explained by Khale Kapot Nyay. and the conversion of the nourishing material to the Prakrut Dhatu is well explained by the Kshirdadi Nyaya. Thank you.
Thank you, doctor. Next, I invite Dr. Akash Rathod for the presentation. Dr. Akash Rathod, can you hear me? Dr. Akash Rathod, can you hear me? Dr. Akash, please start your presentation.
I am audible, sir.
Yes, doctor. Audible, doctor. You are audible, doctor.
My case study is Ayurvedic management of hyperacidity in cause Amla Pitta. Hi, I am Dr. Akash Vittalrao Rathod, PG scholar. Good evening, everyone. Contains introduction, aim and object, material, method, results, and discussion conclusion. Hyperacidity, also known as acid dysphagia, is a common issue bothering most people. It is a medical disorder where the stomach produces excess of acid, mainly hydrochloric, by the gastric. Correlated with the Amla Pitta in Ayurveda. Amla Pitta can be correlated with the various gastroesophageal reflux diseases like gastritis, dysphagia, heartburn, peptic ulcer, hyperacidity, etc. As is said in modern science, aggravated Pitta impairs the digestive fire, leading to improper digestion of food and production of toxins like Aim and objective to study the Ayurvedic medicine in hyperacidity, Amla Pitta. Objective to reduce the intensity of the heartburn with nausea, vomiting, anorexia, and headache. Case report. A male patient of age 47 years old came to Kaichik's OPD of our institute. Chief complaints are patient had headache with the nausea and vomiting 3 to 4 episodes. Also have a severe heartburn. All the above complaints are from the last 2 months. Patient is patient's occupation is he is a bus driver. Mainly history of present illness. There is no history of diabetes, mellitus, hypertension, no history of any trauma and fall. Personal history patient has mixed diet, appetite is good, bowel incomplete evacuation 1 day, maturation normal, sleep disturbed because of pain, addiction, alcohol and tobacco chewing, digestion, patient has complaints of indigestions. Nadi is वात पित्तज, शब्द स्पष्ट, मल असम्यक, स्पर्श अनुष्ठित, मूत्र सम्यक, दृक प्राकृत, जीवा साम, आकृति मध्यम. On examination, general condition is moderate or febrile. Respiratory is by aerated bilateral equal. CVS S1 S2 are normal. Patient is conscious and overrated. BP was 110/70 and pulse rate 88. All routine investigations are normal. सम्यक संप्राप्ति घटकार दोष पाचक पित्त समानवात क्लेदक कफ दुष्य रस धातु अग्नि जठर अग्नि स्त्रोतस अन्नव रसव उद्भव स्थान आमाशय संचयस्थान महास्त्रोतस रोगमार्ग अभ्यंतर साध्यता निदान पंचक विहारज हेतुजार विहारज हेतु दिवास्वाप वेगधारण मानसिक हेतु चिंता शोक क्रोध भय कालज हेतु दिवास्वाप प्रावृत आहार हेतु कटु उष्ण लवण रस सेवन विषमाशन अजीर्ण दधी सेवन प्राशुद्ध आहार आणि विरुद्ध आहार पूर्वरूप increase the intensity of headache along with the nausea, vomiting, heartburns and anorexia. उपशय by मधुर आहार and विश्रांती. संप्राप्ति हेतु सेवन it will lead to agnish dushti with pitta sanchiti, amdosh avipak pitta prokop that leads to ati amla ati drav pitta vruddhi and complaints are rullas shrushla amla satan amla pitta. Treatment was given to the Nidan Parjivajan is the first treatment given to the patient. Then Avitika Churna 1 gram before meal with lukewarm water for 15 days. Lagu Suchekar 2 tablets with Amalki Churna 250 milligram with Yashtimadu Churna 250 milligram. Shatavari Churna 250 milligram for 3 days with lukewarm water after meal for 15 days. Bunyimbadi Kashai 15 ml 3 days after meal with lukewarm water in HS given with the 10 ml air and snail for 15 days. Results and assessment. Headache, anorexia, nausea, vomiting, heartburns are the subjective criteria. Before treatment and after treatment criteria is shown on screen. Discussion. In daily routine, it has been seen that so many patients are suffering from the Ambla Pitta disease. This is the burning issue of the nowadays. The ingredients of Avitika Churna exhibit anti-ulcer properties, expert cytoprotective effects on the gastric mucosa. It decreases the gastric secretion, increases the mucosal resistance, and potentiates the defensive factors of the gastric mucosa. Bunimadi Kashai relieves the pain and burning sensation in the stomach. It is an effective digestion, belong the nausea, loss of appetite, and blenching. Acharya stated mainly Virichan Karma for the Pitta dosha. Enresneina HS with the Bunimandi Kashaya will help for the Vatanuruman and with Pitta Shaman. Conclusion: the best treatment of Amla Pitta is to avoid causative factor that is Nidan Parivarjan and maintain good lifestyle habit. The symptoms of the hyperacidity like headache, nausea, vomiting, and heartburn decrease after the given treatment. Thank you, everyone.
Thank you, doctor. Next, I invite Dr. Taragesh for the presentation. Dr. Taragesh, are you there? Dr. Taragesh, are you there? Next, I invite Dr. Anukirt M for the paper presentation. Dr. Anukirt, are you there?
Yes, sir.
Okay, doctor. Please share the screen, doctor. Your screen is visible, doctor. Please chat.
Okay, sir. Myself, Dr. Anagit, first year PG scholar, Department of Swasthya from Sri Sri College of Ayurvedic Science and Research Hospital, Bangalore. Am I audible, sir?
Yes, doctor. Audible, doctor.
Okay. The title of my presentation is Understanding the Principles of Shodhana Karma in the Management of Lichen Planus. So these are the contents. Moving on to introduction. Lichen planus is a chronic inflammatory immune disease that affects mucosa, scalp, and nails. Although the exact underlying cause of lichen planus is unknown, it is observed that autoantigen collagen 17 is associated with the development of disease. Kitipa Kushta included under Shudra Kushta, which simulates with the signs and symptoms of lichen planus. Lichen planus can be triggered by hepatitis infection, flu vaccine, certain pigments, chemicals, and metals, pain relievers such as ibuprofen, naproxen, certain medication for heart disease, high blood pressure, or arthritis. Now let's compare the symptoms of lichen planus and Kitipa Kushta. The symptoms of lichen planus are thick and rough patches with scaly lesion, flat top, polygonal papules and flakes with angular borders, symmetrically distributed, recurrent pruritic inflammatory eruptions, and the lakshanas of Kitipa Kushta are Shava, Kinnakara Sparsha, which is hard to touch, Vrutam, round and coin-shaped lesions, Ganam, well-defined borders, Vruddhamandi, spreading in nature, Snigdha, and finally Prashanti cha Punar Utpadyanti, which means it subsides and relapses. Moving on to Samprapti. Due to Nidana, the dosha aggravates. It causes Agnimadhya and it produces Dhatu Shaitilyada. Among all dosha, Kaphavada dosha is aggravated predominantly and causes Shaitilya of Tok, Rakta, Mamsa, and Lasiga. It obstructs Lomakuva and leading to the Sangatmaka Vigirdi in Sweda Hasrodas. This Prakupita dosha enters to Rasa Raktadi Paribhavana, which means systemic circulation, and especially in Tiriac areas. Finally, it gets lodges in Bahya Rogamarga and resulting in Mandalotpati, which is formation of skin lesions. Moving on to discussion. In this section, an attempt is made to evaluate the efficacy of Virechana in the management of lichen planus. As per Ayurveda, poor metabolism leads to the production and deposition of ama and endoxin. When this ama associates with the immune cells, it results in the abnormal behavior. This causes autoimmune disease. So the proper treatment of any autoimmune diseases, this ama needs to be expelled out of the body. Panchakarma is the tool for this. Deep cellular level removal of toxins should be planned for the treatment of autoimmune disease. As we all know, in Kushtitis, Bahudosha Nirharna is contraindicated because it may lead to further weakening of the body due to Vata Prakopa. Virechana is one of the Shodhana Chikitsa, specially advised in Pitta and Rakta Pradhana disorder, and it is very effective in various skin diseases. Though Kitipa is Vata Kapha dominating skin disorder, it is primarily due to the vitiation of Rakta Dhatu and Sudosha. Now let's discuss the role of Snehana. In lichen planus while doing snehapana with panchatikta krida, kadriyatikta krida or mahatikta krida, the essential fatty acids which are required for the lipid barrier of the skin is increased. This will correct the epidermal fluid loss, making the skin susceptible for the reaction. So the Grida play a role in enhancing the lipid barrier. Grida has lipophilic action, so it helps in ion transportation to the targeted organ. This lipophilic nature of Grida helps the entry of drug into the cell and its delivery to mitochondria and nuclear membrane. Also, it helps in restoring the normal texture to the skin. Moving on to the Ayurvedic part. Pacification of kapha dosha helps to subside itching, boundaries and thickness of plaque and adhesion of plaque. Owing to the pacification of vata dosha, roughness, dry scaling, as well as blackish brown patches in lichen planus subsides. So all these properties that act mainly at the cellular level and it improves the cell cycle, so helps in decreasing keratinization of the cell layer. Moving on to the role of Svedana. During Svedana, there will be increase in the body temperature. It stimulates the sweat glands via hypothermic action of sympathetic nerve. It increases the sweat production, so more waste removal occurs, and Svedana corrects Svedavha Srodhodushti. Svedana does vasodilation, so the permeability of the blood vessel wall increases. It helps immune cells to effectively reach the affected area. And finally, helps in the cell regrowth and promote healthy skin. Mode of action of Virejana. As we all know, the properties of Virejana drugs are Sukshma Guna, Vikasi Guna, Tikshna Guna, Ushna Guna, and Saratva Guna. By the virtue of Sukshma Guna, Virejana drugs can pass through the minute channels of the body and reach at the cellular level to act at the site of pathogenesis of lichen planus. Due to Vikasi Guna, Virejana drugs are dispersed in the whole body without the digestion and help to the loosening of dosha dusha sanghadana. Tikshna Guna has strong potency to open the various channels to flush out the toxins by enhancing the opening of various srodhas. It softens the tight dosha dusha sanghadana and make them ready to flow through the open srodhas. By the virtue of Ushna Guna, dosha dusha gets melted due to its hotness and easily moves to the alimentary canal after liquefaction. And finally, due to Swaratva Guna, the dosha dusha are encouraged to pass out to the rectum by its laxative property. Now let's discuss the probable mode of action of lichen planus in controlling the symptoms. The symptoms such as asvedanam, absence of sweating. Here the mode of action goes like this. Virejana Dravya has Srodoshodhaka property, opens the microchannels and improves circulation, resulting in perspiration. Symptoms such as Vruttam, Snigdam, Ganam, large round point shape with well-defined borders. It is seen due to the vitiation of Kapha dosha, Rakta Dhatu. Virejana with Pitta Kaphagara property corrects Rakta Dhatu, thus reducing big lesions. Shava, Parushya, Kinnakara Sparsha, which is blackish, scaly, hard lesions. It is also called as hyperkeratinization. It is due to the vitiation of Tridosha. Virejana act on all dosha and control scaling. Candle grease sign. It indicates increased Sukshada and Karaguna in Tuk. It is caused by the vitiation of Vada dosha. Virejana corrected by Vada and Lomana and ultimately reducing the Rukshata. Hospit sign. It is mainly due to the vitiation of Pitta and Rakta dosha. Virejana removes vitiated Pitta dosha and Rakta, thus reducing the Daha. Kandu. It indicates involvement of Kapha, Rasa, Rakta dosha. Virejana has Pitta Shodhaga and Rasa Rakta Prasadana property, so it reduces itching. Moving on to conclusion, high potency topical corticosteroids, antihistamines, and oral retinoids and immunosuppressants are used in the first line treatment. These corticosteroids have adverse psychological effects, thus affecting the quality of life of the patients. Ayurveda recommends on the root cause of the disease and reversal of the pathology. Whatever the diseases might be, toxins are always involved in a disease. Therefore, the best way to treat a disease is to remove the deep-seated toxin. So the line of treatment according to Ayurveda will be as follows. First one, toxin removal, then metabolism correction, then increase in ojas production, and finally immune system correction. In addition, Shamani Yoga Bahirparimarjana Chikitsa is administered after taking proper course of Shodhana, which then provides additional relief and thus help in the eradication of lichen planus. Thank you.
Thank you, Doctor. Next, I invite Dr. Sushmita Bharadwaj for the paper presentation. Dr. Sushmita, are you there? Hello, Dr. Sushmita, are you there? Next, I invite Dr. Amal Shivajirao Patil for the paper presentation on the topic Mutrashmari. Dr. Amal Patil, are you there? Dr. Sushmita, okay, doctor.
Yeah.
Hello, Dr. Sushmita.
Yes, sir.
Okay, doctor. Please share the screen, doctor.
Yes.
Hello.
Hello, doctor.
Sir, there is some issue with the connection. Can I do after this one more presentation?
Okay, doctor.
Okay, sir. Thank you.
Dr. Amal Patil, are you there? Dr. Amal Shivajirao Patil, are you there?
Yes, sir. Yes, sir. Just a minute.
Okay,
Hello, sir.
doctor. Okay,
Did you
doctor.
listen to my voice? Hello.
Hello, doctor.
Sir, did you listen to my voice?
Yes, doctor. Yeah,
Okay. Can
you are
I
audible,
share my
doctor.
screen?
Sure, doctor. Please share the screen, doctor.
Just a minute, sir. Oops. Sir, my PC is just hang
Yeah.
out. Just I share my mobile screen. It's okay.
Okay, doctor. Your screen is visible, doctor. Please chat.
Okay. Good afternoon. Myself, Dr. Amol Patil from ASMBT Institute, Nashik. My topic is Mutrashmari. My guide is Dr. Shilpa Bade, ma'am. Sir, did you listen to my voice?
Yes,
Hello?
doctor. Yes, you are audible, doctor.
Okay. So, introduction of the Mutrashmari. The disease Mutrashmari is one of the Ashtamahagada formed in the urine system. Based on the clinical basis, it is compared to erythrolysis. It is a conscious of multifaceted physiochemical process which involves sequence of events in the formation of any urine stones. It has follow urine. It is follow as like Nidan. It's first urine saturation. It after it become urinary supersaturation, then nucleation, then crystal growth, then crystal aggregation, then crystal retention, and finally stone formation. The lifetime prevalence of systemic erythrolysis is approximately 10% in men and 5% in women. The probability of the second stone formation within 5 to 7 years is approximately 50%. There is various risk factors have been identified, and these include a family history of urine stones. Nirukti of the Mutrashmari. It implies that Ashmari is word term for those objects resembling like a stone. Ashmari or calculus look like small gels or stones, hence they are termed as Ashmari. Nidan. Consumption of contaminated water, food, which is disturbed, lifestyle changes, low intake of water, consumption of salty foods, and packed soup may be a causative factor of disease. Some causes are like hereditary, geographic conditions, and socioeconomic conditions also play vital role in the disease. Pururup of Mutrashmari. Mutrashmari possesses symptoms like abdominal pain, dysuria, hematuria, burning sensation through urinary tract, and the prevalence of disease mainly occurs in hot, arid areas than temperate regions. Samprapti, according to Ayurveda, Ashmari involves the development of calculus as a foreign body inside the urinary system, in the kidney, ureter, or bladder. First, like Nidan, we discussed about Samprapti. First, Mithya Ahari we are without Shodhana. Then it formed to Vata and Kapha dosha, Urchana. Then vitration of Shisha. Then vitiated Shleshma mixed with Bastigat Mutra. And then Basti Mutra turned into Ashmari. And finally, Mutrashmari happened. This is pathogenesis. Etiology factors are in this lifestyle, fluid intake, then low urinary volume. Then it happens hypouremia or acidic urine, lack of citrate, low level magnesium. Then it formed to pyrophosphate, then accumulation of waste or calcium deposition, and finally stones formed and it's obstruct in the urinary path. It is believed that dried up urine by Vayu and Ashmari lead calculus development in the urinary system. Another cleaning procedure and necessary dietary habit leads. Kapha dosha by Vata Pitta dosha also initiate the Mutrashmari. Classification as per Ayurveda. Ayurvedic science also describes various types of calculi as follows: Vatak, Pittak, Shleshma, Shukraja. This is also a common type of Mutrashmari. Table on various type of Mutrashmari and descriptions. First, Vatashmari. Vatashmari formed due to dusty, its symptoms like a dusty, hard, irregular, and rough stone, severe pain during passage of urine and stools. And second is Pittashmari. A Pittashmari stone is like reddish, yellowish, and blackish stone, sucking pain, burning sensation, and Ushnavata. Third is Shleshmashmari. It's a white, uncoutous, and big size stone. Its symptoms like a dysuria, increasing and picking pain. Fourth is a Shukrashmari, mainly found in adults like Shukra, frequent coitus and coitus interruption. Symptoms dysuria, swelling, and lower abdomen pain. These are some pictures of the Mutrashmari. Ayurvedic management of the Mutrashmari. Acharya Sushrut, Charak, and Bhagavad mentioned several types and approaches in the management of the Mutrashmari, like a shaman therapy, Shodhan therapy, Kshar therapy in the Pittashmari and Shukrashmari. The basic treatment we use in Ayurveda is Gokshuradi Yoga and Pashan Bhedi Gruta. Gokshuradi Yoga and Pashan Bhedi Gruta recommended for the management of Mutrashmari. Gokshuradi Yoga possesses diuretic and lithotropic qualities, while Pashan Bhedi Gruta offers symptomatic relief in this condition. It also offers soothing, cooling, and diuretic properties. Formulation helps to relieve symptoms such as Nabi Vedana, Basti Vedana, Mutra Sangha Vedana, and Surudi Mutra. The author of present article also worked on efficiency of Gokshuradi Yoga and Pashan Bhedi management of Mutrashmari. Finding of study proved efficiency of formation of Mutrashmari. Also, we use the Varunadi Kvata. Varunadi Kvata with Yavakshar Prakshepa reported to possess beneficial effect in erythrolysis. Application of Varunadi Kvata and Yavakshar Prakshepa along with the Pathya plana offers significant result in the management of disease. The ingredient of Varunadi Kvata such as Varuna, Kshali, Vedak, Shunti, Gokshur, and Yavakshar help to relieve symptoms such as pain, burning ulceration, hematuria, and dysuria. We also use Apamarg Kshar and Yavakshar. Apamarg Kshar along with the Yavakshar possess disintegration, dissolution, disloading, and explosive property. Therefore, recommendation in Mutrashmari. Kshar is formed by Bhasmikaran, which make drug possess its gunas of water. Bhasmikaran also impact Kafagna and Vatagna properties into drug. It also offers capacity to break into its Agni Kshar process. Lavan Ras also used in Ashmari Vedana. So mainly we Apamarga and Avakshar is mainly used for this. Also we use recommended yoga Mutrashmari is Vajrasana, also Pavan Muktasana, Uttara Padmasana, Dhanusana, and Pranayama is also used in Mutrashmari disease for treatment basis. Finally, conclusion is Mutrashmari is a disease of urinary system and obstruct urinary path, which term as a stone in modern science. The Mutrashmari mainly occurs due to calcium deposition, which may be associated with lack of citrate and other related factors. Approximately 5 to 10% people are suffering from common symptoms like ureter calculi, pain, hematuria, burning, ulceration, and dysuria. Ayurveda described various treatment approaches like we discussed, like management and disease, use of herbs, formulation of kshar, lavan. The good conduct of life is ahara vihara is also play major role in the management of disease. So this is Mutrashmari. Thank you for listening. Hello.
Thank you, Doctor.
Yes, sir.
Next, I invite Dr. Midhu Krishnan for the paper presentation. Dr. Midhu, are you there?
Hello, sir.
Hello, Doctor.
Hello.
Please share the screen, Doctor. You are audible, Doctor. Please share the screen, Doctor.
Okay. Hello.
Your screen is sharing, Doctor. It's not visible. It is on sharing. Now visible, doctor. The screen is now visible, doctor. Please start.
Okay, sir. Myself, Dr. Midhu Krishnan, second year PG sir. Hereby presenting you a preventive approach to Prameha. Moving on to the introduction. Prameha is one among the Ashtama and considered as Agni among Anshanki with Prabhuda Avina Mutrada. Prameha can be taken as a clinical entity for the type 2 diabetes characterized by reduced sensitivity to the action of insulin and inability to produce sufficient insulin to resistance. Coming to the problem statement, in India, in global prevalence is estimated to be 463 million, rising to 578 million by 2030 and 700 million by 2045. In India, in 2019, 77 million individuals had diabetes, which is expected to rise over 134 million by 2045. The overall prevalence of diabetes was found to be in 16% in Karnataka. There are mainly two types of risk factors: non-modifiable risk factors and the factors that cannot be modified are non-modifiable, such as age, gender factors. The factors which can be modified as modifiable risk factors as lifestyle, unhealthy diet, alcoholism, sleep. These risk factors can be prevented by there are 4 types of levels of prevention: primordial prevention, prevention. Primordial prevention is the prevention in its purest sense. Educators need to prevent the risk factors that efforts are directed towards the children and the harmful lifestyle early childhood. Moving on to the primary prevention, the action to prevent there are two high risk strategy and population strategy. It is reduced in environmental risk factors which prevent the such as health nutritional habit, and in high risk there will be a change of sedentary life, overnutrition, obesity, avoidance of the alcohol, and using adequate high intake of dietary fiber and the avoidance of sweet foods, and maintaining a lifestyle. In Ayurveda, by the regular practice of dinacharya, consumption of ahara on time, intake of nityasevani ahara, nidra, non-controlling of the mutra vega, and following the sarva and the manifestation of the prameha. Moving on to secondary prevention. Secondary is the action that will halt the progress of the disease in its incipient stage to prevent the further. Main aim is to maintain normal blood glucose level, maintain normal body weight, and to further Ayurveda by the use of Bheshaj Sevana, Pratyahara, Vihara, Yoga, and Panchakarma. A key element in the secondary prevention is self-care. That is, a diabetic should take care of the responsibilities of medical guidelines with adhering to diet, regimen, examination of the blood glucose, and maintenance of weight, and monitor the glucose and insulin, and periodic checkup. And one should take care the protective care of the feet by use of a diabetic chappal, the feet clean, and file the nails, and the color or swellings, wounds, or cracks. This is DSM is the program that it is a process of facilitating the knowledge and the skill and necessary for the diabetic self-care. Combines 7 keys: blood sugar, regular adherence to the medications, and a good problem-solving skill, healthy coping skills, and risk reduction behaviors. The Patil has mentioned Acharya, Shali, Shashtika, Ataki, Kulata, Budka, Lava, Patola, Karavela, Yava, Shashtika, and Buduma indicated. These are the Patyaharas that which are explained by our Acharya. In Kulata, Budka, Chanaka, Ataki, Askrova, Sargas, Gajura, Trifala, Kapita, Ashmantaga, Jumbu, and Ishwarga, Madhu. So, let's move to some of the Krudana preparations. Dalaga Odna, Yusha, Sura Yusha, Evakavakya, Shali, indicated. Coming to the Patya Vihara, Vyayama, Vyasa, Padadicharya, Chankramana, Snana, Jala, Seka, Shayama, Ashwabahana, Nishijagrana is stated. Some of Sadasanam, Diva Nidra, Nava Anna, Mutra Vegam, Dumapanam, Veda Mokshanam. The Ahara Udaka Mamsa, Nishpava, Kushmanta, Navana, Ikshu and Rola contradicted. In Sugar, Navana, in Shamit, Anya, Nishpava, in Mams, Anuba Mamsa, Gramya, Udaka Mamsa, in Ikshu Vikara, Ikshu and Buddha, in Prudana Kalpa, Krishna. In Madhya Varga, Saviraka, Tushodaka, Sutta, Maira, Asa, Apathy, Dhumapanam, Swedanam, Rektamokshanam, Sadasanam, Divanidra, contraindicated. Going on to the tertiary, the measures that which available to reduce or disabilities or minimize the sufferings and promote the patient adjustment to the the disability limitations and rehabilitations. Disability limitations is limited to the complications and gaining in and rehabilitation for who have become disabled, handicapped due to complications resulting in blindness and dementia. Physically, mentally, socially, psychologically, and vocationally. Through Ayurveda, we can give Nishamalaki Prayoga and Shilajari Prayoga. These are some of the articles. But the yogas, some of the yogas like Paschimasana, Halasana, Naukasana, Bhujankasana, Vajrasana is indicated in Prayaga and some extent. Naukasana is having direct effect in the reduces stress level. Pranayama is like a Nadi Shuddhi basket to National Program for Prevention and Control of Cancer, Disease and Stroke. The main objective is to prevent and control the common and non-communicable changes. These are some of the
Hello, Dr.
coming
Midhu.
to the conclusion.
Doctor, you are exceeding the time limit, Doctor. Can you speed up your presentation?
Yes, sir. Yes. Effective lifestyle modification with the adoption of
Thank you, Dr. Midhu. Next, I invite Dr. Sushmita Bharadwaj for the paper presentation. Dr. Sushmita, are you there? Hello, Dr. Sushmita, are you there? Dr.
Hello,
Sushmita,
Dr. Sushmita.
please unmute, Doctor.
Yes, sir. Yes, sir. Hello.
You're audible, doctor.
Can I start the presentation?
Yes, doctor. Your screen is visible, doctor. Please chat.
Okay. Myself, Dr. Sushmita Bharadwaj from first year PG Scholar, Department of PG Studies in Swastha, Shri College of Ayurvedic Science and Research, Bengaluru. These are the contents of the study. Coming to the introduction, myasthenia gravis is a Latin expression that literally means that grave muscle weakness. This describes the weakness that happens when an autoimmune disease affects the skeletal muscles. Definition goes like myasthenia gravis is a chronic autoimmune neuromuscular disease that causes the varying degree of weakness of voluntary muscles. A weakness and rapid fatigue of the muscles under voluntary control. This condition is caused by the breakdown in the communication between nerves and the muscles. Although this condition does not run in families, they can be developed in the autoimmune conditions and more likely developing the myasthenia gravis. It mostly affects in different ages, both in men and women. Women under the age of 40 and men under the age of 60. This is the normal physiology of the muscle contraction acts. When coming to the myasthenia gravis, in around 85% of the patients with the myasthenia gravis, acetylcholine receptors antibodies are produced by the immune system. These binds to the postsynaptic neuromuscular junction receptors. This blocks the receptors and prevents the acetylcholine from being able to stimulate the receptor and trigger the muscle contraction. This blocks, as the receptors are used more during the muscle activity, more of them become blocked up, and this leads to less effective stimulation of the muscles, which increase by activity. You can see in the first picture. There is one more mechanism seen in cases. These antibodies also activate complement system within the neuromuscular junction, leading to damage to cells at the postsynaptic membrane. This further worsens the symptoms, which is seen in the second picture down. There are two other antibodies that causes in other 15% of the cases. These are antibodies against muscle-specific kinase, which is called as MuSK, and antibodies against low-density lipoproteins receptor-related protein 4. It is LRP4. MuSK and LRP4 are important proteins for the creation and organization of the acetylcholine receptors. Destruction of these proteins by the autoantibodies leads inadequate acetylcholine receptors. This causes the symptom of myasthenia gravis. The patients with myasthenia gravis will present with these symptoms when they are affected with the particular muscles showing the different symptoms. When it is affected to extraocular muscles, they show diplopia, which is double vision. Eyelid muscles will lead to ptosis, that is drooping of the eyelid, weakness in the facial movements, difficulty in swallowing, fatigue in the jaw when chewing, slurred speech, progressive weakness with the repetitive movements will be also noted. Examination. We can ask the patient to do the repeated movement like blinking of the eye, which shows the ptosis symptoms. Prolonged upward gazing will show diplopia symptom. Repeated abduction of one arm for like 20 times will result in unilateral weakness. And we can also check by thymectomy scar, where thymectomy will be done for the patient. And test the vital capacities, forced vital capacity, which shows it is affecting the lung muscles and all. Diagnosis can be directly done by relevant antibodies like acetylcholine receptor antibodies in 85% of the patient, muscle-specific kinase antibodies in 10% of the patient, LRP4 antibodies. CT and MRI also can be done to see the thymoma. Edrophonium test can also be helpful in doubt when there is a doubt in the diagnosis of myasthenia gravis. Coming to the treatment aspect, reversible acetylcholine cholinesterase inhibitors can be given, where they increase the amount of acetylcholine in the neuromuscular junction and improve the symptoms. Immunosuppressions like prednisolone and azathioprine can also be given. Thymectomy can be done where thymoma is seen in the patient. Monoclonal antibodies are also there, which acts as a supportive help in the cases of myasthenia gravis. Coming to the Ayurvedic view of myasthenia gravis, they are generally controlled by not, these symptoms can only be controlled but not completely cured. There is different way of understanding and managing in Ayurvedic science, which can give better results to help reduce and improve the muscle weakness. There is no direct reference as such in Ayurveda naming myasthenia gravis, but based on Nidana, Rupa, Upashaya, and Anupashaya, a probable diagnosis can also be made and treated accordingly. Due to vitiation of Vata and Kapha doshas at the site of muscles, it is also caused due to impairment of the metabolic fire, which is called Agni, which leads to the accumulation of ama in the body. The suppression of Agni leads to aggravation of doshas. Acharya Charaka and Maharogadhyaya enumerated several Vataja varieties of diseases. These are called as Atmarupas of Vata. Even when these inherent manifested partially, these can be diagnosed and treated as in case of Vata Rogas. This could be the elicited samprapti of the condition in Vata Vyadhi, Nidana Sevana causing Agni Mandya and leading to Ama Uttati. At the same time, Abhigata and other Vata Prakopa Nidana will also cause Vata Prakopa, and this causing Spiraguna Kshaya of Kapha dosha and Chalaguna Vidhi of Vata dosha, leading to Sthana Samshaya of Shas in and affecting the function of Sira Snayu Peshi Kandaras, leading to Vata Vyadhi Lakshanas. The symptoms include Shramsa, Bramsha, Vyasa, Sanga, Kampa, Toda, Supti, Sankocha, and Stamba. All these symptoms are associated with the vitiation of Vata dosha. Thus, the mode of treatment is Vata Vyadhi Chikitsa. Even the condition resembles the Lakshanas explained in the Kupita Vata as at Asti Majjagata level. By analyzing the Samprapti and clinical presentation of the condition, Vata Vyadhi Chikitsa, Asti Majjagata Vata Chikitsa, Ardhita Chikitsa, and Avarana Chikitsa concept can also be applied in the management. So Abhyanga, which is basically told in case of any Vata Vyadhis, Abhyanga followed by Svedana can be done with using any Vatahara Tailas like Dhanvantara Taila, Kshira Bala, Bala Lakshadi, etc. And as told in Asti Majjagata Vata Chikitsa by Acharya Charaka. And coming to Nasya can also be done in the form of Marsha Nasya as told by Sushruta Acharya. Nasya with medicated oil, like when medicated oil will be prepared along with Masha and Saindava Lavana, which also gives the better results. Or we can also use Anutaila in Nasya. Basti, both the Anuvasana and Niruha Basti combination can also be given. Shastika Shali Pinda Sveda, Avagaha, Ardhitava Chikitsa like Navana, Murni Taila, Nadi Sveda, Upanaha from Anupamamsa. Sushruta also says in Vata, if Vata is located in Skanda, Vaksha, Trika, Manya, Shodhana like Vamana, Nasya, Shira, Basti, Shiro Basti and Sneha Basti can be administered. We can choose these kind of Shodhana by checking the Bala of the patient. One can also opt for Ardhangavat Vata Chikitsa, like Svedanam, Sneha Samyuktam, Pakshagate Virechanam. Internally, there are some Kashayas which can be given in the Vata condition. These are the Kashaya, Aristas, and Gugulus, which can be chosen in Vata Vyadhis, Majja Vatagata Vyadhis also. Discussion. The main plan is to treat the condition from its root. Hence,
Hello,
initially,
doctor.
Nidana. Yes, sir.
Doctor, you are exceeding the time limit, doctor. Can you speed up your presentation?
Yeah, sure, sir. Hence, initially, we have to focus on Nidana Parimarjana, which is basically here Vataja Vihara, Ahara Vihara. And followed by that, we have to go to mild Shodhana, followed by any kind of Brahmana Chikitsa. In conclusion, when aggravated and single doshas may cause manifold disease depending upon the various etiological factors at the site of the sites of manifestation. So the physician should try to comprehend the nature of the disease based on the dosha, site of the manifestation and etiological factors, and then initiate the chikitsa. Thank you.
Thank you, doctor.
Thank you.
Next, I invite Dr. Suhail Ahmed A. Gundur for the paper presentation. Dr. Suhail, are you there?
Hello, sir. Hello. Hello, doctor.
Hello, doctor. Please share the screen, doctor.
Yes, sir. I'm here. Okay.
Your screen is visible, doctor. Please chat, doctor.
Okay, sir. Good evening, everyone. Myself, Dr. Suhail Ahmad, second year PG scholar from the Department of PG Studies in Swastarata. So today I am going to present the topic on Ahara and Yoga, a Patheya in lifestyle disorders. So these are the contents of my presentation. Introduction. In this era of modernization, change in lifestyle has led to lifestyle disorders, also known as non-communicable diseases. The modern world is facing a pandemic of lifestyle disorders that require changes to be made consciously by the individuals themselves. This is achieved by appropriate use of ahara, vihara, and achara. Ahara is given prime importance in this. So ahara sambhavastu rogascha ahara sambhavaha. Hita ahita visheshascho vishesha sukadukkayoha. The body as well as the disease are caused by the food. So the state of swasthasya swastharakshanam aturasya vikara prashamanam can be achieved. Also, yoga is the best lifestyle ever designed. It has potential in the prevention, management, and rehabilitation of the prevalent lifestyle disorders. So next is the problem statement of the lifestyle disorders. In India, almost 5.8 million people per year die due to any of the lifestyle disorders. And WHO has identified India as one of the nations that is going to have most of the lifestyle disorders in the near future. In India, rapid urbanization and globalization mainly contribute towards increase in the number of the people suffering from the lifestyle disorders. So moving on to the major lifestyle disorders, WHO states the major lifestyle disorders as Alzheimer's disease, arteriosclerosis, cancer, cirrhosis, liver cirrhosis, COPD, diabetes, nephritis, stroke, obesity. So the causes of the lifestyle disorders: consumption of high-calorie food, stress, irregular dietary habit, sedentary lifestyle, over dependence on the processed foods, energy drinks, artificial sweeteners, fast food, and smoking and drinking alcohol, and poor sleeping habits. So there are the risk factors. The first one is the controllable risk factors. These factors include habit, behaviors, and the practices one can change. Those are diet, physical activity, body weight, and smoking and alcohol abuse. So these are the uncontrollable risk factors. They are age, heredity, ethnicity, and gender. So the characteristics of the lifestyle disorders is it has the complex etiology, multiple risk factors, long latency period, non-contagious origin, prolonged course of the illness, and functional impairment or disability. So now we'll move on to the role of ahara in lifestyle disorders. So we'll see about the importance of the ahara. Ahara is one among the Trayopastapa. It is considered Brahma in Upanishad. So there is a relation between ahara and disease. The causes of the disease are asatma indriyartha samyoga and prajnaparada of improper ahara and vihara, which leads to the roga. And Acharya Charaka also mentioned ahara as the prana and one of the factors of sharira vriddhikara bhava and bala vriddhikara bhava. Even the Acharya Kashyapa mentioned ahara as mahabhaishajya, and he explained that no medicine is equivalent to food. It is possible to make a person disease free just with the ahara. So next one is the and these are the rules and concepts mentioned in Ayurveda, by following which one can prevent the lifestyle disorders, also can adopt in day-to-day basis by deviating from the bad lifestyle to get rid of the lifestyle disorders. So the first one is the Nidana Parivarjana, deviating from the unhealthy lifestyles. And by adopting the concept of Nitya Sevaniya Ahara and Shadrasa Yukta Ahara in diet, and by following the rules of the dietetics, that is Ahara Vidhi Vidhana, Ashtavida Ahara Ayatana, Dwadasha Pravicharana, and also including the concept of the Viruddha Ahara and Satmya Ahara in the diet. So moving on to the role of yoga in lifestyle disorders. So yoga, yujjate anena iti yoga, union between the mind, body, and the spirit. Yoga has a great potential in prevent progression and disease, and if started early, manifest a cure also. So yoga is a holistic and integral science of life dealing with the physical, mental, emotional, and spiritual health of the individual and the society. The major components of the yoga due to its lifestyle components, those are healthy diet, activity, relaxation, and positive attitude, as well as the psychosomatic harmonizing effects of the pranayama and yogic relaxation. So next we'll move on to the some of the concepts of the yoga which can be helpful in the adopting the positive lifestyle. So first one is the Ashtanga Yoga. The concept of Ashtanga Yoga, they are Yama, Niyama, Asana, Pranayama, Pratyahara, Dharana, Dhyana, Samadhi. So Yama consists of Ahimsa, Satya, Asteya, Brahmacharya, and Aparigraha. These are the ethical disciplines. These disciplines guide a person to remain intact from the behaviors which may distract the mental harmony. And the next one is the Niyama. Niyama consists of Shaucha, Santosha, Tapa, Swadhyaya, and Ishvara Pranidhana. So these are the principles of the social well-being. Next is the Asana and Pranayama. Acts on the physical as well as the mental health, strengthens the body, relaxes the body and mind. And the next is Dharana Dhyana. These are the concentrative practices. So next concept is the Mudra. So mudras are the expression of the internal feelings by way of different postures of fingers, palms, hands, and feet. It has the potential benefits for physical, mental, and emotional well-being. So importance of the mudra. Mudras helps in the regain of the lost energy, helps to link the brain to the body, soothes the pain, stimulates the endorphin, change the mood, and increases our vitality. Works on the nervous system, helps in the relieving stress, act as a catalyst to improve body function, and it gives you a peaceful mind. So next concept is the Shatkarma. Shatkarmanam Shodhanam Cha. Regular practice leads to the purification of the body. The Shatkarmas are Dhauti, Basti, Neti, Nauli, Trataka, and Kapalabhati. Discussion. A wholesome diet maintains the equilibrium of the dhatu and helps in the promotion of the health and prevention of the disease. In lifestyle disorders, simple lifestyle measures like regulating proper ahara and following dietetics rules, etc., are more effective in preventing or delaying the onset of these diseases. So yoga, attainment of the state of psychosomatic harmony and balance, that is samatvam yogyam uchyate, and this restoration of physical, mental, emotional, and spiritual balance may be the prime factor behind the changes seen in the lifestyle disorders. So there is a yoga is like an antidote for the stress related diseases. So here stress induces decrease parasympathetic and increase sympathetic activity and underactivity of the GABA. While in contrary to that, yoga corrects the underactivity of the parasympathetic nervous system and GABA system and stimulates the stimulating the vagus nerve. And stress increases the allostatic load and yoga reduces the allostatic load. So coming to the conclusion, for the prevention and treatment of the disease with the lifestyle modification and by following proper dietary rules according to Ayurveda should be done because prevention is always better than the cure. The most important part of tackling lifestyle disorders is the cultivation of right attitudes by the development of yogic attitudes towards the every part of the life. Ahara and dietetic rules, etc., described in Ayurveda are the main tools for the maintenance of physical health, whereas yogic practices promote physical as well as the mental health. Thus, implementation of these modalities has great effect in promotion of the health and prevention of the disease, especially lifestyle disorders. These are the references. Thank you.
Thank you, Doctor. Next, I invite Dr. Vinay Kumar Anveri for the paper presentation.
Yes, sir. Yes, sir. Can I share my screen now?
Please share the screen, Doctor.
Is it visible now?
Your screen is visible, Doctor. Please start. Please start the session, Doctor.
Okay. I said Dr. Vinay Kumar, second year PG scholar, Department of Tantra from Indian Institute of Biomedical Sciences, Manipal. Now I am going to present my PPT on topic metagenomic study on evaluation of organisms present in the gut of the leeches and the effect of Hridra Jala Sanskara on leech gut flora. Introduction. In Sharya Tantra, among minimally invasive surgeries, Raptamokshana plays an important role. Radiotherapy or Jalokacharana has been lauded for its role in management of various diseases like abscess, inflammation, cellulitis, non-healing ulcers, skin disease, etc. Acharya Shruta in Shruta Samhita has explained that leeches have to be collected from various water bodies which are not contaminated with sewage water and etc. And also he has mentioned that in Jalokacharya Adhyaya, the leeches have to be placed in Haridra before it's being used in a patient to reduce the untoward effect of leech bites. While performing this therapy, all of us we follow this pre-operative procedure of keeping Jaloka in Haridra Jala before it's being used in patient. This study has been taken up to check the scientific background of this preoperative procedure of leeches so as to verify the necessity of prophylactic antibiotic cover. Objectives aim to prove the safety of Jalokacharana. Objectives to check the various organisms present in the gut of the leeches of some geographical areas of India and to check the neutralization of these organisms by Haridra. Materials and methods. Collection of the leeches from Udupi and Goa region. Time of the collection, it's the post-rainy season from September to April month. Storage of the leeches in fresh water in clean plastic bottles. Maintenance of the leeches. Water was changed once in 3 days and the bottle was cleaned once in a week. Methods. 8 leeches from same batches of equal size were selected. It is divided into 2 groups of 4 leeches each. First group of leeches were not treated with Haridra Jala and the second group of leeches were treated with Haridra Jala. Treatment in Haridra Jala. For 1 liter of water, 10 grams of Haridra was added and the leeches were kept for 45 minutes. Anesthesia for leeches. Leeches were kept in conical flask. About 5 ml of ether is poured on cotton ball and the mouth of the flask was covered till the leeches become motionless. Then the flask were labeled as separately as LB and LA, means local leeches before treatment, local leeches after treatment. Then dissection of leeches were carried out under sterile environment inside laminar road at STM Research Center, Udupi. Microbial study. The samples from the gut were collected inside sterile microfiche tubes. The procedure was repeated twice for local leeches and twice for leeches from Goa. These samples were sent to metagenomic analysis for Bangalore. Then 7 gut samples from local leeches, each before and after treatment, were collected for microbial analysis. Then 16S metagenome analysis. The gut samples collected in the microfiche tubes were stored at -20 degrees Celsius. These samples were packed and transported under cold condition to Genotype Technology Private Limited, Bangalore, for metagenomic analysis study. Then for microbiological study, the tissue pieces were transferred and aseptically into 10 ml sterile saline water. Then it's attached and then sterile dilution of each was prepared. 1 ml of each dilution was inoculated into soybean casein digested agar. Soybean casein digested agar is a medium for cultivation of microorganisms. Then plates were incubated at 37 degrees Celsius and the colonies were counted after 24 hours. Then count was reported as colony forming unit for gut. Results. Metagenomic analysis of Goa leeches. Here, the percentage of the bacteria belongs to proteobacteria and the bacteroidetes was significantly higher in untreated samples. While in case of Haridra treated sample, it is significantly low. After Haridra treatment, bacteria count in the guts of the leeches was 81 to 82% lower than guts extracted from untreated sample leeches. Here in Goa leeches sample results, we can see that percentage population of bacteria belong to proteobacteria and bacteroidetes significantly lower after Haridra treatment. In absolute count also, before Haridra Jala Samskara, it is 3,39,128. After Haridra Jala Samskara, it is 63,322. Next, local leeches results. The count of the proteobacterial members was significantly lower in treated samples. Then the presence of bacteria categorized under phylum SR1 was noted in the gut sample of local leeches. This is a recently discovered phylum, consists of bacteria found in marine environments, freshwater lakes, and subsurface aquifers, terrestrial high temperature regions. And a SRM bacterial genome has been identified in samples collected from animal guts and termites. Here it's local HS results. Here protobacterial count was significantly lower after hydrogel samskara, and absolute count before hydrogel samskara it is 1,02,240. After hydrogel samskara it is 60,707. Then microbial study result. Overall, the count of the gut microbes in the leeches collected 30 to 45 days post rainy season was lower after hydra treatment in comparison to the number in untreated leeches. Here, in the results of all 7 microbial study samples, we can see that untreated sample results and untreated sample results it's significantly lower after hydrogel samskara, except this second, third, and fourth samples. It may be because blood stain was more while collecting that samples that might very alter the result. Then discussion. Sushruta, based on his keen observations, he has clearly mentioned the fact that the leeches to be used for the purpose of the leech therapy should always be collected from certain geographical areas only. This is an indication that Sushruta had some idea about the presence of certain pathogenic organisms in the leeches, which could be transferred to human through heredotherapy, causing various hypersensitivity, infectious signs and symptoms like itching, pain, swelling, etc. This work was taken up to study the changes that happen in the microbiota of the gut of the leeches after keeping the Jaloka in Haridra Jala. Then the conclusion. In this study, total bacteria belonging to the more than 25 phylum has been identified in the gut of the leeches. And significant reduction of the total number of bacterial count has been observed after Haridra Jala Samskara. Then this work clearly validates the scientific background with which Sushruta had mentioned that any leeches to be used in Jaloka Charana had Haridra from the point of prevention of various untoward effects.
Thank you, doctor.
So next I invite Dr. Yogesh Balasaheb. I invite Dr. Yogesh.
Hello. Hi. Hello.
Hello, doctor.
Hello.
You are audible, doctor.
Hi. Yes. Yes, ma'am.
Doctor, please share the screen, doctor.
Can you hear me? Hello. Hello.
Yes, doctor. Screen is visible, doctor. Please start the session.
Hi, I'm Dr. Yogesh Balasaheb from second year PG scholar from SMT Ayurvedic College. My topic is the Pathya in Sutika Paricharya. Introduction. A healthy woman is the main root of healthy family and society. In the today's world, due to the increase of mental stress and unhealthy dietic habit, lead to disturbance of the social, physical, and psychological aspect of life, by which women develop menstrual abnormality during the reproductive age. These all factors further result in Sutika Roga. This period is also known as a puerperium, started following the expulsion of the placenta until the complete physiological recovery of various organ system, when maternal physiological and anatomical returns to the non-pregnant state. The postpartum period divide into three ambulatory phases. Acute phase first, the first 24 hours after delivery of the placenta, early up to the 7th day, late up to the 6 week to 6 months. Lack of care in this time of period may result in death or disability, as well as missed opportunities to promote the health behavior affecting a woman of newborn. Aim and objective: to review the literature of Sutika, Sutikakal, and Sutika Paricharya along with the Pathya in the Sutika Paricharya. Sutika, a woman who has just given the birth to the child followed by the expulsion of placenta, is called as a Sutika. Sutikakal, according to Charak, not specified. According to some acharyas like Sushruta Ashtang Sangra, Ashtang Hriday, Bhav Prakash, Yoga Ratnakar said 1.5 months until the next Rajo Darshan, and Kashyapa said 6 months. According to Pathya, according to Acharya Charan. Aharas, 5 to 7 days, Snehapan, Yavagupan, alike Pipladi Dravya, Karmavat, Apayan, Swastauta Palan, and Viharaja, Abhyanga, Parisheka, Abhyanta Kala, Udaravasyan. Pathya, according to Acharya Shushru, first 2 to 3 days, Vatahar, Aushadhi Dravya, Vatapan, Ushnoda, Pipladi Dravya, 4 to 6 days, Sneho Yavagu or Shura Yavagu. After the 7 days, Jungle Mouse, Yaval Kol, Pulatayush, Shalida Bhujan, Viharaja Sarvadev Bala Tel Abhyanga, Parisheka by Vatahar Dravya. According to Kashyapa, 3 to 5 days, Madapan, Hita Bhojan, Snehapan, Snehayukta Yavapan, including a Pipladi, Nagara, Lavana, Rahit Yavagu, 7 to 12 days, Snehayukta Yavagupan with Lavan. After the 12 days, Kulatta, Jungle Mouse, after 1 month, Snehana, Svedana, Ushna Jala Sevana. Viharaja, Rakshoga Dravya, Ashwasana, Udara Pidana, Udara Veshtana, Ushna Balatela, Krishna, Yonis Vedana, Ushnodakasana, Vishranti, Dhumapan with Kushtani Gugula. Pathya. Hitakar, Ahar, and Vihara. Sutika should have bath with warm water. Adequate sleep should be followed. For drinking, boiled water should be used. Abhyanga and Parisheka Avagaha. Udaravashtena. Diet must contain Garbhavashodaka, Stanyavardaka, Stanyajanana, Vatahara. Dravya. Apathya. Shitahar, Maithuna, physical and mental stress. Ativayan, Shoka, Bhaya, Krodha. Atapa 7, Devaswap. Panchakarma is a contraindicated in Sutika. Discussion. Childbirth care during and for the time following this period in an area of great concurrence nowadays. Interest for the giving of quality care during this period is increasing. People turn toward the traditional practice due to the during this period. Ayurveda detailed description regarding to the some of the systemic way of mention. Sutika consider us Shunya Shari as she become weak due to the development of fetus, loss of strength of body tissue, excretion of clay and raktaha during a delivery process. For the remaining of the loss of vitality and strength of special care should be the provided for the Sutika suggests the use of a Samanya Vishesha Paricharya during a postnatal period as per requirement. Samanya Paricharya is a provider universal and unique care for the or postnatal female, but the Vishesha Paricharya is somewhat more focused on personality oriented approach. Conclusion. The diet and regimen which of the described by the Ayurveda literature thousands of years ago for the Sutika totally scientific different procedures include a need of proper management of ahara acharya for the purpose of the Purna Navikarana of Sri itself, and Sutika Paricharya have been a tool for the prevention of a problem of women. Thank you.
Thank you, Doctor. Next, I invite Dr. Kriti Dirpadi for the paper presentation. Dr. Kriti, are you there?
Yes, sir.
Okay, Doctor. Please share the screen, Doctor. Your screen is visible, Doctor. Please start the session.
Okay, doctor. Yeah. Okay.
Good evening, all the dignitaries. This is Dr. Kriti, PG Department of Kaya Chikitsa, Monyal College, Manipal. Om Agnimile Purohitam, Yajnasya Deva Mritvijam, Hotaram, Ratnadhatam. This was the first sound recorded in gramophone. Right from the mythological era, Paleolithical period, or in the days of Akbar and Birbal, we find significance of Agni, and so in Ayurveda. Hence, my topic for today is Agni, its clinical application in Grahani Roga. Now, the question arises, how Agni got vitiated? Initially, rishis were yayavas, which means wanderers. Later on, they became gramastha, consumed gramyahara, leading to Agni doshan, manushyanam, roga sangaha, and one among which it is Grahani Roga. Globally, we come across similar concept in Hippocrates, gastrism, and yin-yang theory of Chinese medicine. So, now let's dispel the dark mystery of Grahani Roga through Agni. Grahani Roga is caused by both Agni Vaiparitya and Nadi Dushti, along with 4 Vatadi doshas. Now, let's know the hamster wheel of diseases caused due to Grahani Roga. Here, Shirosa Rupcha Murcha Chabramaha Prishtakatiggraha can be considered as infective disorder, that is, Listeria monocytogenes found in Asatmya Bhojan. Processed meat can cause Agni Vaiparitya, leading to chronic Grahani Roga, and that will lead to, that crosses the blood-brain barrier and causing meningitis-like diseases. Then next is Ghoram Annavisham, which can be linked with autoimmune disorder. For example, in rheumatoid arthritis, due to prolonged pharmacological therapy, which causes Agni Mandya, leading to Sang of Ama in the colon, which leads to thickening and inflammation of the colon, leading to Grahani Roga. Then Pittajamsha Gadan, which can be linked with gut hormone axis, wherein, for example, hyperthyroidism, if it is taken, in hyperthyroidism, due to Atiguru Ahara Bhojana, Agni Dushti takes place in the form of increased iodothyronine deiodinase in the intestinal wall, which causes Grahani Roga as well as thyroid disorders due to intestinal hyperpermeability. Kaphajansha Gadan can be linked with gut-lung axis, wherein due to Rutu Vaiparitya, there will be Agni Dushti, which causes intestinal dysbiosis that aggravates asthma. Now, Vatajamsha Gadan can be considered as gut-brain axis, wherein due to Abhojana or Asatmya Bhojana, it can lead to Agni Vaiparitya, leading to increase in alpha-sen nuclei in the GI system, which gets aggravated in the substantia nigra, causing Parkinson diseases as well as Grahani Roga. Mutra Roga and Chakrit Roga can be correlated with gut, genitourinary tract axis due to Veganam Vidharanat. Agni gets hampered, intestinal and vaginal dysbiosis will be seen, which can cause UTI along with Grahani Roga. Rasadigadam can be considered as gut-heart axis, wherein due to Nadi Dushti in the form of disruption in the gut epithelium leads to Agni Dushti, and then from there the Ama gets translocated into the systemic circulation, causing cardiac dysfunction. Next with the discussion, case study on ovarian cancer by Canadian Society, wherein they tell about the symptoms similar to Grahani Roga, where there will be distension of the abdomen, pain abdomen, constipation, tumor also. which can be, that is due to increase of estrogen in the intestinal cells, which mimics Grahani Roga. Then mitochondria cytochrome oxidase deficiency, that is a rare metabolic disorder similar to Grahani Roga, wherein the Agni in the form of ATP is hampered. Be taken from the reference.
Hello, Dr. Kriti. Hello, Dr. Kriti, can you hear me? Hello, Dr. Kriti, can you hear me? Hello, Dr. Kriti, can you hear me?
Dr. Kriti is not there.
Okay, next I would like to invite Dr. Devayani Dasar for the paper presentation.
Thank you so much, sir. Am I audible?
Audible, doctor.
Okay, sir.
Please share the screen, doctor.
Yes, yes. Sir, is my PPT visible, sir?
Yes, doctor. Visible, doctor.
Yeah.
Please start the session, doctor.
Okay. Thank you so much, sir. So, Patheya 2022 National Seminar, myself. Om Namani Dhanvantari. Myself, Dr. Devayani Dasar, is going to present on evaluation of efficacy of Sira Vedana in venous ulcer, a vein alarm case study. Associate Professor from Department of Shalyatantra of Mahatma Gandhi Ayurvedic College, Hospital and Research Center, Salud Hirapur, Wardha, from Datta Mege Institute of Medical Sciences, Savangi, Wardha. These are the guidelines of this case presentations. So these some of the modules are also present in case study prospect, which is a module 1, having this introduction, objectives, methodology, efficacy and safety results with discussion and appendices. So introduction, an ulcer is a break in the continuity of the covering epithelium. Venous ulcer, which is one of the most common entity in that one, and we found 6 lakhs new cases per year in India, and in Western countries that are numbers are more. Causes are abnormal venous hypertension in lower third of the leg, ankle, dorsum of foot, and occurs at about the age of 30 years. So principle for the ulcer management is the first we have to determine etiology, then accurate assessment of ulcer, identification of the morbid factors, also drainage, desloughing and dressings. According to Acharya Sushruta, in Ashashti Upakrama, he mentioned about the Raktavisravana. So here we can see this is the minor wound, how it is going to form in the layers of the skin. Now, these are the patient's photos. So what the study carried out for this one. So here we can see the maggots also. In this case, I found a really very good results and other photographs in front of you. So aim evaluation of efficacy of Sira Vedana in venous ulcer with the objective to study the efficacy of Sira Vedana in venous ulcer. So case summary, male patient of 67 years having the complaint of ulcer since 7 years with the itching, discoloration of food, pain sometimes, also diabetes. There is no any systemic disorders or also no long use of medicines and no addiction. This is the consent form from the patient. Here is the local examination with the itching, post discharge, and we can see the discoloration of the skin. These are the ethical issues with the consent and the confidentiality. Now methodology, Sira Vedana weekly twice I did, and also Trifle and Mouse Rohini Kwathadhavana once daily, followed by the dressing for the 14 years, and follow up was the for 2 weeks. So these are the materials required for the Sira Vedana, and this is a procedure of the Sira Vedana which I did. So Sira Vedana probably acted in the healing of the wound due to its capability to relieve the stasis of the blood in the overloaded vessels, which hampers the healing of wound and reduces venous congestion. Also, Triphala and Mons Rohini Kwathadhavana acted as antibacterial, antibiotic, and healing and enhancing factors. So here are the patient's photographs. So this is the before of the treatment, mid of the treatment, and this is the after the final treatment of the 14 days. Conclusion, so Siravedana found effective in enhancing microcirculation of capillaries. Also, Pathadhavana found effective in healing of venous ulcer within short span of time with a good healing. And it is easy to prepare. Really, it gives a very good, effective procedure in this one. So these are the references. Treating an ulcer is not like a treating a gut under this ethical rule. Thank you. Thank you.
Thank you, Dr.
Yeah,
for this wonderful presentation.
Thank you.
So next, I would like to invite Dr. Priyanka Rana. I invite Dr. Priyanka Rana.
Hello.
Hello, doctor. You're audible. Please share the
And am
screen.
I audible?
Yes, doctor, you are audible.
Okay. And screen is visible?
No, doctor, it's not visible.
Is it visible now?
No, doctor.
Is it visible now?
Yes, it's sharing now.
Okay.
Your screen is visible now. Please share the PPT.
Yes, ma'am.
Yes,
And it's
doctor, it's
visible?
visible.
Okay.
Yeah.
Okay, ma'am. Good evening, everyone. Myself, Dr. Priyanka. I am PG Scholar of Panchakarma in Karnataka Ayurveda Medical College, Mangaluru. My topic of presentation is Understanding Concepts of Metabolic Disorders with special reference to Pachakagni and Dhatavagni. So starting with this, as the Prayojan of Ayurveda also says, Samadosha, Samagnischa, Samadhatu Malakriyaha, Prasannatmendriya Manaha, Swastha Ita Bidhiyate. So according to Ayurveda, Swastha is a state where the dosha, agni, all the body constituents, components, all the physiological process are in a balanced state, and also our atma, manas, and indriyas are in a state of total well-being. So agni has an important role of maintenance of health in a healthy individual. So I am taking agni as a factor here. And why the need of the study is there is because the metabolic syndromes or the metabolic disorders nowadays has become a very burning problem in the society. It can be correlated to aging, genetics, disturbed lifestyle or dietary habits, or presence of other diseases and deteriorating environmental factors also. So here conditions like obesity, dyslipidemia, hyperglycemia, etc. are some of the common metabolic disorders. Out of them, obesity and hyperglycemia are affecting many severely. The current scenario witnessed that large number of teenagers and elderly population suffered with these metabolic disorders. This is why we are discussing here about a very small topic of Ayurveda, but it is the essence of it is more. So starting with that, here is the vicious metabolic diseases may involve abnormal metabolism of meda, vitiation of ahara rasa, jatragni, disturbed hormonal regulation, and tridoshic imbalance. Why agni is here discussed? According to different acharyas, different types has been given. Basic is jatragni 1, bhutagni are 5, and dhatwagni is 7. Among this, jatragni is considered as of prime importance. According to Sushruta, 5 types of agnis are Pachaka Agni, Ranjaka Agni, Alochaka Agni, Sadhaka Agni, and Brajaka Agni. However, there is an indirect reference of 5 Bhutagnis about the transformation of foodstuff. Acharya Vakvata has described different types of Agni, that is Odra Agni, Bhutagni, Dhatva Agni, Dosha Agni, and Malagni, and Pitta, that is 5 types of Pitta. Sharangadhara has described 5 types of Pitta. They are Pachaka, Bhrajaka, Ranjaka, Alochaka, and Sadhaka. Acharya Bhav Mishra has agreed with Acharya Charak and Vagbhata. So why Agni is important here? Agni is the key factor for the transformation. So among these one, there are actually of 13 types, but Jatragni here plays the principal Agni and causative agent for the normal lifespan, complexion, strength, health, enthusiasm or urja, growth, complexion, ojas, and luster, other forms of Agni, and even responsible for existence of an individual. So Bhuta Agni turns all the Vijatiya Panchabhautika Dravyas consumed to Sajatiya Panchabhautika Dravyas. And Dhatu Agni here does is the charge, it takes the charge of synthesis and breakdown of dhatus. Importance of Agni. This shloka defines why, what are the functions of Agni and how it is important in a transformation. So, Balam Arogyam Ayucha Pranacha Agno Pratishtita. Agno Pratishtita iti Agni Adhina Pranarati Vayava. So, this shloka actually defines what happens when the Oja or the Teja is subsided, or when it is in the equilibrium form, or when what functions it does. So we are not going into the shlokas because of the time is very less. So here is the explanation of Jatragni Vyapara. The food ingested is acted upon by the normal Koshtagni via Pachaka Pitta and cooked properly to produce two substances, that is the Sara Bhaga and the Kitta Bhaga. So Sara Bhaga, called as the Ahara Rasa, is the essence of food, and the Kitta Bhaga is the waste product of the food. So this Sara Bhaga or the Ahara Rasa undergoes further changes, being acting upon by the Bhuta Agnis and get converted into Rasa Dhatu, that is the first Dhatu of our body. This subsequently goes into other Dhatus for Poshana. The activities of Koshtagni and Bhutagni together forms the Ahara Paka or digestion of food. The Rasa Dhatu contains the nutrient materials derived from the food and required by the Dhatus, that is the tissues. This Rasa Dhatus circulates all over the body, supplying the nutrients to all other Dhatus, which utilizes this material for their growth, or called as metabolism. So speaking about metabolism, first we'll deal with what is Dhatva Agni. So Dhatva Agnis are basically 7 types, that is Rasa Agni present in Rasa Dhatu, Rakta Agni present in Rakta Agni present in Rakta Dhatu, Mamsa Agni present in Mamsa Dhatu, Meda Agni present in Meda Dhatu, Asti Agni present in Asti Dhatu, and Majja Agni present in Majja Dhatu, and Shukra Agni present in Shukra Dhatu. The following shloka also describes the similar facts. What is the relationship between Jatra Agni and Dhatva Agni? So this is an important factor which we are going to study in this presentation. So as we already know, Grahani is considered as the seat for Jatra Agni, but Sukshma, that is the minute amsha of this is present in all the dhatus. Jatra Agni is directly related to Dhatva Agni, or the bioenergy in these cells and their metabolic processes.
Hello, doctor.
Yes, sir.
Doctor, you are exceeding the time limit, doctor. Can you speed up your presentation?
Oh, okay, sir. Okay, sir. So if this Jatra Agni is hyperactive or hypoactive, it will cause an excessive or retarded action of the Dhatva Agni. This disturbed action ultimately leads to the various disorders. So Jatra Agni is the main important Agni, which is on all the other Agnis are depending upon that. So how it actually hampers the metabolism is given in this slide. So there are 4 types of Agni, that is Sama Agni, Vishma Agni, Tikshna Agni, Manda Agni. So Sama is for balanced metabolism, Vishma is irregular metabolism, Tikshna is it causes hypermetabolism, and Manda causes hypometabolism. Speaking about metabolism, I am here giving only a brief review. So metabolism is nothing but it is a biochemical processes that maintain the functioning of living organism. It consists of 2 processes, catabolism and anabolism. Catabolism is breakdown of larger molecules into smaller ones, and anabolism is consuming energy to build the new cells and maintaining body tissues. So metabolic disorder here occurs when the abnormal chemical reaction disrupts the body metabolism. This could affect how well the body can break down large molecules for energy, or how efficiently cells can produce energy, or cause problems with energy regulation. So this slide describes how the metabolism works. Metabolic disorders, here are some of the metabolic disorders we are seeing nowadays. And Ayurvedic concept of metabolism. Metabolism can be split into a series of chemical reaction and comprises of both the synthesis and degradation of complex macromolecules known as anabolism and catabolism. Here simile has been given, like Dav Agni in the forest causes destruction of trees if increased excessively. Similarly, Jatra Agni leads to destruction of dhatus in the Vruddha Avastha.
When the metabolism increases due to increased Jatragni, the Poshana Amsha is not available in the required quantity to compensate that, which ultimately leads to increased catabolism, that is apachaya kriya, and decreased anabolism, that is chaya kriya, resulting in dhatu shinta in that individual. So here are the shlokas describing the same. So increased catabolism requires increased oxygen consumption by the cells, which ultimately causes decreased anabolism. Likewise, it is for the same. Example is here, increased thyroxine hormone in the
limit, doctor.
Ma'am, last slide. Example, increased thyroxine hormone is in the blood leads to increased basal metabolic rate, causing more oxygen consumption. This causes increased catabolism, leading to depleted dhatus or emaciation. If thyroxine hormone depletes in the body, it leads to vice versa. So here I conclude the Samavastha of the Pachakagni in the Deha is responsible for the Samavastha of Ushma, Vata, Pitta, Kapha, leading to Arogya, Pushti, Ayu, Bala, and Annapachana. Dhatavni is directly in the link with Pachakagni, maintaining Samavastha of the Dhatus. Thank you.
Thank you,
Thank you,
Dr.
Dr.
Priyanka.
Priyanka. Next,
Thank
I
you,
invite
sir.
Dr.
I
Kriti for the
invite
poster
Dr.
presentation. Dr.
Yes,
Kriti,
sir.
are you there? Hello, Dr. Kriti, are you there? Hello, Dr. Kriti, are you there?
Yes, sir.
Okay, doctor. Please share the screen, doctor.
Sir, poster presentation or paper presentation?
Poster presentation, doctor, and complete paper run. I think your paper has been completed, right, doctor?
3 slides were left, sir.
Okay, doctor. Continue, doctor.
Sir, can you just share my poster? Paper, sir, last 3.
Okay, doctor. One sec. Hello, doctor.
Before that, sir. Yes, sir. Shall I start, sir?
Sure, doctor. Please start, doctor.
Kaphajansha Gadan can be correlated with gut-lung axis, wherein the Rutuvaiparitya leads to Agni Tushti, which causes intestinal dysbiosis that aggravates asthma. Vatajamsha Gadan can be correlated with gut-brain axis. Here, due to abhojana or asatmya bhojana, there will be Agni Vaiparitya that leads to increase in alpha-sine nuclei in the GI system, and that leads to aggregation of which gets aggregated in the substantia nigra, causing Parkinson disease and Grahani Roga Lakshana. Mutra Roga, Shakrat Roga can be linked with gut genitourinary tract axis. Due to Vegan Vidharanat, Agni gets hampered, intestinal and vaginal dysbiosis will be there, which leads to UTI-like disorders along with Grahani. Then Rasadi Gadan can be correlated with gut-heart axis, wherein due to Nadi Dushti in the form of disruption in the gut epithelium leads to Agni Dushti and translocation of the ama into the systemic circulation, causing cardiac dysbiosis. Next. Under discussion, case study on ovarian cancer by Canadian Society, wherein there will be increase of estrogen in the intestinal cells, mimics the Grahani Roga like symptoms, that is pain, abdomen, distension in the abdomen, constipation or diarrhea, along with abdominal mass. Then mitochondria cytochrome cooxidase deficiency, which is a rare metabolic disorder, is similar to Grahani Roga, wherein Agni in the form of ATP is hampered. Here, Agni can be considered as Teja, and Teja is nothing but Deho Ushma or Shukra, according to Chakrapani. Here, Shukra can be considered as cell, anything which has the capability to reproduce. And Deho Ushma can be considered as ATP. So this can be correlated to Grahani Roga. Next. With this, I would like to conclude by saying that Agni is the governor of the laws of nature in the universe and the human physiology. Hence, its prime Agni Samrakshana is the supreme duty of every individual, and it is truly said, Yo vartate suchitvena sa vaishwanaraha, yo vartate asuchitvena sa vaihi shwanara. Thank you.
Thank you, doctor.
Sir.
Next is the poster presentation, right, doctor?
This was paper presentation, sir. Poster
Next
presentation is also similar.
Hello, Dr.
Yes, ma'am. Ma'am, can
It
you
was
just share my poster?
Okay, doctor.
Yes, ma'am.
Dr. Sabin.
Okay, doctor, one sec. Doctor, please start. Doctor.
Yes. Once again, good evening to all the dignitaries. I'm Dr. Kriti, PG Department of Kaya Chikitsa, Munyal Institute of Ayurveda Medical Science, Manipal. Agni is very important, and it's the beauty of Ayurveda. Here, it says that Aham Vaishwanaro Bhutva Praninam Deham Ashritaha Pranapana Samayuktaha Pachatyannam Chaturvidham. Also, there is one shloka known that is Om Agni Mile Purohitam Yajnasya Devam Ritwijam Hotaram Ratnadhatam. This was the first sound recorded in gramophone. So, right from the mythological era, Paleolithical period, or in the tales of Akbar and Birbal, we find significance of Agni. So, in Ayurveda, hence my topic is Agni, its application in Grahani Roga. Here, now we have to understand how Agni gets vitiated. That is, here in the shloka, it tells that rishis were yayavas. It has been taken from Charaka Chikitsa, first chapter, wherein they were yayavas, that is wanderers. Later on, they became gramastha, and when they became gramastha, they consumed gramyahara, which lead to Agni doshan, manushyanam, roga sangaha, and many rogas were explained, but one among which is Grahani Roga. And globally also we come across such concepts in Hippocrates' gastrism and yin and yang theory of Chinese medicine, where various empty diseases related to intestine can be correlated. Now, so let's dispel this dark mystery of Grahani Roga through Agni. Here in analysis, sir, analysis part, wherein Shiraso Rukcha Murcha Cha Brahmaha Krishtakrati Graha can be considered as meningitis, which is caused due to Listeria monocyte genes bacteria that is found in asatmya bhojana, that is unpasteurized cheese or unprocessed meat, which leads to Agni Vaiparitya, leading to chronic Grahani Roga, and this infection will be so severe that it crosses the blood-brain barrier, causing meningitis. Then Ghoram Annavisham can be linked with autoimmune diseases like in rheumatoid arthritis due to prolonged pharmacological therapy, which causes Agni Mandya, leading to Sangha of Ama in the colon and causing thickening and inflammation of the colon. Next in Pitta-Jamsha Gadan, which can be correlated with gut hormone axis and inflammatory disorder, that is in hypothyroidism, there will be increase in iodothyronin deiodinase enzyme, which gets accumulated in the intestinal wall and causes Grahani Roga due to intestinal hyperpermeability. Kapha-Jamsha Gadan. Hello, sir. Hello, sir. Hello, sir.
Hello, Dr. Savin.
Hello.
Yes, doctor.
Am I audible, sir?
Audible, doctor.
Kapha-Jamsha Gadan
Yes,
can be
doctor.
linked with gut-lung axis, which is a respiratory disorder, wherein due to Rutuvaiparittya, there will be Agni Dushti, which causes intestinal dysbiosis, and it aggravates asthma. Vata-Jamsha Gadan again can be correlated with gut-brain axis, wherein alpha sign nuclei increases due to Agni Vaiparitya caused due to abhojana or asatmya bhojana, which gets aggregated in the substantia nigra, causing Parkinson disease along with Grahani Roga. Mutra Roga and Chakrit Roga can be related with gut genitourinary tract axis. That is due to Vegan Vidharanat. Agni gets hampered, intestinal and vaginal dysbiosis takes place, and there will be UTI-like diseases, disorders along with Grahani. Rasadi Gadan can be correlated with gut heart axis. Due to Nadi Dushti, there will be disruption in the gut epithelium, and there will be translocation of AMA into the systemic circulation, causing various cardiac dysfunctioning. Under discussion, I have mentioned a case study on ovarian cancer, which was conducted by Canadian Society, and the other one is mitochondria. Cytochrome oxidase deficiency disorder. It is a metabolic disorder, and the methods that were taken, it is from the classical text, gurus, my teacher, my guide, Shripati Acharya sir, and research articles and seminars. Then at the end, I would like to conclude by saying that it is prime important to do Agni Samrakshana, and references have been taken from Charaka Samhita 15 chapter Grahani Roga. Thank you.
Thank you, doctor.
Thank you, doctor.
Thank you.
Next, I invite Dr. Dhruv.
Hello, am I audible?
Yes, doctor.
Yeah, one second.
Your screen is visible, doctor.
Okay, sir. Yeah, I'm Dr. Dhruv Modi, PG scholar from Shalya Tantra department from KVG College, Ayurveda College, Sulia. My topic is three marma, a clinical critical review. We'll start with brief introduction of marma. In Ayurvedic literature, the term marma is concerned as jivasthana, which is also called vital spot and vulnerable points. Marma points are the specific areas of the body which has relation through panic channels to various internal organs, doshas, and shrotas. There are 107 marmas which have importance in during Abhyanga, along with the application of different kinds of medicated and aromatic oils to stimulate internal organs. Here we can see the different marma points in our body. Marma, according to different acharyas, Acharya Shushruta has explained the marma are combination of mamsa, sira, asti, snayu, and sandhi, where prana is specially associated. Acharya Vagbhat defines that marma is meeting point of mamsa, asti, sira, snayu, dhamni, and sandhi, and where prana is present. He also mentioned that marma is a place where unusual pulsation can be felt and where shall be the tenderness on pressure. Here we can see different definition slokas of marma. So the topic is three marmas. So among 107 murmurs, Sirasa, Hridaya, and Basti are given prime importance by Acharyas. The reason behind is these three murmurs are sthana for prana, and any kind of pida in any kind of injury can cause death of the patient. Similarly, as the spoke of wheel are attached to the center, similarly, the 10 vessels, prana, vayu, apana, vayu, mana, buddhi, consciousness, and mahabhutas are attached to the heart. Samanya lakshanas of trimurma injury. Serious injury to trimurma causes destruction of the body, since the destruction of the substratum ashrayas leads to destruction of the suprastructures. Partial injury to this leads to application by serious diseases. Therefore, these vital organs should be specially protected from external injury and application by vayu, etc. When sadhya pranahara marma are injured, there will be loss of sensory perception, abnormalities in the mind, intellect, and different kinds of severe pains. Samanya treatment of three marma. The marmas are to be protected from aggravated vayu, because of aggravated vayu is responsible for aggravation of pitta and kapha. The vayu is best treated with basti. So there is none another than basti therapy which can safeguard the vital organs. So the first marma from three marma is Sirasa. It consists 4 marmas: Shringataka, Adipati, Shankha, and Matraka. Shringataka marma also have a subdivision in 4 marmas present in middle of the confluence of veins, Shringataka, supplying nourishment to the nose, ears, eyes, and tongue. Adipati, situated inside the head, at its top, and is the confluence of veins and joints surrounded by a ring of hairs, is also known as Adipati marma. Any injury to this marma can cause death quickly. Third one is Shankha. Present above the level of brows in between the ears and forehead are the 2 marmas as Shankha. Injury to this also can cause death. Fourth one is Matruka. Present on 2 sides of the neck are 4, 2 in each sides. Matruka marma. Injury also can cause death quickly. Treatment we can do Basti, Abhyanga, Svedana, Ushna, Upnaha, Snigdha, Dumupana, Avapidanasya. Second one is Hridayam. Situated in between 2 breasts and in the chest at the mouth of stomach. Seat of Sattva, Raja, and Tamasa. Injury can cause death quickly. Injury Lakshana, Kasa, Swasa, Balakshaya, Kanta Shosha, Jiva, Nirgamana, Talu Shosha, Pralap, etc. Treatment we can do drink juice of Matulanga or any other salt drink which is pleasing to the heart by adding powder of hingu and any other salts. Decoction of Kshudra Panchamula added with sugar may also used as a drink. Yavago prepared with decoction of Bilva, Shionaka, Gambari, Patla, and Ganikarika. Third one is Basti. Present inside pelvic bone, consisting less muscle and blood, is the seat of urinary bladder and adherent structures by name as Basti. Injury to this marma can also cause death except the renal calculus. Injury lakshanas Basti Shula, Mehana Shula, Vakshna Shula, detention of Vata Mutra, Varcha, Basti Kundala, Udvartana, Gulma, Vatasthila, Upastamba, stiffness of Nabi, Kukshi, Guda, etc. Treatment we can do Kumbish Veda, Vartis, Niru Basti, Anuvasan Basti, Uttara Basti, decoction of Satavari, Gokshura, Bruhati, Kantakari, Punarnava, Ushira, etc. I would like to conclude here. Thank you.
Thank you, doctor. So next, I invite Dr. Soppabala Rahul Chand. Dr. Rahul.
Yes, madam. Hello.
Hello, doctor.
Yes,
You are
you're
audible,
audible,
doctor.
Yes.
Can you please share the screen, doctor?
Is the screen shared, sir?
Screen is
Yes,
visible, doctor. Please start.
Please start.
Good evening, everyone. Myself, Dr. Rahul Chandra. Today, I am here to present the topic concept of sleep and obesity. So sleep is the most important component of human physiology, where sleep is the important modulator of neuroendocrine function and glucose metabolism. Due to increased technologies, various night shift duties, excessive social networking, indulgence, stress, and has been direct and indirect impact on the quality of healthy sleep, which in turn affects the health of an individual. So one of the major complications due to these factors are obesity and emaciation. So sleep duration and quality is associated with the hypertension, obesity, diabetes, and cardiovascular diseases. So growing studies from both laboratory and epidemiological studies reveals that short sleep duration and poor sleep quality is a new risk factors for the development of the obesity. So sleep also shows alterations in the metabolic endocrine, including decreased glucose tolerance, decreased insulin sensitivity, increased levels of ghrelin, decreased levels of leptin, and increased hunger and appetite. So dietary quality and intake of specific nutrients can impact regulatory hormonal pathways to alter the sleep quality and quantity. So sleep in turn affects the intake of total energy as well as specific foods and nutrients through biological and behavior mechanisms. So a study found that consuming high glycemic index carbohydrate foods approximately before 4 hours to the bedtime decreases the sleep latency or the time of the sleep initiation. So which was attributed to an increase in the tryptophan after the carbohydrate consumption. So tryptophan is an amino acid, is the precursor to the sleep regulating hormone, that is serotonin, and is often mentioned as an important predisposer relationship between the diet and sleep. So the micronutrients also have been proposed as mediators the diet disease association. For example, carotenoids and vitamin D medicate association between the sleep duration and the waist circumference or systolic blood pressure, and vitamin C mediates the sleep duration and diastolic blood pressure relationship. So caffeine and theobromine are competitive antagonistic to adenosine, a hormone that regulates the sleep-wake cycle. So caffeine and theobromine provides immediate energy after the consumption. They are also lost longer for the consequences that alter the sleep patterns for many hours after intake. Excuse me, including prolonged sleep latency, reduced total sleep time, sleep insufficiency, and worsened perceived sleep quality and REM sleep behavior disorders. So consumption of alcohol decreases the sleep latency and may disrupt sleep later due to the inability of influence levels of the serotonin and norepinephrine. So an upregulation of the activities of orexin neurons and changes in the appetite regulatory hormones may affect the food intake. It is dependent on the ghrelin hormone promoting hunger, increasing with the sleep restriction, whereas the leptin hormone contributing to the satiety perception decrease. Food stimulates the vagus nerve linings in the GI to initiate the negative feedback, that is satiation. Ghrelin is also produced in the upper regions of the stomach and hunger, whereas peptide YY and pancreatic polypeptide, GLP-1, oxyntomodulin, these all reduce the food intake. So leptin is also produced in the adipose tissues, which causing the reduction of hunger. So ghrelin is an hormone which produced at the endocrine level cells of the GIT tract, which regulates the complex process of energy homeostasis, which adjusts the energy input by hunger signals and energy output by adjusting the proportion of ATP generation, fat storage, glycogen storage, and short-term heat loss. So ghrelin has been linked in inducing the appetite and feeding behavior. Circulating ghrelin levels are highest right before food and lowest after the food. It also exhibits the circadian rhythm and closely follow the feeding schedules. So the levels of ghrelin increases during the daytime from midnight to the dawn, which becomes opposite in case of obese patients. So ghrelin receptors are also found in the ventral tegmental area and stimulate the dopaminergic neurons in the nucleus accumbens. So a review report finding strong evidence that sleep restriction affected the ghrelin, leptin, and cholecystokinin or orexin. So leptin is a hormone predominantly made by adipose cells and enterocytes in the small intestines that helps to regulate the energy by inhibiting the hunger. So the lack of leptin receptors leads to uncontrolled hunger resulting in obesity. So serum leptin is reduced due to the sleep deprivation. Obese individuals generally exhibit a high circulating concentration of leptin than normal weight individuals due to a higher percentage of the body weight. So leptin produced by the adipose tissues acts via receptors in the VTA implicating dopamine to reduce the food consumption. So orexin, it is released in the response of low blood glucose levels and promotes appetite. Orexin also plays an important role in the sleep-wake cycle. And next comes to the cholecystokinin. Food causes cholecystokinin to be released from cells in the duodenum, and these signals gives to the satiety. In obese, there is a perturbation of homeostatic mechanisms, reduced hypothalamic response to the leptin, which results in the high circulating blood levels. So this is the chart relationship between the energy balance modified by the ghrelin and leptin hormones. So the discussion part is anidra is considered as a vataja vyadhi. So tarpak kapha is nourishing the brain cells resulting in the proper night sleep. So pranavayu is seated at the murdhva, that is brain and neck region, and sadhak pitta is also located at the heart, which is responsible for the emotions and desires. So altering these above doshas also causing resulting in the anidra. And the conclusion part is disturbed sleep or insomnia is the main cause of many diseases ruining the people's health. So adjusting the sleep wake cycle is must in this busy world. So practicing some yogasanas, pranayama, dinacharya, ritucharya, sadhurta is so much beneficial. And Ayurvedic treatments for anidra is very safe, effective, beneficial with less side effects. Thank you.
Thank you, doctor. Next, I invite Dr. Aishwarya Lakshmi Hegde for the paper presentation. Dr. Aishwarya, are you there? Dr. Aishwarya Lakshmi, are you there? Okay, next I invite Dr. Anisha KR for the paper presentation. Dr. Anisha, are you there? Dr. Anisha KR, are you there? Doctor, please unmute, doctor.
Yes, sir. Can you hear me?
Yes, doctor.
Can you please share me the slides?
Hello, doctor. Hello, doctor.
Hello, sir. Can you hear me?
Yes, doctor. Your screen is also visible, doctor. Please start, doctor.
Okay. Hello, everyone. Myself, Dr. Anusha KR, first year PG scholar from Department of Prashasta and Bhaishya Kalpana, guided by Dr. Archana B. Pagal from STM College of Ayurveda and Hospital, Hassan. Today's topic of presentation is Ayaskriti Kalpana, a classical method of metal administration. Firstly, what is Ayaskriti? The definition goes like this: the procedure in which metals like iron, gold, silver, etc. are cut into small pieces, subjected to specialized pharmaceutical procedures, and made therapeutically fit for consumption. The term ayas here means iron, and kriti means to cut or to hack. Here, usually, generally, ayas refers to loha dhatu, where loha can be considered as both metals or specifically taken as iron. In this particular formulation, it refers to iron. Ayaskriti is an Ayurvedic medicine mainly used in anemia, weight loss therapy, skin diseases, etc., as iron is one of the main ingredients in it. Some of the references where we can find Ayaskriti is, according to Charaka, it is mentioned as Lohadi Rasayana, which is mentioned in his Chikitsa Sthana, first chapter, third pada. According to Sushruta, it is mentioned under 3 headings, that is Aiskriti, Aushadha Aiskriti, Mahaushadha Aiskriti in his Chikitsa Sthana, 10th chapter. According to Vagbhata, he is mentioned by the name Aiskriti in his Chikitsa Sthana, 12th chapter. There are 3 methods of preparation, mainly Churna form, Leha form, and Sandhana form. The form here refers to the output of the preparation. As I'm from the Rashastra department, I'm concentrating more, mainly on the formulations, the preparation methods. The first type is Churna form, where Sushruta has mentioned Aiskriti, Aushadha Aiskriti, Mahaushadha Aiskriti, which finally gives us a powder formed Aiskriti. The procedure goes like this. Firstly, we have to take thin sheets of loha, Tikshna loha, and it is been smeared with panchalavana paste. And nirvapana is done. That is, these sheets are heated red hot and dipped in Triphala Salasradi Kvata. This makes the iron sheets brittle. This procedure is repeated for 16 times. Then after nirvapana, these sheets are further heated in fire produced by Kadira Kasha and left there until the fire is lit off by its own. Later, they are collected, powdered, and saved through a cloth to obtain fine powder. Next, we'll move on to the Avaleha form. Acharya Charaka has mentioned Lohadi Rasayana, which gives us Avaleha form of Aiskriti. Here, the first procedure is Nirvapana. The thin sheets of Tikshna Loha of 4 angula length and thickness of sesame seed are taken. These sheets are made into red hot and dipped in several times in Triphala Kvata, Gomudra, Jyotishmati Ksharodaka, Ingudik Ksharodaka, and Palashak Ksharodaka, respectively. This procedure will turn the color of sheets to dark black, that is Anjanavat. Next, these black colored sheets are pounded well and made into fine powder. Next, this obtained powder is then mixed with equal quantity of honey and amla juice. The obtained formulation is then kept in a earthen pot, which is smeared with ghee, which is fumigated and smeared with ghee. This is kept in the heap of yava, which is covered up to the neck of the pot, and it is kept for 1 year in the pot. After 1 year, if you open, we'll get Leha form, Aiskriti. The next form is Sandhana form, that is fermented syrup form. Here, Sushruta mentions Mahaushadhi Aiskriti. Out of 3, Mahaushadhi Aiskriti is one where we get Sandhana form of Aiskriti. Procedure is, firstly, we have to prepare Kvata of Salasradi Ganadravya. Thin sheets of iron are made into red hot and dipped in this Kvata. Thus formed preparation is kept in appropriate Sandhana Patra, and Pipali powder, Madhu and Guda are added to it for fermentation, and it is kept for 15 to 30 days. After 30 days, we will get syrup form, fermented syrup form of Aiskriti. Next, another Sandhana form is told by Vagbhata by the name of Aiskriti. The procedure goes like this. Asanadi Ganadravya should be prepared. Dravya Kashaya should be prepared first. Then to this Kashaya, the mentioned quantity of Buddha is added and dissolved in the Kashaya. This is then filtered and then taken in a clean fumigated earthen pot which is smeared with ghee, Madhu, Ghita and Pipali Churna. The remaining drugs like Madhu, Vatsakadi, Ganadravya, Churna are added to the pot and stirred well. Now the pot is applied with a thick layer of Jatu, that is lac, from outside. Then the thin sheets of Tikshna Loha are made into red hot and dipped into this liquid which we have prepared priorly. This process is repeated for several times until the whole iron gets depleted in the liquid media. Then along with the liquid, the Tikshna Loha are kept for fermentation. The mouth of the pot is sealed and placed undisturbed for 15 days in a heap of yava. The indications according to the form which we obtain is in Churna form, it is mainly indicated in Kushta, Prameha, Meduroga, Shuta, Pandu, Pampasmara, Unmada, Rasayana. And Leha form also, Acharyas have mentioned the same thing, Kushta, Prameha, Meduroga, Shuta, Raja, and here additionally Rajayakshma is mentioned. And in Sandhana form, the same is mentioned as Kushta, Prameha, Meduroga, Shuta, and Rajayakshma. And dose time and Anupana are almost the same. That is, dose is according to Agni, time is Pratakala is preferred, and Anupana is Madhu and Krita. In Apathya, they say Amla and Lavana rasa should be Varjya. Coming to discussion, Aiskriti is having Katu, Tikta, Kashaya Rasa, Lahu Ruksha, Tikshna Guna. It is Deepana Pachana and Kafa Kleda Medo Shoshana properties. The main action of Aiskriti appears on Vata and Kapha dosha. It specifies Vata and Kapha and it increases Pitta. Usually Aiskriti is mainly used in Kerala for the treatment of hemorrhoids, urinary disorders, skin disorders, leukoderma, worm infestations, anemia, irritable bowel syndrome, loss of appetite, malabsorption syndromes, and obesity. Aiskriti is commonly indicated in Kushta, Prameha, and Pandu by all the acharyas. Aiskriti is kept in heap of yava to facilitate easy and early fermentation. While mentioning Avaleha form of Aiskriti by the name of Lohadi Rasayana, Acharya Charaka had stated that it is not restricted only for iron. The procedure can be implemented for even gold, silver, copper, etc., other metals. Since metallic drugs cannot be administered internally in their original form, it was the step taken by our acharyas in bringing a metal to a form in which it is rendered fit for consumption. The general dosage which is in clinical practice is for children it is 2.5 to 10 ml, adults 10 to 30 ml, and maximum possible dosage is 60 ml per day in divided doses. Twice a day with equal quantity of water, and it is mostly preferred to take immediately after food. And some of the articles which mentions about Aiskriti are a comparative pharmaceutical analytical study of Sushrita Loha Aiskriti and Loha Bhasma had been done. That is comparison between Loha Aiskriti and Loha Bhasma, as both are metallic administrations. Here they conclude that the study of XRD of Loha Aiskriti and Loha Bhasma value of Fe is present in the elemental form along with other form of oxides. It also proves that Loha Aiskriti also passes Ayurvedic Bhasma Pariksha. This is very important to know that even Aiskriti will pass the Bhasma Pariksha. Second article where it is clinical studies conducted on Madhumeha, that is type 2 diabetes mellitus, which concludes that there was a significant improvement in subjective and also in objective parameters, that is FBS and PPBS before and after treatment of Madhumeha. These are the articles referred and which shows the importance of Aiskriti. Thank you.
Next, I would like to invite Dr. Bhakti Sevan for the paper presentation. Dr. Bhakti. Okay.
Hello.
Hello.
Yes, sir.
Okay, doctor. Please share the screen, doctor. You are audible, doctor.
Okay, sir.
Hello, doctor.
Yes.
Doctor, you have any problem with screen sharing, doctor?
Yes, sir. Actually, I'm sharing the document, but unsupported document type.
Okay, doctor. I will share for you, doctor.
Okay, sir.
Please chat, doctor. Is the screen is visible, doctor?
Yes, sir.
Please chat, doctor.
Okay, thank you, sir. Good evening, everyone. Myself, Dr. Bhakti Sawant, second year PG scholar, Dravaguna department from Ayurveda Mahavidyalaya Science. The topic for today's presentation is Ekal Dravya Chikitsa in Rakta Pradara. In Ayurveda, Asrikdar is a clinical condition mentioned in Yoni Vyapat Adhyay of Charak Sahita in 38th chapter. The word pradara, that means pradiryate iti pradaraha vistarito bhavati. Asrugdiryate yasmin niti asrugdaraha. Mentioned in Charak Chikitsa 30th chapter. According to Acharya Charaka, due to the pradiran, that is excessive excretion of Raja, it is known as pradar. According to Chakrapani Tika, there is Dhiran of Asrik, hence Asrikdar. In such case, normal menstruation pattern is altered in reference of duration, color, amount, cycle, and collectively known as Artava Dushti. Next, going towards the Samprapti. That is the pathogenesis. The Hetu 7, that is Amla, Lavan, Guru, Katu Vidahi, Snigdha, and Gramya Krushara. Hetu 7 takes place. After that, vitiation of Tridosh, particularly the Vata dosh, leads to Agnimandya, Vikrit Ahar Rasa. Rasagni Vaishamya and Vikrit Rasadhatu Nirman takes place. The Rasadhatus Upadhatu, that is Artava, increase due to the Rakta increase. Drava Gun increase in amount by Pitta Prakopa Nidan Sevana. After that, Garbhasha Shetilya affect the uterine vascular apparatus and uterine congestion increase. Uterine circulation due to the vitiated Vyan Vayu. The Apan Vayu Dushti also takes place, leading to excessive and prolonged bleeding, which leads to Pradara. The treatment. Acharya Charaka explained the treatment to be like Rakta Yoni, that is, Rakta Sthapana Aushadhi, after giving the consideration to the association of doshas. The following are the Ekal Dravyas which are to be given in Rakta Pradar. The first one, Ashoka. It is also called as Trimitra. Ashoka is Saraka Ashoka from Fabaceae family. The useful part is bark, Rasa Panchak, that is Guna, Laghu Ruksha, Rasa, Kashaya Tikta, Virya, Shita, and Vipak Katu. The mode of action is due to the Kashaya Rasa, Ashok constricts the blood vessel flowing towards the uterus. Therefore, the bleeding ceases, whereas clade and other secretion decreases accordingly. As the clade decreases, Garbhasha Shaitilya and inflammation gets reduced. The crystalline glycoside substance reported to stimulate uterine contraction. It is first mentioned, the reference of Pradar for the Ashoka plant is first mentioned by Vrunda, and it is also mentioned by Shodal. Shodal has mentioned Ashokasya tvacha rakta pradarasya vinashini. The Amaik Prayog is Kshirapak of its bark in the morning. Second plant, Vasa. Adatora vasica from the Acanthaceae family. Its useful part is Panchang, Gun, Laghu Ruksha, Rasa Tikta Kashai, Viryashi, and Vipak Katu. Tikta and Kashai Rasa, Shita Virya reduces the Tikshna Ushna Gun of Pitta and constricts the blood vessels. Studies on human subjects have shown that the alkaloid vasicine has significant uterotonic activity. The Amaik Prayog is Vasaswaras with honey. The next drug is Priyangu, Calicarpa microphylla from Verbinaceae family. Its useful part is Phalamajja, Gun, Laghu Ruksha, Rastikta Kashai Madhur, Viryashit, and Vipak Katu. Priyangu is madhur, kashai rasa, pungent in the post-digestive effect and has cold potency. The Amayik Prayog is Priyangu Churna with Tandulodak and honey. The Priyangu is also mentioned in Shonita Sthapan Varga Mahakashay of Charak Sahita. The Shonita Sthapan not only stops the bleeding but also increases the Rakta Dhatu. The next drug, that is Lodra, which is also mentioned in Shonita Sthapan Gana. Simplochus racemosa from Simplocaceae family. Its useful part is Twak, Gun, Laghu Ruksha, Rasa Kashai Tikta, Virya and Vipak Katu. Lodra contains Kashai Rasa. Due to this, its formulation made from the bark, and its bark also contains tannin. Lodra is Grahi, Sheet, and Laghu, which itself is a unique combination. The Amayik Prayog is Lodra Churna with Mishri thrice a day for 3 to 4 days. The next drug is Mustak, Cypress rotundus from Cyperaceae family. Its useful part is the rhizome, Gun, Laghu Ruksha, Ras Tikta Katu Kashai, Virya Sheet, and Vipak Katu. Kashai Ras, Shita Virya reduces the Tikshna Ushna Gun of Pitta and constricts the blood vessels towards the uterus. Amayik Prayog, 20 rhizome in milk and water, boil it up to the water content vanishes, sieve it and consume for 4 to 5 days. Next drug is the Mocharas, which is also mentioned in the Shonita Sthapangan of Charaka. Latin name is extract of Bombax malabarica from Bombaceae family. Useful part is the Niryas, Guna, Laghu Snigdha, Rasa Kashai, Virya Sheet, Vipak, Madhur. Mocharas is hemostatic agent due to its Rasa Panchak and chemical constituent tannin. Amayik Prayog is Ghrita Sendav Siddha Chalmali Pushpa. The next drug is Nakkeshar, that is Mesua feri from Gatiferi family. Its Upyoktanga, that is useful part, is Pumkeshar, Guna, Rukta, Tikshna, Laghu. Hello? Hello?
Please continue, doctor.
Please,
Yes. Rasa,
please
Tikta.
speed up, doctor.
Yes. Virya, Ishata, Ushna, Vipak, Katu. Nakkeshar has astringent taste with Ishata Ushna. It is Laghu Ruksha in nature, so it acts as hemostatic by constricting the blood capillaries and prevents the bleeding. Nakkeshar Churna with Mishri and butter is its Amayik Prayog. Next is Bhumyamalaki, Phyllanthus urinaria. From Euphorbiaceae family, its useful part is Panchang, Gun, Laghu Ruksha, Ras, Tikta Kashai Madhur, Virya Sheet, and Vipak Madhur. It has astringent properties, so improves the uterine tonicity, and Shita Virya, which reduces the blood flow and acts as Pitta Shamaka, and Deepanapachar property corrects the metabolic disorders of body. Chandan, Santalum album, Santalaceae family, Laghu Ruksha Gun, and Tikta, Shita, Vipak Katu. Due to its Laghu Ruksha Gun, Shita Virya, it leads to the constriction of blood vessels towards the uterus. Chandan Churna with Tandulodak honey and ghee is useful. Next is Daru Haridra, Berberis aristata from Berbidaceae family. Useful part is root, bark, fruit, rasanjan, ras, tikta, virya sheet, and vipak katu. The whole of the Daru Haridra plant is Ushna Virya except the fruit and the rasanjan, which is sheath in nature. Tikta ras, Shita Virya, and Ruksha Guna reduces the Tikshna Ushna Gun of Pitta and constricts the blood vessel. Its Amayik Prayog is it with honey. Thank you.
Thank you, doctor.
Next, I invite Dr. Amol Shivajirao Patil for the paper presentation. Hello, doctor. Dr. Amal S. Patil. Doctor, we can't hear your voice, doctor.
Hello, sir.
Yes, doctor. Now clear, doctor. Please share the screen.
Okay, sir. Okay, sir. I can share my screen.
Okay, doctor.
Okay. Now, hello.
Your screen is visible, doctor. Please start, doctor.
Okay, sir. Good evening, everyone. My name is Dr. Patil from SMBT Ayurvedic College, Nashik. Today, I present you the management of rectal prolapse, that is Kudu Brahmasha through Kshar Karma. It is a case study. My guide is Dr. Shilpa Bade, ma'am. First, we take the introduction about the rectal prolapse. Gudronsha, which is known only as rectal prolapse, is a condition where the rectum protrudes beyond the anus. The exact cause of rectal prolapse is unclear, but it is a predominant, female gender. Most of the one people having constipation, previous and rectal surgeries, etc. Both partial and complete varieties of rectal prolapse are extremely debilitating because of the discomfort of the prolapsing mass and variety of symptoms like rectal bleeding, intermittent constipation, or fecal incontinence. Although diverse models of surgical management of rectal prolapse are present, no single optimum procedure is provided, and the choice of operation is determined by the patient's age, sex, degree of incontinence, operative risk, as well as by surgery experience. In Ayurveda, Gudu Brahmasha, which is rectal prolapse, is explained by Acharya Sushruta under Kshudra Rogas, which is a minor disease and has elaborated its conservative management very beautifully. In this case, a female patient with partial rectal prolapse was treated with a Kshar application and managed without complication. So Kshar application can be safe and effective alternative for the management of rectal prolapse. Chief complaint, a female patient of 40 years, housewife from Hassan, Karnataka, came to our SMBT Institute College Ayurveda Hospital, complete mass per rectum since 1 year. So history of present illness is, according to the patient, she was apparently healthy 1 year back, and then she felt something protruding out from the rectum while staining during defecation. It was painless, but was occasionally associated with streaks of blood. The mass of rectum was very often self-reducing in nature, requiring manual reduction rarely. She was also suffering from intermittent constipation and tenesmus. Treatment histories, she consulted some nearby house practitioner and some complained and was under the over-the-counter hairwire laxatives. It reduces the complaints of intermittent constipation, but the protrusion of mass was the same or even increasing. Personal history, the appetite of the patient was good. The bowel constipated intermittently and bladder habit was regular. The patient used to have sound sleep, and the patient didn't have any habit of alcohol consumption or smoking or tobacco chewing. Examination of patient. The patient blood pressure is normal, 130 by 80 mm per Hg on supine position. The pulse rate is 76 per minute. The patient had mild pallor, no icterus present, no lymphadenopathy, no cyanosis, no clubbing, no edema, no dehydration. Per abdomen, CVS, RS, CNS are normal. Local examination, inspection on different position, no absence infected. On staining, small circumcision mucosal protrusion present. These are pictures of the patient. Kshar application. Diagnosis, we go to the diagnosis. Partial rectal prolapse is present. Treatment. After all laboratory investigation and pre-operative evaluation, Kshar Karma, it's like a chemical cautery with using of Apamarga Pratisarniya Kshar was planned for the patient. So we go to the procedure. First, we take the pre-operative procedure, keeping the patient NBM for 6 hours before prior to surgery. Written surgical consent, written anesthetic consent. Part preparation is done. Injection tetanus 0.5 cc intramuscular stat. Injection lignocaine 0.2 cc intradermal stat. Proctolysis anyway done. On the intraoperative procedure, under SA, patient taken on lithotripsy position, painting and draping done. Slit Proctoscopy and application of apamarga pratik shar on the anal and rectal mucosal circumferentially extending from the mucocutaneous junction outside to 1 centimeter above the anrectal junction. After 100 seconds, the part applied with the shar become dark, just like a jambupala sadrisha, and then it was gently washed with the limbu or fresh lemon juice. The same procedure was repeatedly circumferentially until the anal mucosa was applied. Anal pack of gauze. After it, anal pack of gauze soaked with estemudu taila, which applied, dressing the wound done, and patient shifted to post-operative ward. So we go to the discussion. Rectal prolapse is basically treated by surgery. There are diverse surgical options for the management of rectal prolapse, indicating that the present etiology and treatment guidelines have not been clearly established. Among the surgeries for rectal prolapse, perianal approaches has higher recurrence rates, which is like 5 to 21%, and reduced the improvement of fecal incontinence, whereas abdominal approaches are accompanied by significant incidence of perianal adhesions, longer recovery time, greater morbidity, and possible complete sexual function. In Ayurveda, Acharya Sushruta has proposed the line of conservative management as repositioning of the prolapsed rectum after mild sedation and anal application followed by mechanical support for the anorectal region by special leather bandage, which is called a Gopana Bandha. Sushruta also stresses of Vata elevating treatments, especially Apana Vata, through the local and oral use of Mustikadi Tail. Sushruta also explained the surgical management of Buddha Bhasma by the application of Shar Karma. Shar application is proposed to induce aseptic fibrosis of the anal mucosa and adhesion is properly. During the wound healing process, it causes citration and strengthens the anorectal ring. In this case, the symptoms of the patient which were present before treatment were markedly reduced at the 7th post-op day. Chief component of mass per rectum was not present. Unlike other symptoms, mucous discharge was not completely reduced. But up to 7th day, it is after Matra Basti was continued and the complaint was absent after 1 month of surgery. Conclusion, Sushruta also stresses on Vata elevating treatment. Unlike the other symptom, mucous discharge, conclusion, rectal prolapse is very debilitating condition which lack exact management guidelines. Differential surgical procedures have different disadvantages. Shar Karma, which is chemical contraction, has been very beneficial on the management of rectal prolapse. Owing to the post-operative symptoms and complication to as the parental cases, it can be done under local anesthesia as a daycare surgeries, and it is very cost effective. So Shar Karma can be boon for the management of rectal prolapse. Thank you, sir. Hello.
Thank you, doctor. I think today's presentation seems to be over.
Yes.
I would like to invite Dr. Aishwarya to conclude the session.
Thank you, Dr. Sabin. So, dear participant, it's an end of today's presentation, and let me congratulate all our participants for their wonderful presentation. And on behalf of Ayurapta, I'm taking this opportunity to express my sincere gratitude to our panel members. Tomorrow will be the final presentation. Till now, good night.